Preliminary budget hearing for the Committee on General Welfare. Please silence all cell phone electronic devices. Moving forward, no one is to approach the dais. There is no food or beverage in the chambers. If you wish to participate in today's hearing, please fill out an appearance card with the Sergeant at Arms. Any other questions, reach out to us.
Thank you for joining me for the fiscal 2027 preliminary budget hearing for the General Welfare Committee. We'll hear from two agencies, the Human Resources Administration, HRA, and the Department of Homeless Services, DHS, testifying under the umbrella of the Department of Social Services, DSS. The city's proposed fiscal 2027 preliminary budget totals $127 billion, of which $19.26 billion, or 15.2%, funds DSS, making the second largest agency budget after DOE. This encompasses $14.62 billion for HRA and $4.63 billion for DHS. DSS serves some of the most vulnerable populations in the city, and these services are more vital now than ever. There were notable changes made in the preliminary plan for both agencies. HRA saw $2.63 billion in new needs, which are largely city-funded, added in fiscal 2027. The majority of that funding is going towards fully funding the baseline for city FEPS and cash assistance, which the council has long pushed for. I was very happy to see the preliminary plan increased baseline funding for Community Food Connections, HRA's food pantry support program, to $74.5 million in fiscal 2027 and the out years. DHS has had $935.8 million in city-funded new needs in fiscal 2027, including baseline funding increases for shelters and street homeless outreach. Street homeless individuals are amongst the most vulnerable New Yorkers, and the precarity of their situation only grows as climate change makes extreme weather more common. I look forward to working with the administration on effectively addressing the needs of this population while maintaining a balanced budget. I'm particularly concerned about DHS's high vacancy rate, which was 27% as of January. DHS cannot adequately perform its responsibilities without the social workers and administrators required to operate its shelters and intake sites, or those doing outreach on the streets of New York in Arctic temperatures. It must prioritize hiring vacant positions and reducing its attrition rate. I'm also concerned that the recent mandate for agencies to reduce half their vacancies will impact DHS's ability to maintain its current level of services at a time when they are more needed than ever. I'm concerned that the recent mandate for agencies to reduce half their vacancies will impact DHS's ability to maintain its current level of services. Savings mandate, coupled with the current federal funding threats, places DSS in a more vulnerable position. Under prior administrations, savings mandates have included exceptions made for frontline workers and other essential staff that support shelter and benefits assistance programs, which make up much of DSS's staffing. I'm also concerned about the areas where the budget does not adequately support the essential programs administered by HRA and the necessary level of staffing required to provide clients with services in a timely manner. While HRA has made headway on their backlog of SNAP and cash assistance applications, denial rates have increased, which is troubling. We have still been hearing that it is very difficult to get through to HRA by phone and that clients are experiencing very long wait times at HRA centers. H.R. 1, the major federal spending bill passed by Congress last year, reduces federal support for administrative and benefit costs of SNAP. New York State may choose to pass on a portion of these costs to the city, directly impacting HRA's expense budget. While the preliminary plan adds 183 SNAP eligibility specialist positions with an aim to improve the city's SNAP payment error rate, there is a growing concern over staff retention and lack of institutional knowledge, which both have a direct impact on agency operations, client service, and benefits processing time. The changes to SNAP from H.R. 1 not only impact the city's expense budget, but also would impose a greater burden on individuals and families in need in a city where 1 in 5 New Yorkers are receiving SNAP benefits. While the budget maintains the essential benefits programs administered by HRA and the shelter programs administered by DHS, we need to think more deeply about where we can most effectively allocate our limited city resources, especially during these uniquely challenging times. DHS's shelter census continues to grow. At the end of February, there were over 85,000 individuals in DHS shelters, nearly a third of them asylum seekers. While shelter exits to permanent housing did increase in fiscal 2025, So did the shelter census, and the process for subsidized housing placements must be accelerated in order to significantly decrease the number of people living in our city's shelter system. Programs such as City FEPS are more important than ever and the best way to move long-term shelter residents into stable, permanent housing. However, this program suffers from numerous process bottlenecks on top of the difficulty of finding affordable housing in a very expensive city. In today's hearing, we would look forward to discussing adjustments made in the preliminary plan, staffing for benefits administration and shelters, SNAP cost risks and cost shifts as a result of H.R. 1, and the metrics included in the fiscal 2026 preliminary mayor's management report. It is the council's job to carefully review the budgets and operations of city agencies to ensure that we are good stewards of public dollars and that we are providing our city's most vulnerable residents with the services they need. This is a job I take very seriously. Before I welcome the commissioner, I would like to acknowledge my colleagues who are here today, Council Members Ung, Sanchez, and Morano. Finally, I would like to thank the General Welfare Committee staff for their work on preparing this hearing. Fariha Rahman, Financial Analyst, Elizabeth Childers Garcia, Financial Analyst, Julia Haramis, Assistant Director, Aminta Kilawan, Assistant Deputy Director, Panina Rosenberg, Senior Policy Analyst, Justin Campos, Policy Analyst, and my Chief of Staff, Andrew Wright. And now, Commissioner Dalton, our council will swear you in.
Now, in accordance with the rules of the council, I will administer the affirmation to the witnesses from the mayoral administration. Would you all please raise your right hand? Commissioner Dalton, do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee and to respond honestly to council member questions? HRA Administrator Scott French.
I do.
DHS Interim Administrator Christine Fellini. DSS Chief Program Performance and Financial Officer Richard Johns.
I do.
And DSS Chief Strategy Officer Chris Gonzalez. Thank you. You may begin when ready.
Good morning. I want to thank Chairperson Hudson and the members of the General Welfare Committee for holding today's hearing and for the opportunity to testify about the Department of Social Services fiscal year 2027 preliminary budget. My name is Erin Dalton, Commissioner of New York City's Department of Social Services. DSS is made up of both the Human Resources Administration, HRA, and the Department of Homeless Services, DHS. So accordingly, I'm joined by my colleagues, HRA Administrator Scott French, DHS Interim Administrator Christine Fellini, as well as DSS Chief Program Performance and Financial Officer Richard Johns, and DSS Chief Strategy Officer Chris Gonzalez. Collectively, we represent the approximately 14,000 hardworking staff who dedicate their lives to supporting New Yorkers living at or below the poverty line. Before I begin, I would like to share my excitement and gratitude in assuming the position as Commissioner of DSS. In my former post as the Director of Allegheny County, Pennsylvania, that's Pittsburgh, Department of Human Services, I was focused on strengthening families and communities through a broad network of community-based programs that prevent harm and address critical needs in housing and homelessness, in senior services, child welfare, behavioral health, and developmental supports. I look forward to working in partnership with Speaker Menon, Chair Hudson, and the rest of the City Council to deliver the vital benefits and services to the city's most vulnerable populations. Today, I will provide an overview of the FY27 preliminary budgets for both agencies and highlight the programs and services supported by those resources. DSS is the largest local government social services agency in the country, comprised of the Human Resources Administration, HRA, and the Department of Homeless Services, DHS. The consolidated management structure and shared vision of DSS together provide an integrated continuum of client services to over 3 million New Yorkers every day. Our efforts to create a financial path to financial and social sustainability for low-income New Yorkers are rooted in the following 3 pillars. First, streamlining access to social services. Second, addressing homelessness and housing instability. And third, creating economic stability. We will refer back to these 3 pillars throughout our testimony. I will begin by providing an overview of the HRA, DHS, FY27 preliminary budgets. HRA is dedicated to fighting poverty and income inequality, providing essential benefits including cash assistance, nutrition and food programs, public health insurance, employment and transportation services, as well as access to housing, homeless prevention, and emergency assistance. HRA helps more than 3 million New Yorkers annually through the administration of more than 15 major public benefits programs with a budgeted headcount of approximately 12,500. The FY26 budget for HRA is $14.2 billion, including $11.3 billion in city funds. The majority, over 70%, HRA city funds budget is earmarked for benefits that the city administers on behalf of New York State. Almost 98% of HRA city-funded budget provides direct benefits and support to actual New Yorkers, including first, cash assistance benefits for which benefit levels and eligibility rules are set by state law and regulation. Second, Medicaid, which includes home care, managed care, mental health, substance use services, and hospital care, and is also administered by the state, though the city pays a portion of Medicaid costs out of the city funds, representing 56% of the city-funded budget, and HRA sends these funds directly to the state to be used alongside other state and federal funds to pay medical providers and managed care plans. And third, the remainder of the budget, 16% goes to public assistance, 17% to rental assistance and homelessness prevention, 2% for administration, 3% for legal services, 2% for HIV/AIDS administration, or HACA, and 1% for employment services, community food connections, domestic violence services. HRA also administers the SNAP Supplemental Nutrition Assistance Program for 1.7 million clients. These federally funded benefits, which are about $5 billion a year, do not flow through our budget, but they represent another critical benefit that HRA is mandated to provide. HRA also administers another over $50 billion in state and federal funds supporting NYC Medicaid clients, which are not part of the city budget. Also note that the DSS budget for administration covers shared services for both HRA and DHS. Now I will provide an overview of the DHS budget. DHS is committed to providing safe temporary shelter, connecting New Yorkers experiencing homelessness to permanent housing, and addressing unsheltered homelessness. DHS has an FY26 budget of $4.4 billion, of which $3.5 billion is city funds. The agency has a headcount of approximately 2,200, and with its not-for-profit partners, is the largest municipal organization to addressing homelessness in the United States. Almost 97% of the DHS budget supports shelter for families and individuals and services for the unsheltered, including outreach and low-barrier beds. The DHS budget is broken out as follows in FY26. $1.3 billion for adult shelter, $1.27 billion for family shelter, $456 million for street outreach services, and the remaining 4% is for general administration. In the FY27 preliminary budget, this administration is continuing to make investments in our critical programs with over $3.1 billion added in baseline funding, including for the City FAPS rental assistance program, cash assistance, DHS shelters, food assistance programs, affordable housing services, additional services to support New Yorkers experiencing street homelessness, and support for our nonprofit partners. As I've highlighted in my testimony, DSS, HRA, and DHS budgets are significantly reliant on federal dollars, and importantly, the 3 million people we serve rely on those benefits from the federal government. Enacted in July of 2025, the Federal Budget Reconciliation Bill, known as H.R. 1, significantly changed both SNAP and Medicaid in ways that will directly affect New York City residents who rely on these programs to meet basic needs. The law expands work requirements for SNAP and Medicaid, increases administrative reporting requirements, and reduces federal funding while shifting more costs to the states. As a result, many eligible individuals will lose access to food assistance or health care coverage due to stricter eligibility rules or paperwork barriers rather than changes in income or need. For a city like New York, where millions rely on SNAP to afford groceries and depend on Medicaid for health care, these changes will increase food insecurity, lead to loss of health coverage, and place additional strain on local safety net providers such as hospitals, community health centers, and food banks. Under H.R. 1, the definition of able-bodied adults without dependents, or ABODs, in SNAP expanded from ages 18 to 54 to ages 18 to 64, and now applies to adult without a child under age 14, where it had previously been 18. The law also removes several exemptions, including for veterans, people experiencing homelessness, and young adults who aged out of foster care. ABODs must complete at least 80 hours of training, 80 hours per month of work, job training, or volunteer activities to receive SNAP for more than 3 months in a 3-year period. New York had a statewide waiver from ABOD for the time limits for many years, but that waiver expired February 28th, 2026. The new rules took effect March 1st, 2026, when ABODs in New York City began needing to meet the 80-hour monthly work requirement. The 3-month time limit clock began March 2026, meaning individuals who do not meet the requirement could start losing SNAP benefits in June 2026 after their 3 allowable months. Since the passage of H.R. 1, HRA has embarked on an aggressive outreach campaign to raise awareness of the impending impact of these new rules on SNAP recipients in New York City. Along with repeated direct outreach to the almost 120,000 identified clients, we have conducted dozens of information seminars and trainings to community organizations and partners, including elected officials. We have also amplified awareness through a variety of public media outlets to ensure clients have ample opportunity to connect with us to mitigate any impacts of the new eligibility criteria on SNAP recipients. If you or anyone you know is a SNAP recipient and has not yet engaged with HRA, please encourage them to connect with us immediately through Access HRA. Turning to cash assistance, in the preliminary budget, FY26 budget for cash assistance is $2.76 billion to support a caseload of 595,000 recipients through June 2025. HRA issued emergency rep payments to cover 52,000 households in FY25. Along with SNAP and cash assistance, HRA continues to support New Yorkers with other key benefits, including, but certainly not limited to, Medicaid, fair fares, and HEAP. With regard to Medicaid, I cannot stress enough the automatic Medicaid extensions have ended. Clients must recertify in order to keep their health insurance. We are working to ensure that everyone who remains eligible for Medicaid receives ongoing benefits. Please continue to remind all of your eligible constituents to renew. In collaboration with Council, we expanded fair fares eligibility to 150% of the federal poverty level in 2025. There are currently 389,400 New Yorkers enrolled in the Fair Fares program. Please continue to encourage New Yorkers to submit for benefits as soon as possible. With regard to HEAP, DSS continues its collaboration with the state to provide heating and cooling benefits to New Yorkers. In 2025, over 900,000 New York City households received HEAP heating and/or cooling benefits. Keeping New Yorkers in their homes, moving families and individuals out of shelter, and helping these households remain stably housed are all primary goals for the agency, and now I want to talk about our progress in these areas. First, I would like to provide a quick update on our DHS shelter population. As of March 6th, the overall DHS census was 85,471 people. Of the 85,000, approximately 55,000 are families made up with children and their adult parents and caregivers. And children make up 35%, or more than a third, of all the people in shelter. The remaining population are made up of adult men, about 18,000, single women, about 7,000, and adult families, 4,900. In New York City, 97% of people experiencing homelessness are sheltered, but that 3% is an area of particular focus. DHS continues to aggressively expand low-barrier bed capacity, which are shelter types targeted to those experiencing unsheltered homelessness, like safe havens and stabilization beds. As of March 2026, DHS had a total of 4,290 low-barrier beds online, 300 of which Mayor Mamdani accelerated to be available during the recent cold snap. We expect an additional 350 safe haven beds to come online before the end of the year. In conjunction with these low-barrier bed contributions, on February 18th, Mayor Mamdani announced a revised unhoused encampment response policy that shifts primary responsibility for encampment engagement for those experiencing unsheltered homelessness from NYPD to the Department of Homeless Services. Under the new protocol, DHS is now the lead agency responsible for issuing notices, conducting outreach, and offering placements, with DSNY conducting cleanups and NYPD present only as needed for safety support. The policy emphasizes daily outreach during the notice period, with DHS teams returning consistently to offer shelter placements, safe haven beds, and connections to services. The administration has committed approximately $30 million in baseline funding for DHS outreach expansion and $11.9 million for NYC Health and Hospitals to support increased street medicine and behavioral health engagement. This includes 66 additional DHS staff, which will be primarily outreach workers, expanded street outreach and wellness units, show units, and an additional bridge to home site for individuals with serious mental illness. DSS remains committed to connecting New Yorkers to permanent housing and keeping them stably housed. DSS has seen record increases in the number of permanent housing placements. In calendar year 2025, nearly 17,000 households comprised of nearly 36,000 New Yorkers were able to obtain permanent housing or stay in their homes using CityFEP's vouchers, reflecting a 17% increase year over year. Through our home-based homeless prevention services, more than 20,000 households or 52,000 New Yorkers remained in their homes, and more than 13,000 households or 33,000 New Yorkers received aftercare from home-based to keep them stably housed. Now for the Now for the third pillar, creating economic stability. We recognize that more and more New Yorkers rely on our city's resources to make ends meet. In addition to the public benefits, rental assistance, and other essential resources we offer to help get people back on their feet, HRA, career services, and other supports enable New Yorkers to secure steady income and live sustainable lives. A good paying job is a key component to a stable, economically independent life, and HRA offers a wide array of career services programs to help low-income New Yorkers find and obtain a career that works for them. In FY25, the agency's career services program continued to raise the bar, helping nearly 22,000 low-income New Yorkers obtain employment. That's an increase of over 170% compared to FY24 and the most placements since the onset of the COVID-19 pandemic. Additionally, 10,500 public benefits recipients were connected to employment through HRA's Business Link Hire NYC program, a 28% increase over the prior fiscal year and a new record for the program. The PINK program, which advances training, education, and job placements, enrolled about 2,400 individuals in construction and industrial training, with 1,330 completion so far. We also have placed over 1,000 individuals to jobs, of which 900 were unionized positions. Going forward, we continued to invest in our career services program. The Pathways for Access to Careers and Employment, or PACE contracts, began October 25 using the centralized No Wrong Door program model with locations throughout the boroughs. These programs first streamline and minimize travel burdens, maximize access to all employment support and services, and foster strong client relationships. Second, establish an in-demand, occupation, and sector-focused approach that connects clients to skilled professions that offer family-sustaining wages. And third, utilize labor market data to assist clients in gaining marketable skills for success and advancement in their careers. And lastly, streamline process for vendors offering a hybrid approach to engaging clients. I will close by underscoring our ongoing commitment to break down government silos and improve access to services. The challenges that DSS, HRA, DHS work to confront bridge across agencies and further bridge across jurisdictional boundaries. Overcoming these kinds of challenges goes to the heart of creating the kind of caring, compassionate communities we seek to live in. We appreciate the opportunity to testify today, and we welcome any questions you may have. Thank you.
Thank you so much, Commissioner, and I would like to officially welcome you to your role. We're excited to have you and look forward to your leadership. I'd also like to state for the record that we've been joined by Councilmember Mealy. Okay, so we'll get right into it. On January 29th of this year, the mayor issued an executive order requiring every agency to appoint a chief savings officer. The order required the CSOs to identify city funds savings of 1.5% in fiscal 2026 and 2.5% in fiscal 2027 at all mayoral agencies. Under prior administrations, there have been exceptions made for frontline workers and other essential staff that support shelter and benefits assistance programs, which make up much of DSS's staffing. Are any programs or aspects of HRA or DHS's budgets exempt from this requirement? And if so, which ones?
I will be relying on my colleagues here as just a note to note the second week on the ground in the job. So I'd love to turn that over to Chief Johns.
Yes, thank you. Yes, the calculations for the targets does exclude critical and essential, also mandated programs. So, we're still working out the exact targets, but for the most part, I shouldn't say that. In its entirety, and as the mayor announced as part of the initiative, no services will be cut.
Okay, no services will be cut. Could you share which programs and services specifically that may be, or you're saying
Yeah, I mean,
all
it's-
of them?
it would include things like cash assistance, SNAP, the city's contributions for Medicaid, and all of those like sorts of mandated programs.
Okay, great.
I don't have the exact information in front of me, but we'll certainly, we expect to submit this on the 20th. We will be on time, we will meet the targets, and we'll be able to share at that time.
Great, thank you. The agencies were also instructed to provide a plan to eliminate half of all existing vacancies. As part of this mandate, agencies were required to determine which positions would be retained and which removed from the baseline budget prior to the release of the executive plan. Currently, while HRA and DHS have the highest vacancy rates seen since 2023, at 13.5% for HRA and 27% for DHS, there's still a need for increased staffing for direct client services, especially related to the administration of benefit programs. Will HRA or DHS be required to eliminate any of its vacancies, and if so, how many and for which types of positions?
Yes, I'll go ahead and take that one as well. Thank you for that question. Like the savings proposals, not all positions will be subject to the 50% reduction. We are, again, working very closely, and we really value our partnership with the Office of Management and Budget to ensure, here again, that we're minimizing impacts and ensuring that New Yorkers don't lose access to vital services. So yes, we will be reducing some number of our vacancies. It will be 50% of those eligible positions, again, which we're working out. Though,
You said it will be 50% of eligible positions?
yes, it will be, but again, it's not going to be all city-funded positions. We are working very closely with OMB to determine which positions will be impacted. Again, the positions that are in mandated programs will largely be exempt.
Do you know which programs?
Again, that I don't have with me, and I don't think we've fully decided which programs will be exempt, but things like, where you see city-funded positions in things like SNAP or cash assistance or Medicaid, entitlement programs, those positions should largely be exempt.
Okay. Thank you. Let's move to HR 1, SNAP cost shifts. So HR 1 reduced federal support for states' SNAP costs from 50% to 25% starting in October 2026. We know the state anticipates this will result in an additional $204 million in annual expenditure statewide. OTDA has indicated that the state will cover $36 million of this cost and shift the burden for the remaining $168 million to localities, with $111 million shifted to the city. Have you had any conversations with the state partners about the state fully covering this funding in the enacted fiscal 2027 state budget, rather than shifting the burden to the city and localities?
So we are in ongoing conversations with, the state around what would be the plan regarding the administrative cost shift. I don't think anything has been sort of finalized at that point, but we are staying very much focused on also where there are cost shifts, especially around like the SNAP payment error rate that is coming. Internally, we have put into place many things to actually bring that rate down so that we can minimize actually any impacts that may come to the state and or be passed on to the city.
Okay, and so I know you're still working it out, but would the $111 million be an additional amount that needs to be added to HRA's existing budget if the state does not decide to pick it up in the final budget?
Yeah, I'll take that one. Yes, it would be additional money. One thing to keep in mind is that the $111 million that OTDA had announced is in a grant year. So the SNAP administration in DSS's budget is found within both the revenue for SNAP administration and for employment and training. So assuming that the city does have to fund the remaining 25%, we would see a need of about $90 million in our budget. I would just add, there could be other agencies that are receiving SNAP admin. That information I wouldn't have with me.
Okay, and then starting October 2027, under HR 1, there will be a new cost shift to states that could be up to 15% of benefit costs The rate will depend on the state's error processing rate. In an emergency briefing on SNAP federal regulations, HRA indicated that it is anticipating there would be a $1.2 billion additional cost in New York State, which would result in an estimated $705 million in additional cost for the city if the state chose to pass the new benefit cost to the city. Historically, SNAP funding for benefit payments to individuals who reside in the city are dispersed by the state, do not directly flow through the city's budget, and have not required any city contribution. Have you had any conversations with the state partners on this about the possibility of the state covering the additional costs?
Similarly to the administrative rate, we're in ongoing conversations. The state has said that they, would not be able to cover the costs if, based on the payment error rate fully. And so there would be an expectation that some of those would actually have to be passed to New York City and other localities around the state, which is why we're really focused on making sure we can bring that payment error rate down over this current federal fiscal year and get us to a place where we are not seeing a 15% cost shift happen.
And what has HRA been doing to address the high payment error rate?
Sure. So we've been doing a few things we've been working on. First and foremost, we have been focusing a lot on training. As you mentioned in your opening statement, right, over the last several years, we've brought on a lot of new staff. We have been funded by OMB to bring on new trainers who will actually be in the benefit access centers and other centers so that they can do more real-time remediation with staff who may be making some errors that we would like to fix. So that is already ongoing and rolling out. We've made some additional changes as well to our existing systems where we've been able to put in additional flags to workers to ensure that they are following all of the steps they need to, and most importantly, checking calculations, as that's where we're seeing most of our payment error rates are related to, calculations around earned income, which can be complicated depending on, the benefits that someone is working on. And then we're working on some other additional technological work that we think may also create some additional, flags and be able to identify specifically where there may be some mismatch in calculations before someone actually processes a case.
And are the 183 SNAP eligibility specialist positions included in the preliminary plan adequate to address this concern?
Yes, we believe those positions are adequate to address that concern, to ensure we have staff to, work on the payment error rate, as well as the rollout of the ABOD work requirements that is ongoing.
Great, thank you. And speaking of those employment requirements, I have some more questions regarding that specifically. On March 1st, and I'd like to note that we've been joined by Councilmember Brewer. On March 1st, 2026, the new employment requirements for ABODs on SNAP went into effect. Since November of 2025, HRA has been assessing SNAP applications and recertifications based on the new criteria. HRA has also introduced 2 main CBO partnership pathways for clients to meet their new work requirements, with CBOs having the choice to register as a community service partner, CSP, or a self-enrolled voluntary services provider, SEVSP. Since November, how many total SNAP applicants and recertifications were newly deemed ABOD under the broadened federal criteria?
Certainly, thank you. I think when thinking about this, what's important to focus on is actually, because it's a point in time, as to the point in time how many SNAP recipients need to comply with ABOD. So at this point in time, there are approximately 119,000 SNAP recipients who need to comply with ABOD. As part of the rollout of ABOD, we are continuing to reassess individuals at their recertification to determine if actually they would meet the new expanded criteria. It wasn't something that happened all at once. It will happen over the next year, starting November 1st. We will have gotten through everyone in the first round by the end of October. So currently it's 119,000, and we are really staying very much focused on ensuring that we are exempting as many people who are eligible for exemption, and continue to look at ways in which we can streamline the ability for folks to submit documentation so that we can exempt them from this, as we know that is the most important thing. We want to get that number down as much as we can and have as many people off the list who need to comply.
Do you know how many individuals newly deemed as an ABOD attended their initial PACE appointment for career services support and how many did not?
So overall, for all ABODs, because everyone was getting appointments, so I'm going to split it up into two categories. There are SNAP ABODs who are not on cash assistance. We call them NCA SNAPs. There's about 36,000 total individuals who are in that bucket of people. Approximately 11% have shown so far, so that is, a low rate. We continue to do extensive outreach to individuals. We also expected in some place that the show rate, because this would all have been pre-March 1st when actually things go into effect. So we expect to see increases over this month, and we'll be conducting additional outreach for those individuals who are on cash assistance and also need to comply with SNAP ABODs. Those individuals are being engaged through the cash assistance mandatory engagement process, which is slightly different, given cash has some more expansive requirements. On average, each week, we are seeing 55 to 60% of individuals show up for those appointments.
And sorry, what's that total number of cash assistance and SNAP?
Approximately, I believe, 82,000.
Thank you. And you said 55 to...
About 55 to 60% each week are showing up to their appointments. And for cash assistance, we have a ongoing and expansive engagement process where for individuals who did not show up, we have a process to engage them and follow the cash assistance conciliation and sanction process, which happens over several weeks.
Okay, great. Can you walk us through the CBO partnership pathways and how many CBOs have applied to become partners with HRA?
Sure. So I'm happy to say, and also very thankful to the CBO community, that over 100 CBOs have stepped forward, and that number actually increases each week. It is an open enrollment, so there is no deadline. As CBOs learn about it or determine it is something they think they might be able to do, we welcome them to submit the form. And then based upon the activities the CBOs have, and what capacity they have to support, they will either be put into one of the two pathways you had talked about. One of the pathways has a little bit more administrative support that is being brought, where those organizations will receive referrals directly from us, as well as help track compliance and hours and report that into us. On the other pathway, that is more of a connection made between the individual and the organization, most likely an organization they're already connected to. They may attend programming or receive other case management services where they can access volunteer opportunities and then submit to us on a monthly basis, compliance with those volunteer hours.
Great, thank you. Okay, we know that the agency has been warning people who are meeting ABOD work requirements, but the agency will not begin to take negative action until June 2026. Does DSS have an estimate on how many SNAP clients may lose SNAP benefits during the first month when the agency will begin to take action for noncompliance?
We do not have that estimate at the time. We're going to be tracking closely each month to see how many individuals are actually coming close to the 3 months. Because that will really then give us a sense of how many people may be impacted. We'll also be able to really target our outreach and engagement closely, because we'll be able to target specifically the people we know who maybe have had 2 months of non-compliance, so that the third month is really essential. So we're happy to keep the council updated as we see that. The first data that we'll have will be in the very beginning of April, when we see what happened in the month of March.
Okay, thank you. With the reinstitution of work requirements for cash assistance clients, we know HRA has been projecting an increase in the demand for child care vouchers for those who are on cash assistance. As of the recent PMMR, in the first 4 months of fiscal 2026, around 596,000 individuals in New York City are on both SNAP and cash assistance. This roughly represents 1/3 of the total SNAP population. How many HRA cash assistance child care vouchers have been issued this month?
I will have to get back to you on the monthly. I can say, as of right now, there are 30,000 households currently receiving child care vouchers through HRA as part of compliance with cash assistance mandatory engagement.
Okay, so maybe you'll have to get back to me on this one as well then. How many of the vouchers were issued to clients on both SNAP and cash assistance?
I'll have to get back to you on that. I will just clarify the requirement for childcare on the HRA side is connected specifically to cash assistance requirements. There is not mandated childcare required on SNAP. For individuals on ABOD, they would be exempted having children under the age of 14, and on the cash side, childcare is required for individuals who have a child under the age of 14 in the household.
Okay. We know HRA has been rolling out the resumption of work requirements in phases over time. How much growth have you seen since in cash assistance, childcare vouchers since this began, and how does it compare to the level of vouchers seen prior to the pandemic?
I'll get back to you on the level of growth. It is lower than pre-pandemic because we have been slowly rolling out mandatory engagement, and we hadn't actually had mandatory engagement in place for many years during the pandemic. We only rolled out mandatory engagement again last April of 2025, and we've been taking it in a very methodical way. But we can get back to you on the trends that you asked about.
Okay, that would be great. And does HRA anticipate needing more staffing to handle the administration for the projected increase in demand for cash assistance childcare vouchers?
No, at this point, we believe we have appropriate staffing to support that.
Okay. Great. I'm going to pause here and turn it over to some of my colleagues, starting with Councilmember Morano.
Thank you, Chair. Commissioner Dalton, thank you for your testimony. Congratulations on your new role and good luck. You, in your testimony, outlined billions in spending and tens of thousands of placements. The shelter census, as you pointed out, is still over 85,000 people. At what point do we say the current model isn't reducing homelessness and just managing it? And is there anything we as policymakers could be doing to more effectively get people out of the shelter pipeline?
I'll start and then turn it over to my colleagues who will probably have a more informed answer, but I think it's a great question and something I want to understand better. With so many additional exits from the shelter system and perhaps fewer new entrants from asylees, I would expect to start to see declines in the shelter population. It's something, in my first few weeks I want to take a really good look at. I think what we want to do is be moving people into shelter who need it, of course, and then moving them onto permanent housing as quickly as possible. And so I think it's worth a really good look. But if the Administrator Fellini wanted to add anything, please feel free.
Thank you, Commissioner. I would echo your sentiments that we're looking to ensure that we're meeting the needs of those who are coming in and moving them to permanent housing as quickly as possible.
Commissioner, you stated that roughly 98% of spending goes to direct benefits. Does that include shelter costs, administrative overhead embedded in contracts, and hotel placements? I'm wondering if you can clearly define what counts as a direct benefit to a taxpayer.
I will turn that over because I certainly don't know the details of the contracts to nonprofits in particular or to hotels, but I think you do see a very low administrative rate in HRA and DHS. I think the numbers I cited were 4% and 3%. So those being low administrative rates with the vast majority of those dollars going directly to New Yorkers. But let me get my colleague.
Yeah, so the direct benefits there would include things like public assistance or Medicaid, SNAP, and the entitlement programs that the DSS collectively administers. It would not include the shelter costs that you noted.
One final question, if I may. You're expanding low barrier beds and shelter capacity. What specific steps are you taking to reduce demand so communities aren't continuously asked to absorb new facilities? I especially ask because in my district in Staten Island, there are plans for a new facility there.
Again, I'll start and then turn it over. I think it's a great opportunity to talk about our home-based program, which helps to prevent homelessness, and I'll let my colleagues do that. I think that program has been effective. And I think, just like you said, we want to be moving people as quickly as we can into permanent housing. And so the other thing I would just say is all of the other benefits that DSS HRA offer are the kinds of things that prevent homelessness in the first place, right? We want to be able to provide every dollar that New Yorkers are eligible to receive, and with those dollars, they don't have to make choices between healthcare, childcare, and housing. And so making sure we really maximize and do what we can, particularly during this time of HR 1, to keep dollars in the hands of eligible New Yorkers will hopefully also reduce homelessness. But maybe an opportunity to talk about home base a little bit.
Sure, I can take the home-based question. So the home-based program has proven to be very successful in diverting people from shelter. Every year it's about 95% of those who engage with home base do not enter shelter. Last year they served approximately 32,000. We are definitely looking at ways in which some of the activities home base currently does with households to bring some of those back into HRA, right? Home base has definitely taken on a lot of work around subsidies and subsidy management and some other complex cases that we've created a new unit in HRA so that we can handle more complex cases and they can serve more people in the community. And so we're finalizing some of those plans so that will continue to increase home base's capacity to serve people, in community and divert them from shelter.
And let me also ask my colleague at DHS to talk about the diversion programs we have there as well.
Thank you, Commissioner, Administrator, and Council Member for the question. Our approach at DHS always is to explore all diversion options, right? So if somebody comes to us, they're in a housing crisis, they're in a emergency situation. So we first want to understand what that is and what options they have. The first step is not always placement into shelter. It's to explore all options.
Thanks very much.
Thank you, Councilmember. I'd like to announce that we've been joined by Councilmember Nurse as well, and turning it over to Councilmember Sanchez.
Thank you so much, Madam Chair, and good morning. Congratulations, Commissioner, on your appointment. I look forward to working with you. I want to just ask a few questions about City FEPS. City FEPS is one of the most effective tools that our city has to stabilize families, which is why this council passed and then overrode the previous mayor's veto to expand eligibility of the program. Even as those conversations continue between the administration, Mayor Mamdani committed as a candidate to release, or I don't know, that's not the right word, but to let go of that lawsuit, and I want to, just park that conversation, except to say that that is the bills that we pass and the expansion that we legislated is very important to this council, and I want to make sure that we are honoring the original intent of that legislation. But even with that aside, this budget, the mayor has and the agency has increased funding for the existing program, $711 million more in 26, $1.64 billion more in 27, growing to $2.6 billion in 2030 for the City FEPS program. Can you help us understand just break down the costs of this program for us? What rent levels is the city seeing most commonly used with the voucher? Can you follow up with a chart and just data that can help us understand what rents we're covering, what rent levels we're covering? And can you help us understand the cost drivers? Thank you.
Yeah, thank you for that question. I can take that. So in the latest PMMR, we reported that the average subsidy for City FEPS is $1,908. This is a newly released statistic. Generally speaking, for City FEPS, just like any other rental assistance program, the cost drivers for the program are the number of individuals that are entering the program, the number of individuals that are leaving the program, and how long they stay within that program. There's also a component that is rent, as you've noted, and there we follow the payment standard as set by the New York City Housing Authority.
So what are we seeing? What are we seeing in terms of number of individuals entering, leaving, and staying, lengths of stay? I'm sorry, Chair.
Oh, yes, I'm sorry. The program in total enrolls about 68,000. So What I have here are the new enrollments for fiscal year '25, which was about 15,000 new enrollees over that fiscal year.
And how does that trend? What are we projecting?
That is a pretty consistent number. So we are projecting the growth to stay fairly consistent over the period of the plan.
So 68,000 people per year, families per year?
No, I'm sorry, 15,000 new families per year.
No. And how long are people staying enrolled?
You know, that I don't actually have available, but we can get back to you with that number.
Okay, thank you. Just to say that the council has, for many years, been asking many questions about the cost drivers and lengths of stay, rent levels, and all of that. Happy to see the new statistic in the PMMR. But we want to be a partner in understanding what the cost drivers are and identifying solutions to contain the cost so that we can reach more families. Thank you, Chair.
Thank you so much, Councilmember. Councilmember Brewer, followed by Councilmember Nurse.
Thank you. Congratulations, Commissioner. We also like Scott French very much. 24/7, calling him, 2 o'clock in the morning, no problem. I teach at Hunter College, and this morning I was there, and somebody apparently has an idea about putting algorithms, this is about SNAP, algorithms on persons who are caught up in this Trump hell. And so you would be able to contact them more easily on their cell phone. $25 million to be saved. So I am going to send you this proposal. Another professor gave it to me. Is that something that you're aware of? Are you using technology to help people not get caught up in Trump hell?
Yes, we are using technology, though I'm very interested in reading that proposal. You know, in regards to communications, right, we are pushing out also, you know, text messages, push notifications. We're going to be rolling out robocalls and other things directly to individuals who need to comply with the ABOD requirements, and always willing and open to look at other utilization of technology to make sure people have the information they need. And we're also making it as simple as possible for them to report to us any information they need to so that we can ensure that they are remaining compliant and keep their SNAP benefits.
Okay.
Just one thing to add, and Administrator French talked about this a little bit in some of his answers, but I think it requires sort of a whole of government effort to make sure we're A, reaching out to people, and B, exempting people where we can. Most of the people on SNAP who aren't already working are exempt from working. And so if we can make sure we understand their eligibility, any challenges they may have in working, we can exempt them forever, and then they don't have to go through the onerous processes designed to get people off of benefits.
I know. I mean, you don't know me. I've been doing this work since 1978, and since then, people don't pay attention to anything. So it's hard. They just don't. They are in another world. So the more that you can tell them in 10 times, I just think this technology might really help. Number 2, just sweeps. I know Scott knows I'm working on this, a lot of encampment. People are difficult. They just like to stay out. So I'm just wondering how many encampments have you, obviously I know the mayor had a position not to move them, but I know that, you know, in some cases you just have to. So, and again, some people just don't want to go to an apartment. They just want to be out. But my question is, how many people have you moved? Were you able to get them shelter? How are you identifying encampments? I know they're not supposed to be called encampments, but that's what I call them. And I just want to know, just generally, how you're handling them and what the numbers are.
Sure, I will start and then pass to Administrator Fellini to provide some of the details. So as you know, this administration has asked the Department of Homeless Services to take the lead in engaging with people staying on the street, in community, and in encampments. And I think that is the right move. These are the outreach workers who have built trust over weeks and years, and these are the people who know where the resources are and can help meet those needs. And so as that work continues with partners, I think for me it's really important to try to offer people what they want. While I agree there are always some people, a very small number, who will never come inside and some who won't come inside on that day. If we can meet their needs, if we can make sure that their belongings are kept if they can't take them with them to the next location. And if we do treat people with dignity and respect in that process, I think a lot of folks will accept those offers. And so that was maybe enough time for the administrator to find the numbers we've been working on so far.
Thank you, Commissioner and Council Member. Yes, thank you. Since January, we've conducted around 40 cleanings and have made referrals to 85 individuals into the system. I don't know how many have actually come in, but we could look into that.
You could let me know. Mine got swept March 11th, and they're right back this morning. Just FYI. So that's what I'm dealing with. Just also, on the city FEPs, good question from my colleague, but after, how much time does one have on city FEPs and have those deadlines? I think it's 5 years. And then what happens? Or maybe you haven't hit that deadline yet in many cases.
Yeah, the program is a 5-year program, right? As long as individuals keep meeting eligibility, and then after 5 years, we will review on a case-by-case basis if the subsidy would continue.
Okay. And then there's a program that we used to have where basically it was direct to housing, you know, home. And so I know in other places in the country, you probably know, Commissioner, it exists. It was a pilot. I believe it ended. Is that something that is continuing? How much does it cost, and is it effective? Because to me, it might be effective, but it's probably expensive, but worth the money, in my opinion.
Yes,
I just want to know does it exist and how much it costs?
Yep, and letting my colleagues get to the place in the briefing book where they might be able to give you numbers there too. I understand it was a pilot that is continuing actually. So we continue to work with, I think it's Volunteers of America, to place people directly from street.
And how many people have been placed and what's the cost?
Sure. So I'll get back to you on the exact costs, you know, but people are placed utilizing housing subsidies, city FEPs, sometimes some other subsidies, but we also provide a payment to support the move straight from the street into housing while we work on whatever is needed for, you know, whatever applications may be needed, whether it's supportive housing or otherwise. I can say the current program has 81 units. And since over its inception, 151 street homeless individuals have utilized the program. Currently, there are 64 participants in the 81 units, and we have approximately 15 clients currently scheduled to view the current units after being engaged by our outreach teams and expressing interest in participating in this.
So is it successful? Is it more successful than any other way of getting people off the street, or is it not clear yet?
I think it is another tool which we are always happy to have. We are exploring the possibility of expanding it to see if there is a scale that might be able to be met by the program. That's still under discussion, so I'm happy to continue to, you know, update you on that, but we are always happy to have as many tools as we possibly can that may resonate with someone when another tool would not.
Okay, last question, coordination with other agencies. I've been to so many hearings I can't remember, but I think it was maybe it was DCAS. The bottom line is when people are taking other kinds of services, in other words, they could then be asked about SNAP or asked about cashless or whatever. Is that something, how do you coordinate that internally, or if you are? In other words, this is a new day with, you know, the guy in the White House and everything else. So my question is, how are you coordinating with other agencies so people hear about your services? You know, could be even tenant assistance, et cetera. My understanding is that's something that's somewhat new in this administration.
And again, I'll let my colleagues jump in here, but I had a conversation with the Commissioner of Health yesterday, and one of his main goals.
I think it was the Commissioner of Health who said this,
Okay, yeah, working alongside.
That guy from Harvard, yes.
Yeah, working alongside of us is, yes, to take that extra step. If someone is receiving WIC, if somebody's in the medical clinic, how do we ask them about their food security, connect them to SNAP? And we can do the same, right? So we could ask if people
you haven't started doing it, but he's doing it now? Is that the idea? It should be on a massive scale, in my opinion.
Agreed. Every city worker who engages with people should be able to offer those opportunities, and I think
you need training. So is that happening?
Yeah, so we currently do have, a lot of partnerships which we can always expand, especially with the other agencies within the Health and Human Services portfolio, DOHMH, Aging, ACS, many others. We are working closely with the Mayor's Office of Tenant Protections and others to make sure that we are all sort of cross-training and providing cross-information so that they have access to the information on our programs and vice versa, but obviously always open to working on something that goes beyond that in scope.
Okay, and NYCHA also. I'm just saying, I don't think it happened in the past. That's my, personal experience. So it would be good to know exactly how that training is taking place and if it's really happening and what the outcomes are. Thank you.
Thank you, Councilmember. Councilmember Nurse?
Thank you, Chair. And just want to double down on the Street to Home pilot. It's in my district. It's very successful, actually. And hopefully there's a way for you all to evaluate and officially say that, but from my understanding and every conversation I've had, it's been very successful. I think they're looking for more referrals, so at a more frequent rate. And my understanding is there are people who have actually moved into like fully permanent, their permanent home that they want to be in. So a huge advocate for that. I want to talk about DHS Immigration Customs Enforcement as it relates to shelters. Gothamist had an article out at the end of last year. There were about 5 instances of ICE agents gaining access to DHS shelters in violation of our sanctuary laws. 2 incidents where ICE was permitted to enter a DHS facility without providing a judicial warrant. 2 incidents of ICE agents and NYPD officers entering a DHS facility without staff permission. 1 incident of a shelter employee providing ICE agents with information about a former shelter resident. So with this, what have you all done to train up your staff, make sure everyone at the front door knows what we should not be doing, what would be violating our city laws? Are you training people in person? Are you sending people out? Are you doing it remote? Give us a update on how we're remedying this situation.
Thank you for the question, Councilmember. We have had limited encounters with ICE at DHS shelters. We have taken a multi-pronged approach to make sure that the correct information is out there and that staff on the ground in the middle of the night feel supported by the agency when things do occur. So we've reissued our facility access policy so that there's formal information about what DHS's directive is about how to handle this.
That's like via an email, like an all-staff email or something?
Yeah, it's shared through the provider community. There's an online database of policies and procedures. We send it as an attachment. We reference it. We make sure people have copies of it. We have also created a flowchart. When a 30-page procedure does not really help, we have a flowchart that people can have at the front desk so they know exactly what the steps are when they are ensuring that non-local law enforcement is properly identifying themselves and demonstrating a judicial warrant. We've also shared a list of our on-call attorneys, 24 hours a day, 7 days a week, so people on the ground feel supported in the moment when things are happening. And we've also advised staff to not engage in any altercations with any agents. We are regularly engaging with providers around this after an incident. As a reminder, we have DHS staff that are responsible for ensuring our providers are implementing policies and procedures, regularly following up. And every time we hear, we reiterate and make sure that everybody understands. We've done in-person trainings, we've done Zoom trainings, we've done big meetings.
Okay, and so as part of what you're talking about, in the past, you all had stated that you implemented a more robust procedure for verifying arrest warrants after one of these incidents happened. Is this part of that process, or is there anything you could tell us about the procedure change?
Apologies, I'll have to get back to you.
Okay. Yeah, and to be specific, it was that you all had somehow helped people at the front understand how to verify an arrest warrant. So if there's a procedure change, please let us know. In one incident, ICE agents were given access to the resident sign-in book. Have you done any follow-up to see what names were were, they were given access to and taken any safety measures for those people?
I am not aware of that, so we'll look into that.
Okay. I think that's all my questions. Just want to make sure we're protecting our folks and not violating our laws. And so however we can be supportive of that as well, please let us know. If we can help at our district level, we will. But we want to make sure folks aren't being kidnapped. So thank you so much.
Got it. And if I could, Councilmember just got advised, to your question about verifying arrest warrants, we've provided samples of the federal warrants and subpoenas, so staff know how to identify them as being the right type
That's
that would
great.
allow an
And that stuff's
agent in.
like that's at the front desk, like the flow chart and those samples?
We'll make sure. I believe
Okay.
it's part of the procedure, but we'll make sure.
Yeah, I think that's helpful because in the moment people panic and they forget, where to find it. And so just a place to reference it would be helpful. Okay, thank you, Chair.
Thank you, Councilmember. I'd like to acknowledge that we've also been joined by Councilmember Aviles. So I want to move into a different set of questions. I'll be hopping around just a little bit here, but regarding employees on benefits programs. While the people who work at DHS, HRA, and their contracted CBOs do invaluable work serving our city's most vulnerable, work in the provision and social services is often poorly compensated, leading to many employees relying on the same benefits they help others access. Is this something that you track, and can you share the percentage of DHS, HRA, or contracted CBO employees who are receiving public benefits such as cash assistance, SNAP, or housing vouchers?
I think we'll have to get back to you on the city employees. I'm not sure that we have that data, but we can check and come back to you. On CBO providers, I'm not sure if that would be possible because we don't have the full
Their
list
details.
of
Okay,
those
but is this something that you track, as far as you're aware? Do you know, I know you'll get back to me on the
Right.
specific number, but do you know that you have employees that are on public assistance?
I mean, we are aware that there are employees who may be on public assistance, right? I am not aware of tracking, but I don't want to speak definitively in that statement.
Okay.
We are aware that there are, as you noted, individuals who potentially are definitely accessing some of our benefits.
And do we know how many employees are in city shelters?
I don't have that number now, but yes, we know that number. We can get that to you.
Okay, great. And how does DSS support its own employees who are currently enrolled in public benefits to assist them towards self-sufficiency?
We always internally, right, there is very much a commitment to developing pathways of development for staff members. I will say over the last, a couple of years, and we can get back to you with some more details, right, we have developed a lot of trainings and other sort of like engagement and academies, including an academy for frontline workers, which recently occurred over the summer for the first time ever, which was a great thing. That is really about connecting individuals to what internal resources are available to help develop someone's career, what can we connect them to externally that also is around there. So we are happy to follow up with some additional specifics around that, but I will say over the last couple of years, the agency has really focused on building out our staff development efforts so that staff have places to go to explore what options are there for them to build their careers at HRA, and also just to think long-term where they may want to be going to.
That's great, thank you. And I just want to state for the record, my own advocacy for pay parity across agencies, which I've talked about previously as chair of the Aging Committee, where we see social workers and caseworkers in some agencies making less than the same roles in other agencies, which I think is a direct reflection of our values. And in that case, particularly, we don't value older adults and the work that people do around older adults. And so similarly, this is a space where frontline workers are working with vulnerable populations, and they become vulnerable populations themselves. And so anything and everything we can do to help support you and your efforts in supporting staff and employees so that they're not also receiving public benefits, I think would be great work. Shelter costs new need. The council has long called on the administration to more accurately budget for the cost of DHS's shelter system, which has been under budgeted at adoption in recent years. We were glad to see a baseline increase of city funding for shelters included in the preliminary plan, $586.1 million in fiscal 2026, $988.6 million in fiscal 2027, and $1.04 billion in fiscal 2028, $1.09 billion in fiscal 2029, and $1.15 billion in fiscal 2030. Additionally, there are net decreases of state and federal funding, and 146 baseline positions were added starting in fiscal 2026. Can you tell me more about how the funding amounts were determined?
Yes, thank you for that question. I'm happy to take this. So we do coordinate very closely with the Office of Management and Budget on our projections for the census, for utilization, length of stay in our DHS program, and we coordinate on that data and how it translates into the budget. So the dollar amounts in this most recent preliminary budget reflect what we believe will be the spending for through the 5-year budget period. I mean, obviously, projections will change, but this is what we think we would spend.
And what are DHS's projections for the shelter census in the coming years?
Thank you for the question. We work with our partners at the Office of Management and Budget on shelter projections, and I do not have those numbers at this time, but we can share them.
Okay. And why is federal and state funding being decreased? What were the funding sources?
Yeah, sorry. So that, the adjustments that you see in the budget related to federal and state are mostly just cleaning up some of the modifications and adjustments that had been made at periods before the beginning of the fiscal year. So those would have been all related to, say, TANF and state contributions. But the budget currently reflects what we believe will be the projected spending between city, federal, and state funding.
Okay. And what are the titles and job descriptions for the 146 additional positions?
That piece we'll have to get back to you on. The information I have here is just the total, so we'll get back to you on what the titles are and how that dollar amount will be broken.
Okay, and also I would love to know when you plan to have these positions filled by.
Of course. Okay, we can do that.
Okay. And lastly on this topic, why does the amount of city funding increase from year to year?
Do you mean, I'm sorry, I'm not sure. You mean
Over
the
the
new need itself?
Yes.
It's just simply to reflect the fact that city funding had not been appropriately budgeted in the out years in previous budgets, so the dollar amount is increasing simply just to match our spending.
Okay. And then street homeless services, new need. The preliminary plan included additional city funding to DHS's budget for street homeless services totaling $9.7 million in fiscal 2026, $31.2 million in fiscal 27, $29.9 million in fiscal 28, $30.8 million in fiscal 29, and $31.7 million in fiscal 2030. There were also 66 additional baseline positions added. What is this additional funding for, and how was the funding amount determined?
Great, yes, great question. So the Outdoor Structures Initiative had funding for, as you noted, the 66 additional positions. In addition, we have additional funding for things like mobile cooling and warming centers, clinical services. We have an increase related to revisions that we'll make to our Street Smart system, and then there are additional transportation services. We can happily get you the breakdown on that and the 66 heads if you'd like.
Yeah, that would be great. And just confirming, are all 66 positions for street outreach workers?
It is. There are 60 positions for street outreach. We have 2 positions for training and 4 positions in our street havens. I'm sorry, our Safe Havens program.
Okay, great. Thank you. How many street outreach workers are currently employed that are agency employees versus contracted employees?
Looking for that right now.
Sure. And while you're working on that, I would love to know how you determine when it's better to hire staff versus contracted providers staffing for street outreach efforts.
For the DHS Streets programs, we have a budgeted headcount in 26 of 190.
I'm sorry, a budgeted headcount of,
190.
190.
And the actuals that I have are actually a little older for the end of 25, which was 106 employees. I don't have the number of positions for the contracts. So we'll have to get back to you on that.
Okay. And, sorry, can you just talk about hiring staff versus contracted providers staffing for street outreach efforts and how you make that decision?
Sure, thank you, Councilmember. And I just want to confirm, we have about 600 budgeted positions at our contracted outreach providers.
Okay.
So we're constantly evaluating the need against the staffing and the providers that we have. So depending on what the hope count says, what we're hearing from providers, we're evaluating what programs we need, where we need enhancements, where it's better to contract out versus hiring on-site.
Okay. And as of the preliminary plan, approximately $450 million is budgeted in each fiscals 2026 and 2027 for street outreach. Spending under the prior administration increased significantly, hitting approximately $370 million in fiscal 2025. Despite the investments over the past several years, unsheltered homelessness persists. How will your administration approach effectively serving this population while balancing the fiscal implications?
Thank you for the question. And I'll start again, and then if others want to add. As I mentioned earlier, I think the work to house people that are unhoused, I mean, very, very few New Yorkers are, of course, outside, but those who are, we want to do our best work to bring them inside. I think the mayor's switch to having the Department of Homeless Services lead the way is the right role. I think working across our partners in health and hospitals on issues of mental illness and substance use services, and just really trying to wrap our arms around those folks who are staying outside and offer them what they need. And so I think the additional staff will help, along with strong coordination, along with the right folks taking the lead and making sure that we are able to make offers that people will accept. Again, a challenging issue, but one I look forward to taking on.
Thank you so much. And I'd like to acknowledge that we've been joined by Councilmember Caban on Zoom. Okay. I'd like to move into SNAP EBT chip cards and state funding. So theft of SNAP benefits is an epidemic across the United States, and one of the major ways criminals steal funds is by card skimming, usually using illegal devices to copy personal account information when people swipe their EBT cards. At the March 3rd, 2026 quarterly community partners call, HRA stated that in the state's 30-day amendment to the proposed budget, $1.8 million in state funding was added statewide, with $700,000 earmarked for New York City's implementation of chip technology for EBT cards. Will this funding be added to the executive plan?
Sure, I can take that question. So the funding in the state budget is actually for the state to cover the cost of the transition to EBT cards with chips. The state is does all of those EBT cards, so the funding in the state budget is actually to do that actual transition with a vendor. So I imagine that funding is meant to support a vendor to transition the EBT cards to chip cards so that everything will be far more secure and we won't have as many instances of individuals having their benefits skimmed.
And has the state provided guidance on the implementation and timeline of chip technology across the state?
They have not yet given us a definitive timeline, but I do know that it is something they are trying to work on as quickly as possible.
Are you aware of retailers in the city who currently accept SNAP EBT cards but will not be able to accept payment from the new SNAP chip cards?
I am not aware of that, but we will obviously work closely with our colleagues at OTDA to make sure that they are providing the right information to individuals in case stores do need to, look at a change in technology to be able to take the chip card.
Okay, and then there are also some concerns about the new chip card that I'm going to toss over to Councilmember Aviles to get into. Thank you.
Thank you so much, Chair. On those particular cards, we understand because the chips are connected to financial federal regulations that there are potential vulnerabilities for immigrant New Yorkers, particularly in this context, which is something we considered when we developed the IDNYC, right? Which is why the chips were not part of there. Have you explored deeply those vulnerabilities in this political context, and what did you?
So we'll bring that back to the oversight OTDA, as they are actually the ones who oversee the chip cards and the determination of it. And we will speak with them about, what have they looked in, and are there security measures that they are considering to ensure that people remain safe, which is a main concern for us as well.
Great. It is a huge issue in our communities, and we want to make sure that people get the benefits that they depend on so profoundly, but at the same time, they should not be ensnared in indefinite detention and deportation because of their status. Thank you.
Thank you, Councilmember. Okay, as of December 2024, the state is no longer receiving federal reimbursement for stolen benefits. As part of the state budget, there is a proposal to create a victims' compensation fund for those who have had their benefits stolen through skimming. What is HRA doing to support skimming victims, and would you support a state compensation fund?
Certainly. So as you mentioned, the ability to reimburse, SNAP skimming was stopped by the federal government. I can say that, since the beginning of the ability to replace benefits, HRA did work to replace over $50 million in benefits to individuals who submitted claims to us. We can still take claims from individuals who have had their cash assistance benefits skimmed. So I encourage anyone who has had any of their cash assistance benefits skimmed to still submit that to us, because we are able to reimburse those funds. And we are very much open to working with our state colleagues on identifying other funds that can replace benefits for individuals who had them stolen by somebody.
Great, thank you. Okay, the closing of Bellevue Men's Shelter and Intake Site. The administration recently announced that it will be temporarily shutting down the Bellevue Men's Shelter and Intake Center by mid-March. Sites on East 3rd Street and Bowery and Manhattan will assume shelter intake, and Bellevue's 250 single male residents will be rehoused beginning May 1st at shelters to be determined. Can you tell me more about how this decision was made and the logistics of shutting down Bellevue and relocating residents?
Sure. Thank you for the question. And as you all know, that location at 30th Street has been the front door to the homeless services for many years in New York City. And so I don't think anyone takes lightly that a move would need to happen. As folks also probably know, that building has been in disrepair for many years. And while the city has attempted to keep up with the maintenance, it has just become a time when that can't be done piecemeal anymore, and we need to find a safer place for the people we serve and our employees as well. And so we've been working with partners on that transition. So as of Sunday, I think, March 16th, we no longer have assessment beds in 30th Street, and that transition went well. Intake and assessment is still happening on site. Of course, we will continue to have staff long after the transition who can help to direct people to other resources up to the new sites. We expect that for some time people will continue to see that site as a resource, and we will continue to staff it so that people may get to intake and assessment sites throughout the city.
Thank you. And have you identified which shelters will be rehousing Bellevue residents? And if so, can you tell me how you chose the new sites, and do they have the same support services and accessibility as Bellevue?
I can start, but I want to make sure I am fully understanding the question.
Sure.
So there's the issue of intake and assessment, and I can talk about that. And then there is the issue of where people are being sheltered for that short period, and I might take some support to make sure I'm answering that correctly. And so I think, yes, the DHS team as well as other teams have assessed a variety of sites that would meet the needs for intake and assessment, and we believe that the sites that we have chosen offer comparable and better intake and assessment accessibility to the folks who we'd be serving there, and are working with our partners at Project Renewal and others to make sure that there's continuity of care for the clients that they're serving in those spaces as well. Let me turn to my colleagues and see what I might have missed, and if I misstated anything, please feel free.
From what I've heard, I think you've covered most of it, if not all.
Yeah, I was just going to
Yeah.
confirm that and say
Yeah.
that the assessment beds have been transitioned to sites in Brooklyn. As the commissioner said, those those have already been transitioned out. So, we're fully on the path to taking on what is going to be a difficult transition, obviously, away from 30th Street.
Okay, thank you. And how many substance use or mental health treatment beds did Bellevue have? And how many individuals are currently housed in these beds? And has DHS identified which shelters will rehouse these individuals and how you'll ensure there isn't a gap in the specialized care they're receiving?
Thank you for the question. Bellevue served as our assessment and overnight complement of beds, so there were no program beds there. So once somebody was assessed, if the determination was they needed a substance abuse bed, they were placed in a substance abuse shelter.
Okay, separate from this site.
From 30th Street, correct.
Okay. Will any of the new need funding added in the preliminary plan for shelter costs go toward housing, services or staffing for the shelters taking in the Bellevue residents? And will any go towards the intake sites that will be taking over for Bellevue?
Yes, the positions that were added will go towards these efforts. I don't know that that I have the information on which ones go where, but we can get back to you with that when we give you the breakout of the 146.
Okay. Thank you. And do you plan to add additional funding or headcount for these sites in future plans?
Thank you. I believe the additional headcount of the 146 should address the need, but I think when we look at the breakdown, I think we'll find that it's sufficient.
Okay. Sufficient by your standards?
Well, when we take a very centralized, complex program that existed at Bellevue for many years and we have to decentralize it, we did need to stand up essentially multiple intake programs.
Right.
So that's where the additional headcount is. We believe the 146 should be sufficient to operate intake in the dispersed way that we had to approach it.
Okay. Thank you. Just give me 1 second. Let me turn it over to Councilmember Brewer for a second.
Thank you. This may have been worked out, but Project Renewal was hysterical about the time frame. Has that been worked out where it's not as fast and you have more time at their facilities in Lower East Side? And they have a clinic there. They want to make sure it retains because it's very hard to restart it, et cetera, et cetera, et cetera, since I'm swamped with phone calls.
Yeah, thank you. And we're very grateful to the partners at Project Renewal. We know this is not something that they've had a lot of warning about and something that they've had to work closely.
That's putting it mildly, but yes.
Closely with us. We also have deadlines of doing intake and assessment as of May 1st in the new sites, and so we're working closely with Project Renewal on programs that can stay in space and programs that might be better off, perhaps, in an additional space. So we're working with state partners on the substance use treatment program, which again I think we've worked out with them can stay in that space, so those folks will be stable. And then to your point, there's an outpatient clinic that we're working with them on, as well as a federally qualified health center and our Article 28 site that we see as really integral to the intake and assessment function, and look forward to working with them. Certainly, this plan is still in flux. There are state partners involved, there's project renewal, and I think the important thing to know is that we're all working really hard to make sure that we can, where transitions need to be made, make sure that they're done safely and with care, and support those clients going
Do you
forward.
think the federally qualified health center will be okay to stay there, or you're still working that out? Because that is very hard to replicate.
We absolutely want it to stay there, and in fact, again, see it as a really integral part of that intake and assessment function, getting people connected to services. The things we're working through are construction issues. How do we build out the intake and assessment components of that program and keep the Article 28 clinic intact? Those are the kinds of issues we're working through right now.
All right, thank you.
And thank you, Councilmember Brewer. I was getting to that line of questioning next, but also just want to state for the record that the beds that are there currently at the 3rd Street site that are operated by Project Renewal are really unique and have unique needs, and the people who are residents there. And so, we want to make sure that we're doing everything to keep those programs and services whole. And I don't know, and this is, I'm actually saying I do not know, whether the move is going to allow those services to stay whole. And I think, as Councilmember Brewer mentioned, the federally qualified health center is of particular concern because I don't know if that money can actually be moved into a different location, physical location. So those are things that we want to make sure you all are talking with Project Renewal about. Thank you. Okay. DHS vacancy rate. In July 2025, DHS's actual headcount was 1,733, and it has been steadily declining every month since. As of January 2026, DHS has a vacancy rate of 27%. The highest it has been in the last 3 years. Why has DHS's headcount been declining over the last few months?
Okay. Thank you for that question. So when you look at this period of time, there are a few things happening that kind of challenge how we look at headcount. First, we moved the Housing Services Division from DHS to HRA. So you would see that actual headcount move from one agency to the other.
And how many was that, do you know?
127. What? Oh, sorry. It was 107.
Thank you. And that you said that one from DHS to HRA?
Correct. Yeah.
Okay, so do those 107 positions represent the 27% vacancy rate?
No, so the 27% vacancy rate is also, a lot of that is driven from the new needs that we received in the preliminary budget. So if you were to, remove those, the vacancy rate is probably closer to 14%.
Okay, still high, I would argue.
Of course.
And so just going back to the transfer then, what is the actual and budgeted head count for the housing administration program?
Give me 1 second, I'm sorry. Housing services.
I can say, well, they're looking for that. I can say for the rental assistance program, right? The headcount that we have is 161, but I would caution to think that is the only number of people who are actually focused on moving people out of shelter, specifically around city FEPs. There are many other staff, both internal to our agency as well as in partnership with our providers that actually work along the continuum of moving people out of shelter. So I just would caution that that is not the only number of people focused on that work. and that is really focused specifically on rental assistance. There are additional staff who obviously work in the affordable and supportive housing side of our operations that connect people to other types of permanent housing. And we can, if we need to, get back to you with the total number.
Yeah, I'm sorry. We will have to get back to you. I'm sorry about that.
Okay, what I'm trying to get at is whether or not the budgeted headcount was revised for the preliminary plan to account, bless you, to account for the transfer of this program.
The transfer happened in the budgeted headcount had moved prior to the November budget, or moved in the November budget, but the actual headcount moved later. So you're sort of, we're seeing a sort of a disconnect between when the budgeted headcount was moved, only because we had to move them as part of financial plans, and when the actual heads moved, which was later in the fall.
Okay. What is DHS doing to fill vacant positions and to reduce the attrition rate among staff?
Thank you. Yeah, that's a great question. So our Human Resources Administration has a number of initiatives that they've taken to try to reduce the staff, the vacancies in staff. I mean, on an internal level and at the higher levels, we're working to ensure that all of our positions are posted and that staff have an opportunity for growth within the organization. When we are looking to bring in staff from outside of the organization, we are doing the traditional civil service hiring pools. We post everything on our jobs website and try to advertise our positions outside of just the city's website. We've done numerous career fairs. We've collaborated with HRA's career services divisions and done hiring halls across the city. We've also worked within our Office of Marketing to create recruitment videos for positions that are hard to recruit.
Okay, and what would you say is an acceptable or ideal vacancy rate? If not, zero.
Yeah, I would say as close to zero as possible. It will never be, zero, and it takes time to recruit new staff. But I'm certain this agency wants to have everybody on board that we can, and also for the benefit of the other staff who are here, who are taking on so much work on behalf of people. And so, while it's difficult to attract talent, and of course, I suspect this bureaucracy, like all, are challenging to work through. I think it's a great opportunity to look at that process, streamline it as much as possible, and get folks in the door. So I would say we would be striving to have that be as low as possible.
Okay. Okay, on February 19th, DHS released an action plan for the integration of asylum seekers into the DHS system. The plan laid out the following goals: close the last emergency asylum shelter, bring single adult shelters into compliance with capacity limits, and comply with regulations requiring families with children to have access to cooking facilities. The plan mentions that within the next 6 months, DHS will open several new shelters which were delayed by the previous administration. Can you tell me how many shelters are set to open and who the shelter providers are?
Sure. We'd love to. We're really excited about the new shelters. While folks are finding the specific information for you, I'll just say I was at ribbon cutting for Magnolia Gardens last week, and it's a beautiful space built with the nonprofit and community working together. Those are the kinds of spaces we want to be able to move our families and others into, places with services on site that fit the fabric of the community. It was just a wonderful opportunity to see that kind of shelter open. And while I'm sure there's always concerns when shelters are cited, what I saw there that day was so much community excitement for the space. There's community rooms that could even be used, I think, by community members, and so just a real celebration.
I was sorry to miss that ribbon cutting, but I'll be visiting Magnolia Gardens soon.
Thanks, Commissioner and Chair, for the question. I was conferring with Chief Gonzalez. We know the sites, we know the addresses. We'll have to get back to you on the providers.
Okay, and what about a breakdown of the populations that will be served, the facility types, the boroughs, and how many residents these shelters are able to house?
Yes, I can certainly answer. The population will be single men. So these sites are opening to absorb the clients that are being transferred out of the last remaining HERC site.
Okay. And after the opening of these additional shelter sites that are already in the pipeline, do you anticipate needing more shelter sites?
We're constantly evaluating. Part of our large capacity management plan, and the third item that you mentioned from that 45-day plan, is to ensure that families are out of hotels that don't have cooking facilities. So that's a task, and in order to move families out of hotels, we need a robust pipeline. So we're continuing to identify high-quality, safe facilities to allow us to exit hotels.
And do you know how many you might need, like how many shelter sites?
I think we'd need to get back to you. The number changes as we go, right? So when that plan was established, the census was a certain number. We know how many families were in as of the day. It's something we're constantly monitoring. And I mentioned earlier, we work with our colleagues at OMB on the shelter projections to kind of tie what the expected census will be to the beds we're going to need to have available at that time.
Okay. The action plan states that goals will be met in part by converting some families with children hotel units for use by single men. How many families with children hotel units are there currently, and how many could be converted for use by single men?
Yeah, we'll have to get back to you on the total number of family hotel units. We don't want to give you the incorrect number.
Okay, I just want to state for the record that we shared all of these questions with you all in advance, and we're hoping to have the numbers shared here today.
Yes.
So it's a lot of follow-up.
We'll work on that.
One thing I want to go back to very quickly about Magnolia Gardens, which, as you mentioned, Commissioner, is a great new facility. The provider, however, did mention that funding was cut for the PETS program. And I think when folks first started talking about the PETS program, it was probably something that was undervalued. And people didn't realize or understand how important pets can be and are to families, and especially those experiencing trauma and domestic violence and things of that nature. So it seems to be a much more widespread or robust program across the shelter system. And so do you know anything about the funding for the PETS program specifically at Magnolia Gardens?
I will need to get back to you about the specific funding there, but
That one I sprung on you, so I'm going to allow it.
but I certainly agree that we shouldn't ask people to make hard choices about the people and the animals that they love. And so as long as we can create a safe environment for everyone staying there, we should do that whenever we can.
Okay, great. Thank you so much. Okay, and then going back to the asylum seekers and DHS system, where do you plan to move the approximately 8,100 families with children currently in hotel shelters, and how will you minimize disruption to these families' lives and to the children's schooling? I know you talked about doing everything we can and identifying new sites, and of course we know, everybody knows, we have a crisis of housing and shelter here in New York City, but for the families with children specifically, what's your plan to minimize disruption?
Okay, thank you for the question, Chair. First and foremost, outside of any need for an emergency transfer, we are looking to ensure that families are not transferred, families with school-age children, until after the school year, whenever possible. That's one of our approaches, and I just want to confirm for you the number of family hotel units that we have, 11,084.
11,084. Thank you so much.
And just to build on that point, because I've asked about it a little bit as well. So in addition to whenever possible, not asking younger children that are school age to change schools.
Right.
I know we're providing transportation if people want to stay in homeschools. We believe in, obviously, the education stability and making sure there's continuity there.
Great, thank you. And given that asylum seekers often have unique needs different from the general DHS population, how do you plan to serve them after they've been integrated into the DHS while also keeping them safe from immigration and customs enforcement officers?
Sure, thank you for the question, Chair. Throughout the process of integrating asylum seekers into our general shelter population, everyone is treated the same. So everyone is assessed in the same way, service plans are delivered in the same way, and the specific needs around asylum seekers, whether it's legal or immigration services, get added to the service plan just as they would if childcare was needed or employment services were needed. We partner with the Mayor's Office of Immigration Affairs to make sure we have the most current and client-forward facing materials and resources. Our providers, just like they would for medical providers or employment programs, are responsible for making sure they have a network of resources to refer clients in need to.
Thank you. I'd like to acknowledge that we've been joined by Millennium High School from here in Manhattan. Welcome, students from Millennium High School. This is a preliminary budget hearing for the General Welfare Committee, which has oversight over the Department of Social Services, which includes the Department of Homeless Services and the Human Resources Administration. So welcome to City Hall. Okay. Disability and aging accommodations in shelter. As the former chair of the Council's Committee on Aging, I've seen how older New Yorkers have unique needs that I'm concerned about, and how DHS is meeting the needs of this population in the shelter system. Can you provide an estimate of how many people in shelters are 60 years old or older?
Thank you for the question. We will get you an estimate of the number of people in shelter 60 or older.
Okay, you don't have that?
Not at my fingertips, no.
Okay.
Apologies.
What specialized support services does DHS provide to this population?
We have a few sites that are designed specifically for this population. They tend to be lower density. They tend to be more accessible for those with mobility or chronic medical issues. Some of the providers that operate these sites also have their own housing programs, supportive housing programs, and we ensure that we're working with our HRA partners and other city agencies for any housing options that are dedicated specifically to this population.
And what specialized support services are available to shelter residents with disabilities?
So, excuse me. Our Office of Disability Affairs is always available to assist our shelter providers with any needs that they feel that they need to assist a client in order to meet, to make sure that they have full access to services that we offer. We have a robust reasonable accommodation process that allows the people we serve to request accommodations, whether it's a change in policy or procedure, or additional time with an application, or having information read to them to make sure that they're fully aware and participating in their service plan.
And what does the review process for those requests look like? And based on what you're saying, basically the information is presented to the person, and then they would, know what their options are, or are there cases where people are asking specifically for specific accommodations?
We've certainly get those instances, as well as it's our responsibility also to pay attention to proactively see if they're
Identified needs,
yes,
yeah.
Visible and apparent needs. So, for example, if somebody comes in and applies for shelter and we're looking for a placement, we're going to look for one for somebody in a wheelchair who uses a wheelchair with an elevator.
Right.
If
Some disabilities are invisible.
Exactly.
But I recognize that for those that are visible, you do your best at intake.
Right, and for
Sounds
those that are invisible, or for things that arise when somebody is placed in shelter, The individual who's in receipt of shelter can apply directly for a reasonable accommodation on their own by submitting a form. The shelter staff is there also to assist them in completing the form, and it's likely that we're going to need documentation, so shelter staff is also there to help them gather that documentation, make sure it gets to us.
Okay. Would lack of documentation prevent one from receiving a reasonable accommodation?
It depends. It depends on what the need is.
Okay. Can you give me an example of when somebody might be denied a reasonable accommodation for lack of paperwork?
Documentation. So if somebody in shelter submits a reasonable accommodation, they need their own unit and their own bathroom. We would ask for medical documentation that would indicate that that is, in fact, a need.
Okay.
And if that documentation was not provided, the reasonable accommodation would likely be denied.
Okay, at that time, but
At
there's an
that time.
opportunity
And again, the shelter
for-
staff is responsible for helping people to secure
Right.
the documents that they need.
Okay. How many DHS shelters are wheelchair accessible?
I'll get back to you on that.
Okay. And does DHS take age and disability into account when placing clients into shelters?
Yes, as I mentioned, we do have a few shelters that are designed. Yeah, so as if there are available beds there, we would certainly place someone as long as it was appropriate. And as those sites have permanent placements and beds become available, we would be transferring appropriate folks in.
Okay, and I assume you take into consideration the availability of community services and amenities and access to public transportation and other factors that those vulnerable populations would need.
Yes.
How does DHS coordinate with agencies such as NYC Aging and the Mayor's Office for People with Disabilities to better serve older adults and people with disabilities who are experiencing homelessness?
We're constantly engaging with our sister agency partners around best practices, any new services, pushing for additional housing supports, making sure that our providers are aware of all the services that are offered by our sister agencies as well.
Thank you. And I'm going to go to Councilmember Aviles for a few more questions, and then I have a question here from Councilmember Thomas Henry, who's joined us online, but unfortunately we don't have quorum at the moment, and so I'll have to ask her a question for her.
Thank you so much, Chair. Thank you to the whole team for your work and being here today. So I want to talk a little bit about the immigration legal services. In the preliminary plan includes 6.7 million of city funding added in fiscal 26 and 21.3 million added in fiscal 27. 20.9 million added in fiscal 28, and continuing on in out years. Can you tell us what this funding is for specifically and what programs are going to be impacted by the additional funding?
So it supports a variety of immigration services across different programs and different agencies. So it will support IOI, which is at HRA under our Office of Civil Justice. It also supports.
Can you tell me how much for each program? What would be the breakdown? So IOI at HRA at what amount?
Okay, so we'll provide the breakdown on each specific agency. If they don't have it in there. But IOI, then the office NGBV, to end gender-based violence, also has programs that will receive some of that funding. Our colleagues at Moya also receive some of that funding. Additionally, we have a low-wage worker protection program at HRA that will also receive some of the additional funding, and we'll get back to you with the specific amounts for each one of those programs. But it crosses a variety of programs that focus on supporting individuals who may experience immigration issues that need legal representation.
Great. So when you report back, we'd love to see the breakdown across and then across years. Thank you. In terms of the preliminary plan also includes 11.6 million in city funding added to the baseline starting in fiscal 27 for immigration legal support centers operated by Moya. are there specific Moya Legal Services or programs that the funding is for? And what providers will be part of this program? Also, will there be a new RFP?
We will have to get that information from our colleagues at Moya, as we wouldn't have those specific details as to what they're planning, but we will follow up with you.
Great. Also, in terms of the Office of Asylum Seeker Operations, it looks like the preliminary plan includes a reduction of $880,000 in state funding and 8 positions in fiscal '26 only. We were curious about how that funding amount was determined and whether OWASO has been officially disbanded.
Yes, so the OWASO staff and funding have been absorbed by the various city agencies, primarily by DSS. The state funding in the budget was just the modified budget that was in there. I have to get back to you on what that funding represented, but yeah, I'd say OWASO
Is no more?
yeah.
Okay.
Yeah.
Long overdue. So the eight positions are now part of the DSS general budget, have been reallocated?
Yes.
Okay, great, thank you. And then lastly, just to follow up on Councilmember Nurse's questions about the shelter ICE enforcement. In particular, we are aware that many of the security services that are in shelter are contracted services. Obviously, they also are under the obligation of meeting our laws. We've talked a lot about it in the past. But can you tell us, again, for the record, how security contractors are informed and held to account on maintaining responsibilities for our laws?
Thank you, Councilmember. As we mentioned earlier in response to Councilmember Nurse's question, these trainings, the communications, our contracted security providers, or the providers' contracted securities, were invited and did participate.
And in terms of the 2 instances where ICE was able to enter a facility without permission, what measures have you taken to ensure that contractors will never have this problem? They will never experience this failure again?
Yeah, again, thank you for the question. I think, as we've mentioned, just constantly reiterating the process, speaking with the teams after the incident, also to debrief, to understand what kind of happened so that we can talk through next time. But it is an ongoing effort to make sure that everybody understands the way to handle this, especially in the emergency situation.
Great. And Chair, if I may, just one more question.
I'll give you 2 more.
Oh, she's so kind. So many questions, so little time. And of course, I can't find it now that I'm under the pressure of performance. I'd like to move back to home base. Okay, here we go. Could you tell us, so we know that HRA's home base supports city FEPs and community clients to maintain stable housing. We know it's a network of community-based organizations that provide these homelessness prevention services. What's the current fiscal '26 budget for home base, and is that amount baselined?
The current budget for home base is $67.9 million. There is baseline funding in the budget that does fluctuate a bit to 66.6 in '26. Going to 63.9 million in '27 and '28. Yeah.
So 90% amount are baselined for that funding?
Yeah, it's
great.
Largely baselined, yeah.
In terms of what's the actual spending to date in fiscal '26? And how much was, what was the actual for fiscal '25?
So through through February for fiscal year '26, we've spent $46.5 million. The actuals for '25 was $67.9 million.
Okay. And then in terms of In multiple City FEPS oversight hearings, we'd heard from the public that the demand for the City FEPS application renewals and other rental assistance services that Homebase provides can't be met with the current level of funding budgeted. We've also heard that CBOs are having difficulty hiring and maintaining adequate staff levels. As the PMMR notes, in the first 4 months of 2026, the program had over 12,000 enrollments, which is 14.2% increased compared to the same period of year. How many contracted providers are within the Homebase program?
Sure. There are 7 providers with 16 contracts, and I believe it is 23 locations, but I will confirm that last piece for you. We are aware that for some home-based providers, right, there are wait times to be seen. I will say every home-based provider does an initial triage for everyone who reaches out to determine if there is an emergency need, such as an imminent eviction or other activity that needs to be addressed, and those individuals will be seen either that day or within, the next day or two. But we are, as I mentioned before, looking at ways in which we can shift some of the responsibilities that have been taken on by Homebase over the years back into HRA so that we can expand capacity for them to serve more people in the community. That includes, looking at things that we're doing around subsidy work that they currently work on, and especially around state FEPS, as well as some other complex casework that they do that we think we are able to bring back into the agency to expand their capacity.
So since we've acknowledged there's a capacity issue, do you know what the current case ratio would be for home-based staff at this moment?
It doesn't work on a case ratio basis in that manner. I will say, last year they did exceed their service targets, right, which was 30,000 served, and they did serve 32,000 last year. So it is something that we're tracking closely, and we're in conversation, ongoing conversation with the Office of Management and Budget around resources for the program.
And what's the funding that you anticipate, given what we know to date, the program would need to operate optimally?
So that is something we're still discussing with OMB to identify what additional resources would be appropriate to help, respond to the community need.
And lastly, so what is the directive when, so it sounds like the home-based providers are asked to prioritize and triage emergencies. How is the agency conducting oversight and evaluation that those triages are actually happening and happening promptly?
So we speak quite frequently with our home-based providers to assess what is happening. We talk to them about where they may be seeing wait times and how that is manifesting itself within their work. And I will also say that they are, they definitely come forward to us when they are finding that there may be some challenges, especially if it's relating to serving those who are showing up with an emergent need that needs to be addressed immediately.
Okay, thank you, Chair. I'll be back. Thank
You're
you.
welcome. I think that was about 4 questions that you actually asked. But important ones, so thank you. Okay, I'm going to ask a couple of questions on behalf of Councilmember Thomas Henry, who's on Zoom. What is the process for someone in a shelter to apply for formerly homeless set-asides in new housing developments? From her experience, shelter residents are applying directly through Housing Connect, and the housing coordinators at some of the shelters do not seem to be well informed on the application process for the set-asides or availability of new sites.
I will take part of that, and then we might get back to you and the council member with some additional details, and I'll ask my DH colleagues to weigh in as well. So for HPD homeless set-asides, right, the provider network is aware of the different availabilities that we have. To apply for an HPD unit, you do have to submit through HPD Connect. I know that we do have data shares that we are doing with HPD to sort of share information on those individuals who have applied and are eligible, but we'll have to get back to you with some more specific details to map it out, but obviously we do want to know if our shelter providers, right, if we're hearing that some staff aren't fully aware of the process and what should happen, that is something that we will discuss about and make sure that we're pushing out information that's clear and simple so that folks will ensure individuals who could maybe benefit from those set-asides know that they're available to them.
Great.
Yeah, thank you, Administrator. And I will add that it is first and foremost part of the rehousing strategy for clients in shelter to have HHAs submitted. So it is the job of shelter staff to ensure that that's done, that it's done accurately, and when changes occur, that things like income are updated.
We can connect Councilmember Thomas Henry with you all to see if there's a specific location that might need some more assistance. Thank you. And then second question from her. Last year, a former JFK Hilton Hotel in Queens was converted to over 300 affordable apartments for low-income and formerly homeless New Yorkers. As someone who represents a district with an airport that is surrounded by hotels that have been converted to shelters, is there a long-term plan to replicate this model of converting hotels into permanent housing?
Certainly. So yes, so that conversion was part of the Affordable Housing Services program that we have, which we are definitely very supportive of and looking to expand if possible. I do know that there is sort of an overall interest as well across the administration to look at how other hotels could be transitioned to more affordable housing.
Great. Thank you. I'm going to kick it over to Councilmember Brewer before I continue on with my line of questioning.
Thank you. West 74th Street would be great permanent housing, I'm just saying, because I am, the issues there, Scott. Oh, my God. All right, one question. How many city-run shelters are there compared to run by nonprofits?
Thank you, Councilmember. There are 5 city-run shelters when we exclude 2 intake facilities, Path and 30th Street.
Okay, and are they going to be continuing? Are you going to have more? Or are you probably going to stick with the nonprofit?
I think all plans are in discussion for those sites.
Okay. Next is, I get a lot of calls about APS, Adult Protective Services. According to the preliminary management plan, there's an increase without getting into the specifics, as I think many of us are getting older, probably why, but there are many more requests and an increase in cases. So what is driving these increases, except maybe age? How have you been able to handle the caseload, the referral volume, and how many are denied? I must admit, I get a lot hoarders, which is a big problem. So tons and tons of hoarders, APS, et cetera. And I think this is going to be a growing problem, a growing challenge. So you obviously need caseworkers, you need budget and home attendants. So I'm just wanting to know how you're going to be addressing either budget-wise, staffing-wise, the issue of caseworkers and APS and the hoarding issue, which is prevalent.
Absolutely. Thank you for the question. I can say in regards to caseworkers, over the last couple of years, we've hired an additional 107 caseworkers. We obviously track very closely caseload ratios, the budget as well. I will say we are within our timeliness rates to be assessing cases that are referred to us. I will also note that eligibility for APS is very clearly defined by the state and other regulations, and it's sort of very specific criteria that needs to be met for someone to be identified as an APS client, which includes sort of a combination of things of an individual needs to be 18 years or older, and they need to be mentally or physically impaired. They have to be unable to manage their resources, carry out the activities of daily living, or protect themselves from abuse, neglect, exploitation, or other hazardous situations, and have no one available who is willing or able to assist them responsibly. And so all of those criteria need to be met to be deemed eligible for APS. Otherwise, the case would be declined at that moment. But it is something that we're tracking very, very closely. I agree with you with the aging of the population as well. We want to make sure that we're supporting individuals and we will assess and discuss with OMB as well, where we see additional resource needs.
Do you have a contract for hoarding to clean out, or do you do that internally? Because I do a lot of it myself.
We have a deep cleaning contract that we utilize when a hoarding situation has been encountered and we realize that some type of deep cleaning is necessary.
Could you let us know how much that is, how much it's increased, and if you think it needs to be more increased? Because it's...
Yes, we will follow up with you on that.
Thank you. Thank you, Madam Chair.
Thank you, Council Member. Okay, addressing chronic underbudgeting in city FEPS and cash assistance. In recent years, financial plans have not appropriately accounted for costs of HRA's city FEPS and cash assistance budget at a level proportionate with recent expenditures. The chronic underbudgeting of these two vital programs has been of concern to the Council and was raised in every preliminary budget responses since fiscal 2019. The Council was pleased to see that the preliminary plan fills a fiscal cliff for city FEPS and cash assistance, increasing the baseline budget for both programs starting in fiscal 2027. The funding added in the preliminary plan for city FEPS brings the total fiscal 2026 budget to $1.78 billion, growing to $3.04 billion by fiscal 2029. How do HRA and OMB forecast the growth of the city FEPS program?
Yes, thank you for that question. So as I noted earlier, I think in relation to shelters, we work very closely with the Office of Management and Budget. We share data with them, and we, work on fiscal forecasts for this and other programs, and reconcile those based on what we're seeing in the program themselves. In cases of rental assistance, the growth we're seeing, the anticipated growth for the rental assistance vouchers and so forth.
Okay, can you provide a breakdown of the primary factors that drive the cost increases across the plan period?
Sure, yeah. I mean, the increase there is, again, new entrances into the program, which I noted earlier was about 15,000 for FY 25. We project what the voucher increases would be. Again, we follow the New York City Housing Authority and their payment standards. Those payment standards are set by HUD. So we project the growth in payment standards, and overall, when you look at the new entrances, the people that are leaving, and the rental assistance, that sets how we project and what we think the populations would be.
How much has been spent to date in fiscal 2026 on city FEPS?
Give me 1 second. So our spending through January was $1.1 billion.
Wait, through January?
Through January.
So that would be, okay, 1
billion.
Okay. And then how much was spent in fiscal 25?
Fiscal 25, we spent just under 1.4 billion.
Okay, and how much of that went towards client benefits?
That full amount was for just rental assistance, so that everything.
Okay,
That's rental assistance, city FABs.
okay. Hold on. We've seen consistent and significant growth in spending and enrollment in the program each year since inception. When does HRA believe the program may plateau?
So I'll jump in. I mean, just looking at the program, which, with the 2 weeks I've had on the ground, there's a lot of need and desire to use this program clearly, and it's helping people. If we keep, of course, letting people into the program, and that's good, and they're moving in out of shelter or avoiding shelter in the first place, but if there's no exit to that program, it continues to grow, essentially endlessly. There's really 2 degrees of freedom, right? There's ins and outs, and if ins are always going to exceed outs, and they are, without any other strategies, then it will continue to grow. There's only so much, of course, that can be done in the middle. We should do our best job to run an efficient program to make sure that we meet rent standards, but with increasing people entering the program and very few exits, it continues to grow.
Understood. As of the preliminary plan, cash assistance makes up 19.4% of HRA's fiscal 2026 budget at $2.76 billion and is baselined at $2.74 billion starting in fiscal 2027. More households are enrolled in and staying on cash assistance for longer periods of time. According to the PMMR, the number of people receiving cash assistance was 604,000 for the first 4 months of fiscal 2026, which shows an increase from that period last year. How do HRA and OMB forecast growth for cash assistance?
Cash assistance, again, you know, we work pretty closely with OMB to project the population for cash assistance. You'll see in the budget, the out-year budget, or really 26 through 28 is flat. One piece that admittedly is a change is mandatory engagement. So we are, you know, working closely with our partners at OMB to try to refine those models. Cash assistance, though, is admittedly a more difficult program for us to forecast.
Okay, and how much was actually spent on cash assistance in fiscal 2025?
In 25, it was just under $2.7 billion.
And what about to date in fiscal 26?
Through January, we've spent $1.6 billion.
Okay. As of March, how many cash assistance recipients, individuals and households, are there?
So the overall cash assistance caseload currently is 585,339 individuals, which is 327,059 cases.
330?
327,059 cases.
Thank you. And how has this number changed over the past several years?
Over the past several years, we've seen the cash assistance caseload increase. Over time, I would say over the last few months, we have seen for the first time it actually begin to decrease a bit. But I think that is a trend that we're continuing to track to determine if that is actually a trend or some other sort of
An anomaly, perhaps?
Anomaly, perhaps.
Because I was going to ask why there's been such a big increase over the years.
I think a big increase over the years is really reflective of the need that has been out there in the community. And, you know, cash assistance, the eligibility determination is very much based upon income, and someone is income eligible or they are not. So we, as an agency, continued to do, you know, that assessment. Starting in 2023 especially, we saw a significant increase in monthly cash assistance applications each month, and that has really continued. We've seen some abating of that, but, you know, we were seeing on average between 45,000 and 50,000 applications for like a multi-year period. And many of those people were income eligible for cash assistance, so they were added to the caseload. So I think it was a reflection of, you know, economic realities for low-income individuals in New York City. And we also made it easier to apply for cash assistance during that period of time. We shifted it to online, so individuals did not have to come into one of our sites, which allowed people to also apply whenever it was convenient for them. And I think that also led to an increase in the applications and access to the program.
That's great. That work is great, and would love to see more ways that we can make it easier for people to access benefits. What services is HRA providing to clients to help them transition from the City FEPS program to full self-sufficiency? And I guess this goes back to your statement, Commissioner. Just, you know, what effort really are we making to get people out of the program once they've been in?
Yeah, no, thank you for the question. I think it's a really important point and an effort we should work on together. So looking at how we can reduce costs of the program, how we can, of course, move people to self-sufficiency. Over that 5 years, there will be a number of people who we can engage in our career and training programs. We can engage in other subsidy programs to reduce the cost of the program overall. And so I think there are really some strategies we can use to help people move to self-sufficiency and to limit the cost of the program so that we can serve more people.
What have you done already to date? I know, you're talking about things you would like to do in the future, which is all great, but I'm wondering what's already been done.
Certainly. So to date, much of that work would have been focused on individuals who are also on cash assistance and receiving city FEPS, and engaging those individuals in the robust career services programs that we have, either through our PACE providers, as well as other programs such as PINK, Jobs Plus, and our Business Link program, which offer a variety of different connections to both training, education, as well as we've developed a lot of very robust partnerships with employers in the community, and connecting people to active employment. So that's work that we have been doing that has been really focused on the cash assistance clients, and I think to what the commissioner is talking about is looking at ways in which we can really expand that to others, people on city FEPS, who could also benefit from those programs.
And what about specifically for city FEPS, not just cash assistance?
Right. So we don't have a separate specific program for city FEPS at this time, but I think that speaks to some of what the commissioner was talking about in regards to, looking forward as well, looking at things that can really be targeted at individuals on city FEPS who may not be connected to other benefits.
Okay.
Right. I think there, as the administrator said, there wasn't a focused effort for city FEPS only clients. It's a great opportunity to work with people towards self-sufficiency, not waiting till year 5, starting early, engaging folks and making those pathways out of the program.
Great. And do you track how many city FEPS clients have fully transitioned to self-sufficiency?
We can get that number. I know our data
That'd be
people
great.
are tracking city FEPS quite closely.
And we would love to see for fiscal 25 and then fiscal 26 to date, as you've been sharing. Thank you. Okay, moving to Community Food Connection, CFC funding. Community Food Connection is a vital resource providing much-needed food to the city's vast network of food pantries and soup kitchens. This program is especially important given the current changes to SNAP as a result of the federal H.R. 1 bill. In the fiscal 2026 preliminary budget response, the council called on the administration to increase and baseline the budget to $100 million to help combat the high levels of food insecurity in the city, which persists today. I was glad to see that as of the preliminary plan, the fiscal 2026 budget for CFC totals $79.5 million. For the first time in the history of this program, the preliminary plan increased the baseline funding by $53.6 million to $74.5 million starting in fiscal 2027. Is the current fiscal 2026 budget for CFC an estimate of the need for the whole year, or do you expect to add more funding in the executive plan?
No, we believe that this will be the full amount for the budget.
Okay, and how will you allocate the additional funding across the CFC network in fiscal 2027 and the out years?
That's a good question. We're still working across our network to work on the distribution plans and our various pantries.
While increasing the baseline to $74.5 million is a substantial add, food insecurity in the city has continued to increase, and the inflationary increase in the cost of food puts a burden on the city's food pantries. Will HRA consider adding annual adjustments to the CFC budget to account for inflation and the increased cost of food procurement?
We can talk to our partners at OMB and our partner agencies and explore that, yes.
I'll take that yes at the end there. What is the actual spending thus far in fiscal 2026, and how much was spent in fiscal 25?
Through January, we've spent $37 million. In fiscal year 25, the program spent $59.1 million.
Thank you. Okay, moving on to HRA staffing levels. As of January 2026, The actual headcount for the agency was 10,821, with 1,696 positions vacant, or a 13.5% vacancy rate. What are the main challenges the agency has been experiencing in hiring new candidates?
I mean, I think some of it has been similar to what Chief Johns has said before, in particular when focusing on case management and caseworker type of positions. But I think we have taken a lot of very, innovative approaches to recruiting non-traditionally as well. So expanding where we are recruiting talent from, and where we can, utilizing incentives, which is we utilize something for the hiring of caseworkers around that. And we will continue to sort of focus with our Office of HR Solutions to identify additional ways in which we can sort of expand recruitment efforts so that more people know about city opportunities and the benefits of actually coming to work for a city agency and the pathways that can provide.
Many of the agency's frontline workers, such as eligibility specialists and others involved with the processing of benefit applications and recertifications, are in very challenging jobs with low levels of pay. Has the agency done an evaluation of salary increases for these positions to improve retention and hiring?
We're always looking at retention and hiring and salaries. Those are conversations that we would also have with the City Office of Labor Relations, as salaries are baselined within negotiations and agreements with the individual unions that oversee those workers.
What is the agency's hiring plan, especially as it relates to frontline client service positions, which I think you got into that a little bit earlier. What are the priority positions the agency is hiring for?
I can speak for HRA. I would say for HRA, we are always remaining focused on our benefit opportunity specialists that are in cash assistance, the ESs who work in SNAP, as well as the caseworkers who work across several of our specialized service programs, including APS, HASA, and domestic violence services.
And I think frontline workers will always be where we focus our efforts, whether on the DHS side or on the HRA side.
What percentage of candidates offered positions accept them?
We'll have to get back to you on that. We'll need to get that data from our HR.
Okay. Do you have any anecdotal information about the top reasons folks may turn some of these positions down or leave the positions after short periods of time?
I mean, for turnover, I will say and acknowledge what you had said, right? Frontline positions in our agency and others are very challenging, right? We are there to support New Yorkers who may be experiencing a particularly challenging time, and so that is something that we really want to focus on and make sure that we are really providing supports to our staff, right? Whether it's through WorkWell or other wellness initiatives, that really helps to balance and really talk about like self-care and what can we bring into these spaces so that staff can really access those, as well as looking at ways in which we can really show staff that we are invested in them and we want to have them with us for a long time. So the development of the staff development that I had talked about before as well, to really, especially for frontline staff workers, outline, right, what are pathways within the agency that one can really sort of advance within it and see, across DSS, HRA, DHS, that this is a place to create a career, which we have, you go to many sites and you'll find people who have worked for our agency for 30, 35 plus years.
And I'll just add that that's a great indication of people wanting to continue to work with the agency, and we'll still always create a need for more frontline workers, right? So even in that scenario, we're creating that gap. People are moving on to other jobs. That's a great story, and we will always there just always will be a full court press on frontline staff and creating the pathways, I think, into those careers so that people can see their future.
Thank you. All right, benefits, assistance, processing, and hiring plan. According to the PMMR, there's been a steady high participation rate in cash assistance and SNAP. with 604,000 individuals receiving cash assistance and 1.75 million individuals receiving SNAP in the first 4 months of fiscal 2026. What is the average monthly volume of new applications and recertifications for each SNAP, cash assistance, and Medicaid? And would love a comparison to pre-pandemic levels if
Of course,
possible.
I do have that.
Great.
So the average monthly cash assistance application volume is 46,901 for FY26 to date, and that is an increase of 77% from the same period in FY19, which was an average of 26,494 per month. On SNAP, the average FY26 to date monthly application volume is 29,454, and that is an increase of 14.9% from the same period in FY19, which was an average of 25,630. And then for Medicaid, the FY26 year-to-date application volume is 28,553, which is a 9% decrease from the FY19 year-to-date average of 26,186. I'm sorry, that is an increase, not a decrease.
Oh,
Yeah.
thank you. You said the 28,553 is year-to-date for fiscal 26.
FY26, and then it's a 9%
Increase
increase
to
from FY19, which was
26,186.
26,186.
Okay, got it. What percentage of applications and recertifications are denied?
I don't want to speak extemporaneously, so I will get back to you on the specific numbers because I know it has transitioned, and I think it might be in my book, but I don't know that I underline that, so we'll get back to you.
Okay, and the reasons for denial would also be helpful.
Absolutely.
And are there bigger delays in each program processing new applications or recertifications?
No, there are not. We have the extensive delays and backlogs we saw several years ago have been cleared, and they have remained cleared.
Have been fully cleared?
Yeah, the backlogs have been fully cleared and have remained cleared. We obviously still focus on our timeliness rates, right, and are always looking to increase those. But I will say, for a majority of applications that maybe are not done within the 30-day window, they are done shortly afterwards.
Okay. According to the PMMR, in the first 4 months of fiscal 2026, the cash assistance processing timeliness rate was 67%, and the SNAP processing timeliness rate was 89.9%. While these are improvements from the prior year, they're still below your target of having 95% of benefit applications processed within the state's required 30-day timeframe. What is the current timeliness rate for cash assistance and SNAP for fiscal 2026?
The cumulative rate, I will have to get back to you, though it is remaining consistent with those. I will say on cash assistance, there are some managerial and systems things that we are soon to be implementing that will increase that as well. There's, I don't want to get too weedy, but there's
Get weedy.
There's different, on cash assistance, there are certain cases called single issuance or one-shot deals where the benefit is given to an individual, but there may be a system delay in actually officially closing the case, but the timeliness is only calculated
Tied
on
to
the
the-
closing of the case. So we're working on making sure that that closing of the case can happen automatically, so it will truly reflect that
Automatically at the time the
of
one-shot
issuance
deal.
of the benefit, right?
Okay, because my question was going to be, what would cause the discrepancy between the issuance and closing the case?
It may be staff member delay in going back to officially close the case.
Oh, okay.
And other things. So we're just looking at instances there.
Sounds like a simple fix.
So we definitely still, we still have ways to go, but we're implementing a variety of, management and tracking tools to further increase timeliness to get to the 95% targets.
Okay. And I think that was everything from here. Okay, staff retention rate, going back to this. While the preliminary plan has included additional positions for adult protective services, caseworkers, and SNAP eligibility specialists, there's a growing concern over staff retention and lack of institutional knowledge, which both have a direct impact on agency operations, client service, and benefits processing time. IBO found that many APS caseworkers hired leave within 1 year of their start date, and that more than 40% of the active eligibility specialists processing cash assistance or SNAP applications have less than 3 years of experience. Given that many hires are new to subject matter of their roles, how is HRA ensuring that APS caseworkers are able to meet the demands of the job and navigate the technical complexities of their work?
Certainly. So we focus a lot on training and onboarding of new members. There's also, lots of desk training and other training going on within the offices. So newer workers who, are joining, right? We make sure that we utilize workers that have a longer experience time, right, to help individuals and explain to them what's going on. And we are constantly evaluating, right, what additional trainings can we provide to APS workers, similarly to what we're doing on the SNAP side, right? In regards to, in the SNAP world, yes, and cash assistance, we onboarded over 1,000 new staff members over the last several years, and have really focused on training in those instances, especially increasing in-person trainings versus virtual trainings. And as we said on the SNAP payment error rate, we've been able to onboard 20 new trainers who will actually spend their time in these locations working with the benefit workers to address any gaps in knowledge and address any changes that need to be done in regards to how individuals are processing their work.
And what are the current retention rates for the key benefit staff, including cash assistance, SNAP, APS, Medicaid, and city FEPS?
I believe we'll have to get back to you with those rates on those programs.
Okay, thank you. We'd like to get a better understanding of the budgeted and actual staffing levels for key benefits programs. How many budgeted positions are there for roles that support the administration of each of the following programs? SNAP, cash assistance, Medicaid, and city FEPS.
So budgeted for SNAP is 1,324. Cash assistance is 1,718. Medicaid is 855. And then city FEPS is 161. But I would say that with the same caveat I did earlier in regards to that's like specific processing, but there are far larger numbers of people who work on the city FEPS program.
Okay. So 1,300 people for SNAP to manage almost, 29,500 applications monthly? Is that
Yes.
accurate? Okay. And 1,700 people for 46,000, almost 47,000 cash assistance roles.
Yep.
855 for almost 29,000 a month for Medicaid, and 161 plus, we'll say, for, well, we didn't get that one for you for the city FEPS. Okay. All right, I think the caseload sounds extreme.
It is large numbers, I will say. The SNAP, cash assistance, and Medicaid programs, and city FEPS, they don't operate on a caseload basis in regards to like a worker is assigned specific cases.
Right.
That's how we used to work when individuals had to be assigned to a specific center, and that's the only place they could receive services. When we moved to a citywide approach to this, the way in which things work is we have systems where workers can just take the next case that is in front of them. It can be from anywhere across the city, which is a far more efficient way for us to actually process the work and make sure
Yeah.
that we are moving through the work correctly. But yes, it is a large.
I guess
it is a large
workload is
volume.
maybe the word I should have used, but either way, it sounds like it's a lot of work for not that many people. By program, how many of these positions are currently filled?
for SNAP, the latest number I have is 1,093 for cash assistance. I have, shoot. You know, I don't have the head count for cash assistance.
Okay, what about Medicaid and city FEPS?
Yeah, let's do those. You know, actually, City FEPS also, I only have the programmatic budget, so we'll get back to you on that one.
Okay, and Medicaid?
And Medicaid, 48. $710.
710,
Yeah.
okay.
I
thanks.
would also note, I think our numbers are a little older, so we'll make sure we'll
Follow
follow
up
up
with
with more accurate
Okay.
count numbers.
Thank you, and what's the average salary for each position?
I'll also have to get back to you on that. I don't have that with me.
Okay. Is the need greater than what is budgeted? So given the workload, you know, and the number of employees that you have, and the retention rate, and the timeliness rate, do you think that the number of employees you have currently is sufficient?
I think our headcount as budgeted is sufficient. I think as we discussed earlier, making sure that we are keeping all of our vacancies filled is really a priority for us. And then that will really indicate to us if there are still gaps in staffing or not. But I do believe, you know, the budgeted headcount we're seeing in the SNAP cash and Medicaid program, you know, we are able to, you know, manage the volume. There are obviously months that may be a spike that is an anomaly, but our focus is really on making sure that we're as close to the head count as possible, and then that can inform to us if we think there might be an additional need, and if so, we would then have a conversation with OMB.
Okay, that's fair. Is HRA currently using overtime to meet the demand?
We do utilize overtime within the programs as needed. You know, we have not had to utilize mandatory overtime in a very long time, except in a few specific instances that were, again, anomalous.
Okay. Would you happen to know how many hours and what the cost is for the few occasions you've had to use it?
For mandatory overtime, we'd have to get back to you on that.
Any type of overtime?
Right. I think we'll get back to you on that. I'm assuming it's in relation to those programs you're talking about, correct?
Yes.
Okay.
And we just talked about this, but I was doing just my own, I didn't even do the math, I'm just looking at the numbers. But I would love to know if you have the current case ratio for SNAP, cash assistance, Medicaid, and rental assistance, and how that compares to the optimal case ratio.
We can get back to you on that. I think we need to talk to our folks about cash and SNAP because we don't think about it in case ratio.
I was going to say perhaps
So
work ratio or
work
whatever metric you want to
we can
call it.
we can come back to you on that.
Okay, great. All right, moving into City of Yes. The City Council secured $5 billion in commitments as part of the City for All housing plan in recognition of the importance of advancing a holistic housing plan that could support working and middle-class New Yorkers and invest in solutions that meet their housing needs. Of the $5 billion, $187 million was committed over 10 years for City FEPS vouchers and social services to create permanent homes for those in the DHS shelter system. This commitment included an investment of $122 million over 10 years for affordable housing service contracts. Was the funding added as a new need for affordable housing services in the preliminary plan part of this commitment?
Yes, it was. We did, as part of the preliminary budget, hold on one second, I'm so sorry. It looks like we have $215 million for the City FABS vouchers across.
215?
Yeah, let me make sure. Hold on, I'm sorry. You know what, that actually is the part of the original commitment, which covered fiscal years 25 and 26, so,
So no,
yeah.
it wasn't added as a new need.
It would have been, but not in the preliminary budget. The previous budget.
Sorry?
It was added previously.
It was added previously, hold on. Oh, affordable housing services specifically, not overall city FEPS.
Oh, I'm sorry. Yeah, I mean, no, the affordable housing services money that was added to the budget, like the rest of our CLIFs, was added to cover our anticipated spending for the AHS program, as per the previous administration's commitment.
Okay, are you working with other city agencies on this?
I mean, we do work with other city agencies on the construction. AHS is a program that largely develops new affordable housing programs, so we would work with the normal city agencies like HPD or City Planning and Department of Building on AHS.
Okay, and how many new units will be available with this funding?
Right now, we have we financed about 491 new units. We have additional units in our pipeline.
How many additional?
226.
226. Okay, thanks. And then
I'm sorry. I'm
yeah.
so sorry. I gave you last year's number. The current number of active units is 561, and we have an additional 226 in our pipeline.
226. Okay, and then how many of them are currently used by voucher holders?
AHS is,
They all would be.
Yeah.
AHS is
100%.
financed based upon city FEPS.
Okay. And when do you expect all of the new units to come online, those additional 226?
One building, I believe, is more imminent, but I can get some clarity from my development team to understand when those two, we should see them available and see move-outs.
Okay. And what's HRA's process for selecting and placing city FEPS voucher holders in those units?
We look at it in the same way that we look at any rent above a building in regards to, we will work closely with our DHS colleagues to, let them know that a new building is coming on in a certain number of units, and then we will work together to target appropriate referrals to those buildings. Those buildings, I will say, tend to often rent up relatively quickly.
It's crucial that the funding allocated as part of the City for All commitment is targeted to those at the highest risk. How is HRA ensuring that the most vulnerable people are reached with this funding?
Similarly, similar process, we work very closely with our colleagues at DHS, depending on the affordable housing, site and what specific services it may or may not offer. So, because we want to make sure that we are making the most successful permanent housing connections as possible.
Great. Okay, give me just one moment, please. Okay. Rental assistance programs and source of income discrimination. In March 2026, a panel of 5 upstate judges ruled against the landmark state law that bans discrimination against people who use government assistance to pay their rent, stating that it violates the constitutional rights of property owners because the program requires building safety inspections. Has HRA evaluated the potential implications of this ruling for the city and specifically for the city FEPS program?
I think we are currently assessing its potential implication for the city.
Okay. It can't be good, I would state. To date, how many source of income discrimination complaints have been filed by HRA clients attempting to use city FEPS vouchers in fiscal 2026?
So source of income discrimination complaints would actually be directed to CCHR.
Yeah,
So
but
I
you don't know how many of your clients might.
I don't have that information here. We can look
Okay.
to see if we have anything, but CCHR would have the official numbers.
Okay,
that they
we'll make sure to ask them in that. And then how does HRA work with CCHR to address source of income discrimination complaints from clients attempting to use city FEPS vouchers? Is there anything like, do you make sure people know their rights, the law, et cetera?
Yes, throughout the process, we make sure when individuals are utilizing a subsidy that they have information on their rights, if they think that they are being discriminated against, how they can go about filing a complaint. And then obviously, if CCHR reaches out to us, we would engage with them fully to support whatever they might be looking at that impacted our clients.
And an ongoing concern, sorry, I'm moving to domestic violence services. An ongoing concern of both the council and advocates for several years has been the adequacy of the city's DV shelter capacity to fully meet the need. Many individuals who would benefit from the specialized services available in DV facilities end up in the DHS shelter system where such support services are not available, even though they're deemed eligible for DV shelter. I understand that the current DV capacity includes 2,290 emergency beds and 628 units in DV Tier 2 facilities. These figures have not changed since fiscal 2024. Does the current DV shelter system have enough capacity to meet the level of demand? And also, I would just ask, and I don't know if you have this or not, but I know that DV cases of domestic violence went up significantly during the pandemic, and so I'm wondering if those numbers now are similar to those numbers or if they're more similar to pre-pandemic levels.
I do not have that data with me, but we can look into it. And you are correct on the number of domestic DV shelter beds that we have. I will say, though, that we work closely with our DHS providers, and they are required to make sure that they are connecting families who are experiencing domestic violence with appropriate services. At times there are decisions made by families who would prefer to actually go into the DH system rather than come into the DV system. So we're constantly...
What are some of the reasons for that? Do you know?
I think that there are, in the DV system, there are some additional sort of rules and requirements that need to be complied with in the system that aren't necessarily the same rules and requirements in the DHS system. Much of the DV system is, the emergency system especially, is overseen by the Office of Children and Family Services at the state, so they really dictate to us all of the real regulations, and they're more of the direct oversight of those systems, even though we facilitate it on our end. Much of the operations of that system are really dictated by OCFS.
Can you share any details about additional Tier 2 units or emergency beds that might be in the pipeline?
We don't have anything specifically that is currently in the pipeline, but we are constantly, looking and assessing and discussing with our partners at OMB if more beds would be, appropriate. I think one of the challenges in the DV system as well is for a family or an individual, a single adult, there may be multiple factors that need to be taken into account around placement, which is why we're very thankful to our colleagues at DHS. That sort of provides additional coverage because I think, map out and try to understand within the DV system the location, size, and other units that we would need across is challenging, which is why the close partnership with DHS helps to ensure that we're able to place families and individuals.
What's the average vacancy rate for Tier 2 units and DV emergency beds?
Sure. So the the emergency beds has an occupancy rate of, as of December, of approximately 85%. And I will get back to you on the Tier 2 because I don't seem to have that here on this sheet, but we'll get back to you.
And how's DHS working to better address the unique needs of those impacted by domestic violence who reside within the regular DHS shelter system?
Thank you for the question, Chair. As we do around all needs of our clients, constantly working with our city partners, including the Mayor's Office to End Gender and Domestic Violence, around best practices, training materials, engagement strategies, going out into shelters to make sure that our staff, our provider staff, is comfortable having conversations around domestic violence, that they're doing it with sensitivity and empathy, and making sure that the warm handoffs from the DV system continue, so that if they're non-residential services that somebody is receiving, they continue to get those with us.
And we also, I'd just say, also make sure that we coordinate closely. HRA runs a series of non-residential programs, as well as our colleagues at NGBV. So we have closely connected referral pathways between us as well.
Great, thank you. Okay, going back to asylum seeker response. As of February 28th this year, there were 29,809 asylum seekers within the city's care, mostly in the DHS system. DHS will be taking over as the lead agency in the city's response and integrating asylum seekers into its existing shelter system, as we discussed. DHS's preliminary plan includes $1.15 billion in fiscal 26, $1.2 billion in fiscal 27, and $498.4 million in fiscals 2028 and 2029 for asylum seeker expenses. How are these costs estimated, and what services are provided with these funds, and how do they address the unique needs of asylum seekers? You addressed that earlier, but how are the costs estimated, and what services are provided?
The Special Population Support Services funding in the budget is somewhat of a legacy budget. If you recall, when other agencies were operating different shelters, all of the budgeted funding was placed within DHS's budget, and then it was allocated on a periodic basis. So the budget that we have now is based on our best projections of how many asylees that we would serve, but the dollar amount and how it was set is largely done on earlier projections from past years.
Okay, thank you. And the enhanced cost of the provision of shelter for asylum seekers during the Adams administration was a result of the reliance on emergency contracts, including those for hotels that were held by agencies outside of DHS. You may know that the Speaker's Bill on Emergency Contracting, Intro Number 2, is now on the mayor's desk awaiting signature. It limits emergency contracts to 90 days unless prior approval is granted by the comptroller, and requires audits 15 days after execution. If a contract is not submitted for audit within 15 days, the contract would be voided. The council passed this bill to save the city money on expensive emergency contracts and to ensure procurement goes through the proper channels. Does DHS have any remaining emergency contracts related to asylum seekers?
We're currently in the process of transitioning emergency contracts that will end in June to new contracts effective July, standard shelter contracts.
Okay. So no additional services or programs will be contracted post-July?
I can speak only to the shelters that were under contract under the emergency contracts.
Okay, thank you. And how much do you anticipate the full integration of asylum seekers into the DHS system will impact costs?
I would defer to Chief Johns. However, our system is integrated in that as clients are coming in, they're being placed in the shelters that are available at the services that are available. So I'm not sure that there's a...
If the out-year projections are accurate, then it seems like there will be a cost savings, but...
Yeah, I mean, generally speaking, the shelters that are moving into the standard shelters would be cheaper.
Okay, this might be a little redundant, but will there be any cost savings realized by this integration, given that DHS already is experienced in the provision of shelter?
No, I mean, we're not projecting cost savings as it relates to that. I mean, if you look at the budget historically, you would have seen adjustments made to the budget related to the change in the population, but not related to the integration.
Okay, thank you. Okay, and then just some follow-up to Councilmember Nurse's questions earlier. On February 19th, Gothamist reported that the administration would restart homeless encampment sweeps, which had been paused earlier in the year. Given that the mayor had been critical of sweeps conducted under the de Blasio and Adams administrations, this was a bit surprising. The administration has stated that DHS will be the main responding agency for future sweeps, whereas NYPD was the primary responding agency in prior sweeps. Can you share more about what this would look like and how it would be different from past sweep operations?
Sure, I'm happy to start here. And as I said, I think the move to have the Department of Homeless Services take the lead makes good sense. And I personally don't think of these as cleanings or sweeps or moves, but as focused housing efforts. We focus our housing efforts on all different parts of the population, whether it's at the end of the subway line, or I've heard about, the top 50 list of people we're really focused on who have really entrenched needs. Why not focus on people who are staying in a specific place and make sure that they have focused outreach and support around housing and next steps? So yes, I think DHS is the right lead. These are the outreach workers who've built the relationships. We know where the spaces are. Then we can also hear firsthand what people need and want and make sure that those offerings are available as we do our planning for the future, making sure that people's stuff is cared for, understanding their family situation, and making sure they're placed in the best possible environment.
Okay, thank you. And what if the sweeps encounter a homeless individual in the encampments who doesn't want to enter shelter? How will that be handled?
Yeah, and I haven't even had a chance to sit in with the teams yet to understand what they do, so I don't want to answer there. But I think, we do want to be pursuing relentless engagement, and we certainly cannot force people to take shelter options.
I would say that's a good answer.
Okay.
All right, how will folks who are encountered be connected to services and shelters? So I know you're not deep into this yet, but my understanding is that you have some experience in this area, so maybe we can speak a little aspirationally about what should happen and what the best...
Yeah, I would love to. I think it is actually important to set kind of non-negotiables for the way we engage with people. I did want to know in my previous job and want to know here the by-name list of people that were engaging, their housing preferences. We had a specific housing preference form to understand what people preferred and other social services they needed. I want to know what we offer to people, and I want to know what they will do, given that the place that they've been staying will no longer be a place that they can stay in the future. And I think in my experience, which may vary as I come here, most people, if offered the things that they really need, will take those offers and be stably housed, at least for some period where we can start to provide other social services.
Okay. A common criticism of sweeps in the past has been that many unsheltered people's belongings were thrown away. How will you ensure that this doesn't happen?
And I will be happy to let the administrator speak about this as well, but I think that, that kind of practice should not be allowed. We should understand what people have with them, what they will be able to take with them, and what they want to take with them, and make sure that those materials get inventoried and that they can retrieve them. And then anything that is left, we mark as left, right? I think it's also really important to our partners who do the actual cleanups to make sure that we haven't left something behind that people want, right? We have to leave that space clear for them to do their proper work. So I think the issue of people's belongings is a really important one.
Okay. And, I know, again, you're still just getting your feet under you, but in past cases, we've seen, Department of Sanitation that's usually engaged in these types of sweeps, literally throwing people's belongings right in front of them into the back of the sanitation trucks. items for their children, and obviously just valuable items to them deemed invaluable by, city employees. So just flagging that for your awareness. Did you want to add anything, Administrator?
Thank you, Chair. I would just add, as the Commissioner mentioned, especially for those who have accepted placement, making sure that we're working with them to bring in items within limit, things that are important to them, but also ensuring that we're maintaining the health and safety of all of our clients.
Understood. Do you have lockers or storage for sweeps?
Yes, there is storage that DHS manages, so we will kind of inventory with the individual what they're not going to take with them, and we will store that for them.
And I assume that's free of cost?
It is free of cost.
Okay, thank you. And again, you may not have this direct information right now, but how will but you might actually. So how will DHS identify encampment sites for sweeps? Like, do you have already a list of locations identified?
We do, and we work with our partner agencies, elected officials, community members to identify and assess areas of concern. So this is an ongoing practice.
Okay, thank you. Capital? Okay. All right, I think we're getting into the home stretch here. Capital plan budgeting. In the recently released preliminary capital commitment plan for fiscals 2026 through 2030, both HRA and DHS had virtually no changes in funding since the adopted capital plan. No funding was adjusted for any of the major HRA capital projects, such as computer equipment and technology upgrades, improvements to HRA facilities, or communication systems. In DHS, no funding was added for the single-room shelter units in Upper Manhattan that the administration announced in February. The Bellevue Men's Shelter and Intake Facility, which will be closing this month for repairs, also did not receive any additional funding, nor did the East 3rd Street and Bowery shelter sites, which will become intake centers following Bellevue's closure and may require capital funding to accommodate more clients. Why were there no adjustments to the capital budgets for HRA and DHS?
Yes, thank you for that question. There are a number of initiatives that you had noted. Some of them we didn't have the estimates prior to the capital plan locking, but for the most part, we've worked really closely with our partners at the Office of Management and Budget, particularly through the last number of months to align our capital budget. So while we didn't add money, we are moving money around to ensure that we have funds in the places that we think will need it. And we also have money in lines where we can move it and make it available. But at the time of the capital budget, we did not have a need to make a request for additional funds.
Okay, that sounds like a bit of a budget dance there. You're saying you're just going to move funds for certain projects to other projects?
No,
or?
what I'm saying is that there are some needs like Bellevue, which we didn't know at the time
Right.
of that the budget lock. So there will have to be adjustments made for that. But there are some needs that we are aware of. We've been at some of our sites that is
That you're saying you have
currently
the funding
in budget.
for?
Yeah.
Okay,
Yeah.
all right.
For example, and at the risk of adding an example where I could be wrong, but being at 80th 3rd a few times now, I believe, for example, that there's an elevator upgrade that has already been budgeted as part of the normal capital planning
Okay.
for the existing site.
Okay,
Correct.
got it. Okay, thank you. So, and then I guess this goes back to your earlier statement. Has capital needs assessment been conducted since adoption?
That's a good question. I'll have to get back to you. That's not in my area, but we'll get back to you on that.
Okay. And how often are capital needs assessments required?
Again, yeah, I'm sorry. I'm just not aware of that. I mean, we will get the information to you.
Okay. Okay, then you might have the answer to this one. Has an assessment been made of what repairs are necessary at Bellevue and what the capital cost may be?
I don't think there's been an assessment of that done at this time.
Okay. Alrighty, we'll follow up on all of those. Okay. Right. Okay, all right, thanks, okay. Okay, more City FEPS. City FEPS has grown exponentially since the inception of the program in 2018. The initial budget for City FEPS was only $26.3 million, growing to $1.78 billion in fiscal 2026 as of the preliminary plan, and growing to a projected budget of $3.04 billion by fiscal 2029. As the program is approaching the 1-decade mark, we would like to discuss key takeaways and what the future of City FEPS could look like. Can HRA detail what has worked effectively within the City FEPS program, what has not worked, and what lessons have been learned since its inception?
I think we're very happy to set up a separate time to sort of go more in depth there on that. But I think the program has been very successful in moving people out, right? Connecting people to permanent housing. I think, it's very clear that the program has effectively done that. I think, as the commissioner said, right, we do need to look at, ongoing of the program, right, from a sustainability point of view. But I think that, it has proven itself to be a respected tool within the community in connecting with landlords. So that, I think, is proven in the 66,000 or 68,000 households currently utilizing the program. There are obviously things we're going to be looking at in regards to ongoing, management of the program, and how can we make sure we're effectively connecting people to services that also offer a off-ramp from the program, because we've connected people to good paying jobs and employment that allows them self-sustainability, and those are, I think, some of the key things. But we are happy to set up time to discuss at further detail.
Okay, that sounds good. I look forward to it. But just to clarify, some of the workforce programs, it sounds like, are improvements that you might want to make in terms of.
Yeah, some of the City FEP specific targeted programs that we had discussed before. We hadn't had just one that was specifically focused on City FEP. So that is, I think, one of the things we would be looking at to connect more individuals to services that can support them in, the progression of an individual's career.
Okay, sounds good. What is the number of City FEPS voucher holders who lost their housing and subsequently returned to shelter within 1 year in each of the fiscals 2024, 2025, and 2026 to date?
We'll have to get back to you with that data.
Okay. And also, I'd like to know how many returned to shelter within 2 years. So within 1 year and within 2 years. There have been multiple studies and reports analyzing whether the efficient utilization of City FEPS could offer potential savings for the DHS shelter system by providing New Yorkers permanent housing and helping them avoid shelter. Can you walk us through how the monthly cost of shelter compares to the monthly cost of rental assistance vouchers?
Yes, I'm sorry, I am on. Yes, I can do that. So the shelter system is paid on a per diem rate. So if we think about just a single adult, it's probably a little easier. It would be about $4,600 per month for shelter, and that would compare to
Sorry, what was that number?
$4,600 for shelter.
Thank you.
Yeah. And comparing that to the City FEPS rate, where a studio apartment would be $26.46 as our payment standard.
Okay. In the long term, how do the cumulative costs of shelter and City FEPS compare?
That's a good question, and it's a hard one to answer. I mean, a lot of the driver for the two programs is on length of stay.
Is on what?
Length of stay.
Oh, length of stay. Mm-hmm.
Yeah. And generally speaking, people would stay in rental assistance or housing longer than they would shelter.
Okay, has DSS seen DHS shelter savings as a result of the current City FEPS program?
So I shouldn't answer that question, especially when we've got the shelter numbers in front of us and a direct kind of correlation or causation even between those two programs. But I think just to add that I think the way you're thinking about it, the questions that you're asking are the way I'm thinking about it as well. If we're going to invest in programs that help to support people into affordable housing with subsidy, we've got to see savings somewhere. And I'd love to see them in the shelter population. I think that's where everyone would love to see them. All things being equal, everyone prefers housing to shelter, whether that's the individuals being served, us, I think, as officials, as well as the community, right? So we want to see that happening. So that is the way I'm starting to, as you know, in the first couple of weeks, looking at both of those budgets together and how do they impact one another so that we can house as many people as possible and see reductions in shelter.
Thank you. City FEPS is a crucial program for helping families and individuals leave and avoid re-entering the shelter system. We've seen consistent and significant growth in spending and enrollment in the program each year since inception. City FEPS enrollment is reaching a point where voucher holders are entering their 6th year and beyond in the program. We would like to learn more about this specific subset of voucher users. Currently, by household, how many City FEPS voucher holders are in each year 4 and 5 of the program, and how many are in 6 or beyond?
We can get back to you with that data. We have it. I just don't have it here with me, but we can follow up with you.
Okay. How many households have been in the program for less than 4 years? Is that where the other numbers are?
Yes.
Okay, so for that, I would like 4 years and then 3, 2, and 1 year.
Certainly.
So basically.
How many are in each?
Yeah.
How many people are in each year of
You
their
got
time in
it.
the program?
Thank you.
Got it.
On average, how long do clients stay in the City FEPS program?
We have seen that year to year there is not a lot of drop off where folks are renewing and they continue to be eligible. We don't see an extensive amount of drop off, throughout the program, but we can follow up with some more details on that.
Okay, so this goes back to your earlier point, Commissioner, that once you're in, you're basically in the program. It's not really.
Right, unless we do the work that the administrator has been describing.
Right.
To really work with people early on.
Okay. How many City FEPS households currently have earned income?
We can get you the specific number, but I think it is about 25 to 30% in that range.
And then on average, what is the household contribution amount for City FEPS voucher holders?
It's 30% of income. We can get back to you what those dollars may look like, but it's 30% of income.
Yeah. Okay, that concludes my questions. Thank you all very much for your patience. And Commissioner, I will just say that usually you all leave and then we have public testimony, much of which I think you should be present to hear. And thank you. And I'm making this as a general statement for your awareness. We're always told by the administration that somebody in some room somewhere is watching online, which I believe to be true. But I do think it's really important, especially given this topic, that folks stay. And so I recognize that you're not always going to be able to stay for the entirety of the time. I certainly, as the chair, am committed to being here for the entirety of the time, but I would ask that whether now or at future hearings that you make a real concerted effort to ensure that members of high-level senior members of your administration remain in the room to hear public testimony. Thank you. Okay, I think we're going to take maybe just a 3-minute break to transition here. Thanks. Okay, thank you all so much for your patience. I'm now opening the hearing for public testimony. And I want to remind members of the public that this is a government proceeding and that decorum shall be observed at all times. As such, members of the public shall remain silent at all times. The witness table is reserved for people who wish to testify. No video recording or photography is allowed from the witness table. Further, members of the public may not present audio or video recordings as testimony, but may submit transcripts of such recordings to the Sergeant-at-Arms for inclusion in the hearing record. If you wish to speak at today's hearing, please fill out an appearance card with the Sergeant-at-Arms and wait to be recognized. When recognized, you will have 2 minutes to speak on the preliminary budget for general welfare. If you have a written statement or additional written testimony you wish to submit for the record, please provide a copy of that testimony to the Sergeant-at-Arms. You may also email written testimony to testimony@council.nyc.gov within 72 hours of this hearing. Audio and video recordings will not be accepted. The first panel is, and forgive me in advance for mispronouncing any names, Anthony Lackham, Chandra Smith, Lisa Reimer, Naveen Swalmain, Mun Clifford, Abby Bieberman, and Melody Crowell. Okay, Abby Bieberman, is that, no, okay. Okay.
Abby will come on us while we with legal services.
Oh, okay, but she's not here.
Abby, we will go on a follow-up.
Abby will go on in the next one. Thank you. Okay. Thank you so much. We will begin with Anthony.
Hi, I'm actually here for support.
Okay. As in you're not testifying? You're just,
Yes, I'm just
okay.
here to support.
No problem. Thank you for your support. Chandra?
Hello, my name is Chandra Smith. I am an eligibility specialist for the Human Resources Administration. I work in Brooklyn and I process SNAP benefits for congregate care facilities and Social Security recipients. The recent budget cuts have impacted us tremendously. We are working understaffed, and the human aspect is really lessening. What we want is to be able to process the applications and know who we're processing for. The people in the community are our neighbors. The people that come in that need social services all need to have a human interaction. And with AI, we can't really get that human interaction for the whole to better the experience. All right, when they're applying, they have different circumstances. All of the people are not the same. And with AI coming in, what they do is pretty much generalize everything that they lump them into different categories. And that experience has led to some people not getting the benefits that they need.
I'm sorry, just to clarify, AI is being used currently as part of the application process?
Yes.
Okay.
Yes. Yes, it's less staff, and with the system being updated constantly is causing a lot of issues. Some applications are not being processed in a timely manner. There are applications that are being denied because of the machinery. And it's just,
Do you know when, or do you recall when you started to use AI?
no, I don't recall.
Okay. We'll follow up with the agency.
Right, I don't recall.
Okay. Let me just run through the full testimony, and then I'll come back to you. Is that the end of your testimony?
I guess so, yes.
Okay. Thank you so much. Lisa?
Hi, my name is Lisa Reimer. I'm also an eligibility specialist. I work for SNAP as well, but I work at a Bronx location. The reality of it all is that machines do not have the capacity to practice empathy. And when people come into the centers looking for help from the Human Resources Administration, as an eligibility specialist, you are making a determination on what is happening right before your eyes in real time. Again, just to piggyback off of what Chandra said, you watch it as it happens. When you're going to work, when you're leaving from work, it's our neighbors, it's our families, it's people who know our communities as well. And if a machine is allowed to make this determination, there will be a lot of hungry families, which makes other things happen because it's a raindrop effect, right? So it's imperative that we keep the personal touch, because what is occurring with people is not happening to a machine. So with the delay in services being processed for families, individuals, our communities, so to speak, when there's an error, you need a person to fix that error. Because if the person is entitled to the benefits, then they should receive them in a timely manner. So again, with all of the updates and the things that they are making interact with our jobs, it often causes confusion, and there's a constant state of hysteria. Because we are mandated to make sure the benefits are secured and issued to said families that deserve these benefits, but they don't think about how the machine is messing up the function. So again, a delay that you need a person to fix. So it's very important that we use it as little as possible, if not at all.
Thank you.
You have to worry about, like, just the kids, watching the kids and going to school, and if they can't eat, your brain needs food to function.
Yeah.
How are you preparing them for anything better? And if we are showing them the way by keeping the people in their jobs to do what is needed for our communities and for the city of New York, then, you know, it's very important that they weigh it. We should not cause families to be collateral damage.
Right.
Because we're trying to save money.
Yeah. Thank you so much for your
Thank you.
testimony. Thank you both. Naveen Swalmain.
Hi, my name is Naveen. I want to start by thanking the folks on the panel for their testimony, and thank you, Chairperson Hudson. My name is Naveen Swalmain. I'm the Health Justice Advocacy Manager in the Health Justice Program at New York Lawyers for the Public Interest. We urge the Council to continue and strengthen support for the Immigrant Health Initiative, a program that saves lives every day. It funds more than 20 nonprofits, including NOPI, to provide legal help, community education, hospital partnerships, and critical medical advocacy for immigrants across our city. Access to healthcare remains limited for more than 400,000 undocumented and uninsured New Yorkers. With the council's support, we've increased enrollment in state-funded Medicaid and the Essential Plan, changes that are life-saving and cost-saving for the city and the state. In 2025, NOPE screened 85 people with serious health conditions such as end-stage renal disease and HIV for immigration and health benefits. We also trained hundreds of caseworkers, medical providers, community groups, and legal service organizations citywide. As more New Yorkers are detained in immigration jails, NOPE remains one of the few organizations addressing the severe health risks inside these facilities. We continue to provide culturally competent legal representation, including for transgender, gender expansive, and those living with HIV. Yet major gaps remain. HRA needs staffing, multilingual capacity, and targeted funding to reach Black and LGBTQIA immigrants who are facing the highest health disparities. HRA, which serves over 3 million New Yorkers, continues to struggle with delays, high caseloads, and inconsistent case handling. When HRA is under-resourced, people go without food, medical care, and housing. We see the impact daily. One of our clients, a Black LGBTQIA asylum seeker with a chronic health condition, spent months trying to secure Medicaid despite being eligible, repeatedly turned away, denied interpretation services, and was ultimately hospitalized, something that was entirely preventable. New York needs more navigators, stronger training on immigrant eligibility and disability pathways, and clearer multilingual materials so people can enroll and stay enrolled. Thank you for the opportunity to testify today, and we look forward to doing this critical work together.
Thank you so much. Munn Clifford. Melody Crowell. Oh, okay, yes, sorry. We'll put you on the next panel. Thank you. Melody Crowell.
Good afternoon. My name is Melody Crowell. Thank you for allowing us to speak today. I am an Associate Boss Opportunity Specialist, ABOS, for the past almost 8 years, but before that I was a regular worker, a boss. I've seen a lot of transition in HRA during this time. I don't like it. I've seen a lot of outflux of boss and ABOS retiring, resigning. It's a lot of pressure, especially with the different programs that have recently been implemented in the last couple of years, such as CA Demand, SEAMS. Some of those programs to me don't make any sense because what we already have been using worked effectively and efficiently, so I didn't understand why we doing this, and then certain part of those particular programs don't carry over certain functions, so we run into a lot of error, as my co-workers have said over here before. Also, people are dealing with, like I said, a lot of stress, with management practices are not that great. The increase in applicants for cash assistance, less staffing. We voluntarily have to work on the weekend to keep up with our cases, processing, single issuance grants, single issuance cases, recertifications, et cetera. I do it because I know the work has to get done. We have a job to do, a service to do to the people that we serve in this wonderful city. And I just like to be able to continue to do my job efficiently and effectively with the best support as possible. So thank you.
Thank you. And then did you want to add something?
Yes, please.
Go ahead.
So I saw you ask the question about AI.
Mm-hmm.
So first, Anthony Lacken. I'm actually the president of Local 1549.
Okay.
Before I started that role, I was an eligibility specialist working in home care. I say that to tell you, everything everyone said on here, I agree with. Last year, during the holidays, the agency reached out to myself and 371 and other unions to ask us to have our workers work overtime, mandated overtime, and we asked why, and they said because a private agency that they had hired, who uses AI, messed up, and there were over 30,000 cases that were not going to be completed because AI couldn't do it or messed it up, And then my eligibility specialist had to pick up the slack to get that completed. So when we're talking about AI not having the ability to feel, he also doesn't have the ability to complete the work to be done in a timely manner or
And
accurate
I'm
manner.
sorry, when did you say this occurred?
So Thanksgiving Day, I was working.
Of just
while
last year?
everyone- Yes, ma'am.
Okay.
While everyone was working, I was having Thanksgiving. I was working.
And I just wanted to confirm, you're talking about mandated overtime. You mentioned you voluntarily work. Does that mean you're getting paid overtime and you're just volunteering to do the work on the weekends
Correct,
and
but
get paid overtime, or that you're not?
That is correct. But there was
Okay.
a time that we were also mandated as well. I didn't want to put all of that in my testimony, but yes.
Okay.
There was a time.
Well, because what the administration just told me was that they haven't had mandated overtime in quite some time. So do you know
So which
when
agency
the
are we
last time
speaking
was
about?
mandated overtime?
Sure. Mandated overtime ended in January 6th or January
Of this year?
19th of this year. It continues in social services, home care, and probably ended sometime in February for the ESs.
Mandated overtime?
Mandated overtime. I can provide emails if you required proof of
Okay.
that.
We'll follow up.
Absolutely.
Thank you. Okay, thank you all so much for your testimony. We really appreciate you being here. Thank you.
Thank you.
Okay. Okay. And the sergeants will just get your email addresses, okay, so that we can follow up directly. Anna Champany next, from Citizens Budget Commission. Thank you. You can begin when you're ready.
Okay, is this good?
Mm-hmm.
Okay, thank you. Good afternoon, Chair Hudson. I'm Anna Champany, Vice President for Research at the Citizens Budget Commission, a nonpartisan nonprofit think tank and watchdog that advocates for smart fiscal, operational, and policy choices to deliver a better future for all New Yorkers. Our report, False Choice, presents our assessment and recommendations on the fiscal year 27 preliminary budget. We commend Mayor Mamdani for his more accurate and transparent budget that reflects the true cost of current services, but find that the proposed budget risks the city's affordability, competitiveness, and preparedness for what may to come. Rather than raising taxes and raiding reserves, the city should eliminate wasteful spending and improve efficiency so that government can deliver high-quality, essential services that remain affordable over time. To demonstrate what's possible, we present 5 actions that could save $2.6 billion annually, including one that I want to discuss today: keeping the number of housing vouchers flat to restrain unaffordable spending growth without impacting current recipients. Capping City FEP's program would save $330 million in fiscal year 27 and $3 billion over the next 4 years, without taking away vouchers from current recipients. City FEPS is the nation's second largest voucher program, only behind NYCHA's Section 8 program, and it is a radical outlier among locally funded voucher programs. Its cost has tripled in the last 3 years, from $499 million in fiscal year 23 to a projected $1.7 billion this year. The preliminary budget projects spending will increase another 24% to $2.2 billion next year and 44% over the following 3 years. While increasing rents drives some of the cost growth, most of it stems from the growing number of vouchers. In just 1 year, from October 24 to October 25, the number of vouchers grew 31%, an additional 15,046 vouchers, reaching a total of 64,439 households. The average subsidy grew 13.2% over the same period. The preliminary budget adds $9.5 billion for city FEPS on top of the previously budgeted $3.1. The city needs just 2/3 of the $9.5 billion to cover baseline funding for current vouchers. The remaining 1/3 would fund new vouchers, allowing the program to continue growing. We estimate this would lead to 70,000 vouchers at the end of fiscal year 27 and over 100,000 at the end of fiscal year 29. The city cannot voucher its way out of the homelessness crisis. Not only is the program fiscally unsustainable, but even as the number of vouchers has more than tripled, the number of households in shelter has not shrunk. In fact, excluding migrants and asylum seekers, it has increased 21.5%. Now is the time to cap the number of city FEPS vouchers at the current level. No one would lose a voucher, and the city should certainly not be pursuing an unaffordable expansion that would explode costs even further. Turnover would allow the city to issue vouchers to some new households, and priority should be given to those with the greatest need. This smart choice would save $330 million in fiscal year 27 and $3 billion, as I said. City FEPS can and should be part of the city's housing strategy, but the housing crisis can only be solved by leveraging state and federal housing subsidy programs and partnering with the private sector to increase housing production. Expanding city FEPS beyond current levels would compromise the city's ability to deliver core services and potentially jeopardize the viability of the program for current voucher holders. Thank you.
Thank you so much for your testimony. And I do want to acknowledge that Deputy Commissioner Hooks is here, so thank you for staying. Thank you. Okay, I'm going to call up the next panel. Thank you so much. Molly Eckerl. Yasmin Vega, Carlos Rodriguez, Allison Rosenthal, Beth Williams, Rachel Sabella, and Nicole Hunt. We can start with Molly.
Good afternoon, Chair Hudson. Thank you for holding this hearing today. My name is Molly Eckerly, and I'm here on behalf of Met Council to join our fellow anti-hunger advocates in calling on the Council to baseline fund Community Food Connection at $100 million and to continue to invest in the incredibly impactful Feeding Our Communities Council initiative by increasing its commitment to $25 million. For over 50 years, Met Council has been one of America's largest Jewish charities dedicated to fighting poverty, providing wraparound social services that include the nation's largest kosher and halal emergency food network and serving more than 320,000 New Yorkers annually. New York City's emergency food system is at a tipping point. Nearly 1.3 million New Yorkers experienced food insecurity in 2025, exceeding COVID-era highs, and this was before the federal SNAP cuts. These devastating cuts will cause hundreds of thousands of New Yorkers to lose SNAP benefits in the coming months, and SNAP provides 9 meals for every one that a food bank provides for the same cost. When SNAP is cut, the need does not disappear. It shifts onto providers that are already stretched beyond capacity. New York City is also home to the largest Jewish and Muslim populations in the country, and too often these New Yorkers must choose between their religious observance and accessing emergency food. CFC's unique flexibility allows providers to select food that meets their community's specific needs, including kosher and halal, that are not available through other funding streams. Investing in CFC means combating the looming SNAP cuts while advancing equity in New York City's emergency feeding system. Feeding Our Communities has also enabled Met Council and our partners Hispanic Federation and Catholic Charities to connect underserved communities to culturally appropriate food where traditional emergency feeding falls short. We urge the Council to continue and expand Feeding Our Communities to $25 million, ensuring that we can continue this important work. By baselining CFC at $100 million and continuing Feeding Our Communities at $25 million, the Council can support both providers and hungry New Yorkers. Thank you, and we look forward to continuing to work with this committee.
Thank you so much. Perfect timing. Yasmin Vega? No? Okay. Carlos Rodriguez? She's not here.
How about now? There we go. Thank you, Chairwoman Hudson and members of the General Welfare Committee for holding today's hearing on New York City's budget for fiscal year 27. My name is Carlos Rodriguez. I have the privilege of serving as president of City Harvest, New York's first and largest food rescue organization. I want to thank the council first and foremost for its steadfast support of food security initiatives and City Harvest over the years. This year, our plan at City Harvest was to rescue and deliver 86 million pounds of food to millions of New Yorkers. We thank the City Council for its continued support in that effort, including investments in Feeding Our Communities initiative that was established this past year. Because of that investment, we actually project being able to rescue 90 million pounds in this important year by the end of June. As an organization that's been fighting hunger for over 40 years, it's clear to us that this year is not business as usual. City Harvest's network of over 400 pantries across New York City, some of whom are sitting at this table with us, are seeing over 1 million additional pantry visits per month. That's an 87% increase compared to pre-COVID data from 2019. We have already taken significant steps in response to this growth and need. Since 2019, we've increased our food distribution by over 30%, with a focus on high-need neighborhoods with pantry, food supply gaps, and at-risk populations. We started recruiting new pantry partners over the last 18 months. Now we are also rescuing over 6 million pounds of local food from New York State, more than most other organizations in our area. We want to connect New York City neighbors with food from our upstate farms. We have expanded our policy and advocacy efforts so that our neighbors and pantry leaders alike are represented in the halls of government. However, charity alone cannot and should not be expected to replace effective and equity public policy, so we ask for 3 basic things. First, the expansion of CFC and continued funding of it at $100 million to fully fund HRA SNAP enrollment operations and SNAP outreach programming, and so they can support and to make sure that they're actually utilizing it as well, which I know has been an issue in the past, and to restore access to healthy grocer incentive programs in addition to the other funding lines that support our frontline partners and pantries as well. Thank you.
Thank you so much. Allison Rosenthal.
Hi, Chair Hudson and members of the General Welfare Committee. Thank you so much for this opportunity to testify and for your continued commitment to addressing food insecurity in New York City. My name is Allison Rosenthal, and I am the Chief Program Officer and Registered Dietitian at the Westside Campaign Against Hunger. We are an anti-hunger organization that for 47 years has been focused on providing access to healthy, fresh food and direct benefit enrollment to New Yorkers in need. WISCA is one of the founding members of the Roundtable, Allies for Food Access. The Roundtable is a coalition of 9 of the largest and most innovative emergency food providers in New York City and includes organizations like City Meals on Wheels, Holy Apostles Soup Kitchen, Met Council, New York Common Pantry, Part of the Solution, Project Hospitality, St. John's Bread and Life, and the Campaign Against Hunger. Together, our members serve communities in all 5 boroughs and collectively support a network of more than 800 pantries, soup kitchen, and feeding providers that feed more than over 1 million New Yorkers each year. I am speaking today on behalf of WISCA and the Roundtable. As the Council considers priorities for the upcoming fiscal year, we urge you to continue investing in frontline emergency food providers, innovative community-based solutions that address food insecurity at a scale and strengthen the emergency food system that so many New Yorkers rely on. First, we strongly support establishing $100 million as a permanent annual baseline for the Community Food Connection Program. CFC is the backbone of the city's emergency food network, providing flexible funding that allows more than 500 food pantries and soup kitchens to serve neighbors experiencing food insecurity. Second, we encourage the City Council to strengthen collaboration and accountability across the city's food policy infrastructure. We ask for the establishment of a dedicated City Council Committee on Food that would elevate food policy and citywide priority and ensure consistent oversight of programs addressing hunger and food access. Finally, we urge the city to broaden leadership within Feed NYC to include frontline emergency food providers. Earlier today, you asked HRA how they were going to allocate their resources, and the organizations on Feed NYC that advise that do not include any frontline emergency food providers. And we need to make sure that the frontline perspective is also included in how resource allocations get made. Thank you.
Thank you so much. Beth?
Hi, thanks, Chair Hudson. My name is Beth Williams, and I'm the New York State Policy Director for Hunger Free America, a national direct service and advocacy organization. We're headquartered here in Manhattan, and we have an office in the Bronx. I'm here today on behalf of the 1.2 million New Yorkers who are experiencing hunger. As you all know, we've talked about today, we're in a massive crisis in the city that's only going to be made worse by the H.R. 1 bill. We need a massive coordinated response from both the city and the state to deal with this crisis. Right now, 1 in 5 children in New York City are dealing with hunger, and almost half the children in the Bronx are dealing with hunger. The cost of living continues to increase in the city as salaries don't match that. We believe the most impactful way to fight hunger is through increasing participation and keeping folks on the Supplemental Nutrition Assistance Program, SNAP. As we know, with H.R. 1, up to 1/3 of SNAP participants in New York City are going to have their benefits threatened. Just in the month of December in 2025, 1.7 million city residents received $415 million in federal grocery support through SNAP. And so in order to help these folks maintain their benefits, Owen also mentioned this morning, you know, what we were going to do to help folks stay on SNAP. All that was really mentioned was just, you know, screening folks for work requirements at their recertification meetings in the next year, and we believe that more needs to be done for that, along with working with the state. We believe that the final budget deal needs to provide extra money for DSS to work with nonprofit groups to help SNAP recipients meet their work reporting requirements by being both screened for mental and physical disabilities, offering work and paid employment, participating in job training, or performing volunteer service. And we also support the increase in the Civic Impact Fund to fund nonprofit organizations to host SNAP recipients as volunteers to meet their work requirements. Thank you.
Thank you so much for your testimony. Rachel?
Thank you, Chair Hudson. Thank you for hosting this hearing, and thank you to all the council staff members that have worked so hard to make sure all of the thorough questions were asked today. My name is Rachel Sabella, and I have the honor and privilege of serving as the director of No Kid Hungry New York. We're a national organization working to end childhood hunger and poverty. You will have my written testimony with all the data, with all the wonky requirements, but what here today I want to say is how important it is for this council and the Mamdani administration to work together to connect New Yorkers with meals. I want to ditto everything my colleagues at this table said, and I could not be more grateful that these are the organizations on the ground providing New Yorkers with meals as we face one of the most devastating times that we have ever had as a society. H.R. 1 has been mentioned a lot today. That was when on July 3rd, the United States Congress voted to decimate the SNAP program. $200 billion in cuts to benefits, but also cost shifts and new requirements. And that's why it's more important than ever that we listen to what the earlier panel said about the workforce and how they are there for people as we look through this. Right. New Yorkers are struggling. 1 in 4 children face hunger. Our recent poll told us that 3/4 of families in New York City are choosing whether to pay the rent or to pay for food for their families. Parents skipping meals. They are going to grocery stores and buying filler meals. We have to do better. But our immediate needs that we need to make sure the city's budget responds to are the cost-sharing effects of H.R. 1. One is the SNAP administrative costs. As of October 1st, the federal government is expecting states to put in 75% of administrative costs. In the past, it was 50%. That would increase costs in New York City by more than $100 million. Now, I'm sure there's negotiations going on. Could the state put this in? Could the city put it in? We need to make sure that money is there so there is no stopping this program. As families are facing the work requirements, the support is there, the enrollment is there. The last thing I will mention is that as of October 1st, 2027, states could be on the hook for paying partial benefit costs. It's all based on a state's error rate. And that's something we also want to make sure is reflected in this budget. So that's where those staffing lines are so important. Is there technology? Is there training? How is New York City working together with New York State to do this? We stand at the ready to work with this council. We know New Yorkers support these programs. We know how important they are to the economy, and we are here to make sure that we protect the SNAP program. Thank you.
Thank you so much. Nicole?
All right. Hello. Thank you, Chair Hudson, and everyone on the General Welfare Committee staff for being here today. My name is Nicole Hunt. I have the honor to serve as Director of Public Policy and Advocacy at Food Bank for New York City, the city's largest hunger relief organization, serving over 800 community-based organizations across the 5 boroughs and all 51 New York City Council districts. I'm here today because New York City must act in the face of the coming hunger crisis, as changes from the One Big Beautiful Bill Act continue to take effect. This bill will slash $186 billion from SNAP over the next 10 years, putting 408 million meals at risk right here in New York City in that same time frame. As many here know, new ABOD rules take effect this month, and approximately 180,000 New York City SNAP recipients are at risk of losing this critical benefit beginning in June of this year, not because of any change in their circumstances, but because the rules have shifted underneath them. We know many of these New Yorkers will turn to the Food Assistance Network. We will do all we can to close that gap, but our network was never designed to replace federal assistance, and yet that is increasingly what we are being asked to do. Our asks for the city budget, and I'm also going to submit written testimony with all of this written out, but are $100 million in baseline funding for CFC to bolster the Food Assistance Network during this time, support for SNAP outreach programs and administration and the HRA workforce to help preserve benefits for as many New Yorkers as possible, investments in key council food initiatives such as the Food Pantries Initiative, Food Access and Benefits, and Feeding Our Communities to allow flexible and innovative programming, and funding for programs that promote food access and healthy nutrition, such as Get the Good Stuff, Health Bucks, and Groceries to Go. These are not luxuries. They are the backbone of a food security system that millions of New Yorkers depend on and that is currently at risk. Thank you for your time and the opportunity to testify.
Thank you so much. Thank you all for your testimony. Really appreciate you being here. Okay, the next panel is Mun Clifford. Abby Bieberman, Anna Arkin Gallagher, Montel Cherry, and Sharon Small. Chevron? Shervon. Shervon? Shervon, thank you. Okay. We'll start with, is it Mun? Oh, Moon, okay, thank you.
Thank you, Chair Hudson. Make sure I got this right. All right. Good afternoon. My name is Moon Clifford, and I am the attorney in charge of the housing practice at the Legal Aid Society. Thank you, Chair Hudson, and the members of the committee for the opportunity to testify today regarding the budget. We also want to acknowledge that the Commissioner, Ms. Dalton, for her leadership and engagement on the issues of homelessness prevention, housing stability, and the supports families need to remain safely housed. When a tenant is wrongfully evicted, when a mother loses SNAP benefits to skimming fraud, when a survivor of domestic violence cannot safely navigate a divorce, or when an immigrant New Yorker is detained without counsel, the consequences are immediate and devastating. Families lose income, people enter shelter, vulnerable New Yorkers are pushed deeper into crisis. That is why this budget hearing matters. With an annual caseload of nearly 200,000 legal matters, the Legal Aid Society takes on more cases for more clients who cannot afford private counsel than any other service provider in the country. Our work is amplified by volunteer help from law firms, corporate law departments, and expert consultants. Together, we bring a depth and breadth of perspective that is unmatched in the legal profession. Legal Aid's unique value lies in our ability to go beyond any one case to create more equitable outcomes for individuals and broader, more powerful systemic change for society as a whole. For our civil practice, the executive budget and the city council's investments provide crucial funding for legal aid's work, representing tenants facing eviction, helping families access benefits and supports, preventing homelessness, and stabilizing communities. We're grateful for that partnership and for the council's longstanding commitment to preserving and strengthening the promise of the right to counsel. We appreciate the conversation today regarding homelessness prevention. We are encouraged by what the administration and the council have said about addressing homelessness and stabilizing families and communities. We welcome the emphasis on practical tools that can help keep people housed. As we approach the 10th year of the Right to Counsel, it is important to reflect both on how much has been accomplished with the support of the council and what still remains unfinished. Right to Counsel has transformed the landscape of housing court in New York City. It has helped tenants remain in their homes, prevented countless evictions, and made housing court fairer and more just. We're proud to have partnered with the council and the city in helping realize that vision, and we remain committed to working together to fulfill it more completely. However, the program remains not fully funded. I'm going to wrap up. In another critical sense, there is still a significant number of income-eligible tenants who go unrepresented. Even with all that has been accomplished, the city has not yet fully realized the promise that every eligible tenant who needs counsel will receive it. We are grateful for the council's partnership, for the administration's engagement, and for the opportunity to continue to build on what has already been achieved. As we mark nearly 10 years of the Right to Counsel, we should celebrate what the city has made possible, but we should also remain clear-eyed about what is still needed. With continued partnership, adequate investment, stronger data, and a shared commitment to full implementation, New York City can continue leading the nation in protecting tenants and preventing homelessness. Thank you again for the opportunity to testify. I will submit more fully written testimony.
Thank you so much. Abby?
Thank you. Good afternoon, Chair Hudson. My name is Abby Bieberman. I'm Associate Director of the Public Benefits Unit at the New York Legal Assistance Group. I want to highlight a few urgent issues today. First is access to public benefits. NYLAG continues to see clients improperly denied public assistance, SNAP, and emergency rental assistance because of systemic failures, long phone wait times, delays and failure to index documents, and applications that are not processed within the legally required timelines. Clients applying for rent arrears grants routinely wait more than 30 days, pushing them to the brink of eviction. And the DSS-1 number remains nearly impossible to reach. Some clients can't complete critical steps in the application process, or they can't obtain information that they need, crucial information about their public assistance cases. These administrative failures create churn, increase homelessness risk, and ultimately drive up city costs. We also have concerns about the additional burdens that are going to be on the agency as it implements these federal changes. Second is CityFEPS. NYLAG supports the council's expansion of CityFEPS, and we understand the city is facing a deficit, but there is a need for long-term investment, as it would not only get families out of shelters and keep people housed, but it will also save the city money. Even for those who do not qualify for even for those who do qualify for CityFEPS, administrative delays are preventing families, landlords, and caseworkers from resolving routine issues. The city is failing to move people out of shelter because of these delays, and this is for people who already have shopping letters. Expanding staffing, improving communication, and digitizing documents would dramatically shorten shelter stays. We haven't really heard what the city plans to do in terms of concrete plans. Third, I just want to wrap it up with some DHS shelter services. According to the mayor's management report, 43% of families are receiving behavioral health and developmental supports due to staffing shortage and uneven distribution across shelters. Families are also now spending an average of 401 days in DHS family shelters, which is more than a full year of a child's life spent in temporary housing. These delays reflect the systemic barriers to accessing permanent housing and require urgent coordination. Lastly, we urge the continued support for Right to Counsel, legal services, and increased, and all of our initiative asks will be in the written testimony.
Can you just give me that number again, 401 days?
That was what was from the mayor's management report, but yes, 401 days average.
Thank you. Anna?
Hi, good afternoon. My name is Anna Arkin Gallagher. I'm the Associate Director of the Civil Justice Practice at Brooklyn Defender Services. Thank you, Chair Hudson and members of the committee for the opportunity to testify today, and thank you to the New York City Council for its continued support for legal services programs like ours. BDS serves more than 40,000 people each year across our Brooklyn and Queens offices who have historically been unable to access traditional legal services or whose unique issues caused or exacerbated by criminal, family, or deportation proceedings require specialized knowledge to address. With the generous support of the City Council Speakers Initiative, our civil justice practice works to minimize the consequences of system involvement and provides early intervention legal services to ensure our clients keep their jobs, stay in their homes, and acquire essential benefits and services. And it's here that the council funding we rely on truly has an impact, allowing us to intervene quickly by providing upfront legal advocacy to avoid the kinds of protracted litigation that can drastically destabilize the lives of the people we serve. To give you just two examples, we routinely avoid public benefits issues and non-payment proceedings for families whose children are temporarily removed from their care by ensuring rental assistance budgets and housing vouchers remain unaffected by a change in household size, which can avoid non-payment proceedings being filed and the prospect of eviction. We also make sure clients of our criminal defense practice understand their employment rights, work to verify their employers following New York state and city anti-discrimination laws, and affirmatively advocate with employers who have violated these rules. Often our early intervention means a worker is able to get back to work and litigation is entirely unnecessary. Funding through the New York City Council Speakers Initiative allows us the flexibility to provide these types of preventive legal assistance services and ensures more New Yorkers have the chance to avoid the types of legal problems that can irrevocably disrupt their lives. We respectfully request that the Council increase this critical funding so we can continue to provide the proactive, high-quality advocacy that keeps New Yorkers in their homes and their jobs. Thank you for the opportunity to testify today and for your continued support of the people, families, and communities we represent. Our written testimony provides further details on the program initiative and discretionary funding requests we are making to ensure we can continue to do this work.
Thank you so much. Montel?
Good afternoon, Chair Hudson and the Committee on General Welfare, and thank you for the opportunity to testify today. My name is Montel Cherry, and I'm the Deputy Director and Director of Litigation for Mobilization for Justice. Our mission is to achieve justice for all. For over 60 years, Mobilization for Justice has provided free civil legal services to New Yorkers who with low incomes, who are disenfranchised, and who have disabilities. We also conduct community education, advocate for policy reform, and bring impact litigation. Every year we handle more than 10,000 cases from across New York City in the broad areas of housing, disability and aging rights, economic justice, and children's rights. Through our services, we prevent homelessness, help seniors and people with disabilities live independently, help families maintain economic stability, support immigrants and children with mental health disabilities, and address racial disparities. We're speaking here today in the midst of several crises: surging homelessness, skyrocketing cost of living, marginalization of the vulnerable, and a city struggling to meet the needs of its existing residents, let alone those of our newest neighbors who come here seeking safety, stability, and opportunity. And we're tackling these issues in the face of a federal administration openly hostile to the ideals of public service and the public good. The nonprofit community in New York City has faced severe delays in contract payments and hiring obstacles amidst the challenges of pay parity for public service work. It has been a tough couple of years, especially for our clients. I'm respectfully asking you to ensure the following initiatives are fully funded and enhanced: legal services for low-income New Yorkers and working-class New Yorkers, legal services for family advocacy and guardianship, Immigrant Opportunity Initiative, AAPI community support, and community housing preservation strategies. Thank you for your time.
Thank you so much for your testimony. Siobhan?
Good afternoon, Chair Hudson, and members of the committee and staff. Thank you very much for the opportunity to testify today.
Hold on one second. I'm going to start. There you go.
My name is Siobhan Small. I'm the Executive Director of Legal Services NYC, or LISNY, the largest provider of free civil legal services in the country. At its core, our work is about stability. We help people stay in their homes, access benefits, maintain income, and avoid crises that would otherwise push them to the shelter system or deeper poverty. That work is not secondary, it is central to the city's infrastructure. We are part of the New York City's homelessness prevention system and its broader anti-poverty safety net, operating at the intersection of housing, public benefits, and the nonprofit systems that this committee oversees. Today, I want to focus on two structural issues, whether these homelessness prevention programs are funded at their cost, and whether the nonprofit sector delivering them is financially stable. First on cost, New York City made history when it enacted their Access to Counsel law, commonly known as the Right to Counsel program, recognizing that legal representation in the housing court is essential to fairness, stability, and preventing homelessness. But a right only exists if it can actually be exercised. A right without funding is not a right. It is a promise we cannot keep. At present, funding provided through the Right to Counsel contracts only cover a fraction of the need. Each year, more than 120,000 eviction cases are filed in New York City, yet the current contracts fund representation for only a third of those tenants. We estimate that the true cost of delivering high-quality, holistic eviction defense is approximately $7,500 per case. Current contract rates fall significantly below that. What that means in practice is that nonprofit providers are being asked to subsidize a public program. For years, we've done that, using federal funding, state resources, and private philanthropy to close that gap. But that model is becoming increasingly unsustainable. Federal funding through the Legal Services Corporation faces growing uncertainty. State funding streams such as IOLA are subject to spending restrictions and fiscal pressures. Private philanthropic dollars are crucial to our work, but they are not intended to backfill structural funding gaps in government programs. When case rates fail to reflect the true cost of services, providers are forced into impossible choices. We're forced to borrow across the city. Our partners here, I'm just going to skip right through it. My partners here are forced to borrow each and every day to meet our obligations to our staff, to meet payroll, and instead of the money going into our communities, they go directly into the banks. And I do not think that's what the council intended. I believe the council should fully fund this program, continue to pay us on time so that we don't have to borrow and put money into the pockets of the banks. Thank you, Chair.
I don't disagree with you, but I would also argue the administration should fully fund the program.
Absolutely. I really appreciate that. Thank you.
Thank you. Thank you all for your testimony.
Thank you.
Okay, the next panel will be Allison Wilkie, Victoria Leahy, Lauren Schuster, Jade Vasquez, Catherine Trapani, Brendan Cheney, Thank you. Thank you. Allison.
Hi, my name is Allison Wilkie. I'm the Director of Government Affairs and Strategic Campaigns at the Coalition for the Homeless. Thank you for having this hearing and for trying to get through all the detailed information as quickly as possible, but with thoroughness. Really appreciate that. To start, I'll just say simply that the solution to homelessness is easy. It's housing. But the fact of the matter is that for every 100 extremely low-income families in the New York City metro area, there are only 35 apartments that are available and affordable to them. And it is that gap that we are grappling with and that we are grappling with in our city's budget. City FEPS is a really important part of meeting that gap. And there's a lot of talk about how costs have ballooned, the program has grown exponentially, and that is all true, but it is because the program is successful. It's because we are moving people out of shelter with it. In FY25, according to the Mayor's Management Report, there were 21,266 subsidized exits from DHS shelters, and from the testimony of DSS today, they said 15,000 people moved out of DHS shelters because of City FEPS. So that means that City FEPS is about 70% of how people are moving out of shelter into subsidized housing. And we know that that keeps people out of housing. It's an investment that we have to make and continue to make. The council passed laws to expand the program that need to be implemented. I mean, the shelter census is a function of how many people are coming in and how many people are leaving. And if we are not addressing both ends of that spectrum, the shelter census will continue to grow. If we hadn't had city FEPs, then we would have far more than 100,000 people in shelters at this moment. So it's an important program that we need to continue to invest in. Of course, it is not the only program. It's not the only thing we need to be doing. We need to be building deeply affordable housing. We need to use all of the tools that we have, but I think the suggestion earlier that instead of funding more city FEPs, that we should cap it and rely on state and federal resources is a farce. Those state and federal resources are not there. I mean, we are fighting for those all of the time, but really the city is left with a moral choice here of, do we invest in city FEPs to house people and make sure that our people, our residents, have a home, or do we leave people in homelessness? That's a simple choice. The other thing I'll just mention briefly is our unsheltered neighbors and funding for safe havens. The city says continually that there's over 4,000 safe havens. I think most recently in the press they said that there's 4,200. I've never seen the census beyond 3,900, and if you're talking about online units, what's my date here? As of March 13, there were 3,710 online safe haven and stabilization.
Can you give me that number again?
Yeah, 3,710 that were online and available. Not, I shouldn't say available, but being, most of those are being used. So we need to invest more in safe havens. If we're really serious about getting people off the streets, out of public spaces, that is a key part of it. And we're asking the city to add 2,000 more safe haven or stabilization beds. That would be a cost of about $98 million, but that's an investment worth making in the system so that we can help people get off the streets, get into shelter, and ultimately into permanent housing.
Thank you. Can you just tell me the statistic that you gave at the top of your testimony? How many?
Yeah, so it's for every 100 extremely low-income families in the New York City metropolitan area, so that does cover a little bit of New Jersey, there are only 35 available and affordable rental units.
Thank you.
Yep. And that comes from the National Low Income Housing Coalition from the GAP report.
Thank you. Yep. Victoria?
Good afternoon. My name is Victoria Leahy, and I'm the Director of Policy and Planning at Homeless Services United. HSU is a coalition representing over 55 mission-driven homeless service providers. And right now, New York City confronts an unprecedented homelessness crisis. But this year's city budget can change all of that by making sizable investments in solution-oriented programs. First, we must fund the full city FAPS expansion. This program's been critical in preventing evictions and moving New Yorkers from shelter to permanent housing. We know that vouchers break the cycle of homelessness, they reduce the likelihood that somebody's going to return to shelter, and we urge the administration to make the investments needed to move forward with the full expansion. Then we must increase investments in prevention programs and make accessing benefits easier. We know that Homebase is oversubscribed, and this has caused increased wait times for these very critical services, but our Homebase providers at HSU report that they're exceeding their contract deliverables by 113% with months still left in the contract year. So to ease this burden on Homebase providers, we need to right-size their contracts so that they can meet the needs of our neighbors. And as highlighted today, our social service agencies are riddled with staff vacancies, which cause benefit processing to slow down. At a time when the federal government is attacking our neighbors and threatening their benefits, our social service agencies must be staffed and trained accordingly to meet the need. Then we must increase investments in street outreach and low-barrier transitional housing. To successfully move more clients from the streets to housing, we need to expand the housing options available, invest in more single and private rooms, as is often requested by clients. And our outreach teams also need modernized software that aids their data coordination. We have to restore headcounts at DHS, DSS, and MOX to eliminate pervasive payment delays. Nonprofits still experience delays in getting paid for their work. In a recent survey of our members, we found that just 22 orgs were still owed $152 million of contract payments dating all the way back to fiscal year 18, and we know that staffing has contributed to that. And then finally, we must create parity in shelter contracts. This year does make a more accurate projection of spending on shelters, but what remains true is that there's a lack of parity across those budgets, and this imbalance creates significant differences in the level and quality of programming an org can provide to their clients. And we feel that New Yorkers experiencing homelessness should experience the same standard of care regardless of which organization runs their shelter, and establishing parity will do that. So more details and data and facts can be found in our written testimony that we've submitted, and we look forward to working with the City Council to making sure that this year's budget delivers for all of our New Yorkers, including our homeless neighbors. Thank you.
Thank you so much. Lauren?
Oh, thank you, Catherine. I had good morning in my testimony, but good afternoon,
Long
Chair
past
Hudson.
the morning.
It's a long day
Thank
for you
you.
all, and thank you to you and your team for the opportunity to testify today. I'm Lauren Schuster, the Chief External Affairs Officer at Urban Resource Institute. We're the largest provider of DV shelter in the country. On any given night, we house more than nearly 4,000 people across 27 locations. Thank you for your leadership. My detailed testimony will cover a variety of topics, but I want to hit the top notes: procurement reform. URI, like so many of our partners, we are still owed, even with advances, tens of millions of dollars for services already delivered. We have to get to the underlying causes of the payment delays and increase headcount at DSS to help us do that. Workforce investment. Our frontline workers supporting survivors and unhoused families, they are overwhelmingly women of color, and they are doing life-saving work. They're still paid significantly less than their counterparts in the government. We need pay equity for that workforce. Increased DOVE funding. Domestic violence rates, they continue to remain stubbornly high. Black and brown women, particularly in the Bronx and parts of Brooklyn, are disproportionately impacted. DOVE funding needs to be increased and equalized across all districts. We also urge an investment in violence prevention and survivor empowerment. Prevention is the best way to stop somebody from engaging in violence. Youth and community-based violence prevention, work with people who have caused harm. Economic justice, work with survivors and their families. And I want to thank you for your advocacy on behalf of the PALS program at Magnolia Gardens. Pet inclusive shelter isn't just a nice to have, it is life-saving. More than 50% of survivors have said that they cannot seek shelter if they have to leave their pets behind. Funding from the City of New York to make pet inclusive shelter a reality at every shelter is critical to getting people out of danger and into safety and shelter. I also want to underscore what my colleagues have said about fully funding city FEPS. URI is moving into supportive and affordable housing because we recognize that we need to build more supportive and affordable housing. City FEPS is the pipeline to help people move out of shelter and into housing. And we just want to partner with the council on all of this. We know that this is a tough budget year for everyone, and the needs of the marginalized populations that we serve are greater than ever. And we look forward to working with you. Thank you.
Thank you. Can I just ask one quick question? You mentioned an increase in headcount. I don't want to put words in your mouth. I don't know if there's a direct correlation or
I think the
on-time
delayed
payments?
the late payments, the procurement issues are directly related and correlated to decreases.
Directly related?
Yeah, I would say absolutely,
No,
and I'm sure my colleagues would agree. I don't
Okay.
think that's the only reason, but I think that is a main
Yeah.
driver of it.
And if I just add, this
Please.
is something that HSU has worked a lot on, and we find that for DHS specifically, for a budget mod or new needs, it goes through several layers of staffing. You have your programs, you have your budget, it goes to OMB, and whenever there's staffing vacancies in those departments, it forces one worker or a few workers to see all of that, right? And it bottlenecks, which causes long-standing delays. We've had some of our members go months without a single payment from the city. And while the City Council has done wonderful work, right, we've passed several bills in the last few months on future payment schedules, we need to really address the backlog, and doing that means staffing up.
Thank you. Thank you both. Okay.
Thank you.
Jade?
Good afternoon, Chair Hudson and members of the General Welfare Committee. Thank you for the opportunity to testify. My name is Jade Vasquez, Director of Policy and Research at WIN, the city's largest provider of shelter and supportive housing to families with children. We operate 16 shelters and nearly 500 supportive housing units across the 5 boroughs. Every night, nearly 7,000 people call WIN home, including 3,600 children. Today, as our city faces its worst affordability crisis, over 100,000 New Yorkers, including 33,000 children, are living in New York City shelters. As federal cuts threaten vital social safety nets, New York City must lead the nation by expanding, not diminishing, local programs and initiatives that serve struggling New Yorkers experiencing housing insecurity and homelessness. To address this crisis, last fall, WIN published our action plan to end family homelessness, which urges the city to prioritize funding in the following areas. 1, implement city FEPS reform. Council must allocate sufficient funds to begin implementing the 2023 reform package, which would extend rental assistance to low-income households in the community, expand to households earning 50% of the city's area median income, and remove burdensome work requirements. These laws could help up to 92,000 New Yorkers access vouchers and could save the city $630 million on shelter costs alone over the next 5 years. 2, fund Local Law 35 by investing $40 million to place clinical mental health professionals in every family shelter. This is a critical investment in the long-term health and stability of homeless families. 3, support immigrant families by allocating an additional $85 million for immigration legal services. We must also invest in the SHARE program, which provides a pathway to permanent housing for long-term stayers in shelter who are ineligible for other subsidies. 4, expand workforce development by increasing funding for shelter-based programs like WIN's income building program. Shelters need dedicated job developers and youth income building specialists to help residents secure stable employment and educational opportunities. 5, uphold the city's COLA commitment by maintaining the 3% cost of living adjustment for human services workers to ensure a dedicated workforce can afford to live in the city they serve. With federal funding uncertain, the city must step up. We urge you to pass a progressive budget that centers the needs of working people and marginalized communities and provides every New Yorker with a fair shot at financial stability and permanent home. Thank you.
Thank you so much. Catherine?
Thank you so much. I just want to say that we're submitting written testimony with more detail, but the goal of the social safety net should be to prevent homelessness whenever possible. When someone comes into a shelter, it should be a dignified space that's very high quality, and there should always be robust and meaningful access to housing. How we get there with this budget is, one, I always thank you for the questions from you and your colleagues about our Street to Home program. Like, getting unhoused people directly into the housing that they want is critically important, and we're really committed to expanding that. 2, ensure that the shelter options that we're offering folks that can't access a Street to Home unit is dignified. We need to revisit the model budget, and we need to preserve shelter stock that's frankly crumbling. There's a lot of infrastructure needs that the shelter system has, and those model budgets that were created in 2018 really need to be right-sized so that we can ensure that people can live with dignity. The city should also continue to invest in purpose-built shelters, leveraging the DHS contract for a nonprofit-owned model so that we can be better stewards of our real estate and shelter stock. And as we do that, we can close the shelters that we're frankly not that proud of. And we also have to right-size the wages for the human services workers in those shelter facilities so that the quality of care, the stability of the staffing is there to meet the needs of the residents. But perhaps most importantly, we need to expand city FEPS and follow the law. I really was gratified to be joined by so many neighbors and friends, and you, Chair Hudson, talking about the importance of the expansion. There was somebody testifying earlier on a previous panel that said that it was too expensive and that we should be funding core services. City FEPS is a core service. Housing our neighbors is a core service. We have to make sure that nobody is forced into homelessness and needlessly displaced, and so that's really critical. I also want to underline my colleagues' comments about preserving agency headcount so that the HRA, DHS, MOX has the necessary staff to, one, register and pay our contracts. We were owed $40 million at the close of last fiscal year because of delayed payments, but also ensuring—
And are you still owed that $40 million?
The net is a little less with advances, but they're starting to recoup them, so TBD, so almost. But also the headcount necessary, and there was a panel of HRA workers that talked about this, where the demand for benefits goes up and the federal requirements get more onerous. We really need people in those seats at HRA, at APS, at all of these agencies that are really the gatekeepers for our clients that need these critical services. And so I'm wary of proposals I've heard to eliminate headcount. We have to make sure we're not sacrificing core services when we're, understandably looking to save money. So just thank you for your work and for this committee and the staff for everything you've done today.
Thank you so much. Brendan.
Good afternoon. My name is Brendan Cheney. I'm Director of Policy and Operations at the New York Housing Conference. We're an affordable housing policy, nonprofit affordable housing and policy advocacy organization. You have my written testimony, so I'm just going to summarize it in the interest of time. We are concerned about understaffing and bureaucracy at HRA and DHS and how it's affecting housing programs. The understaffing has meant that the agencies do not have the resources they need to effectively run the programs they're running. The way we have been analyzing staffing at HRA and DHS and HPD and our other work is looking at how staffing has changed since before the pandemic to now and looking at actual headcount. So at HRA, for example, in December of 2019, HRA had a actual headcount of 12,528, and then in January now their headcount is 10,866. For DHS, it was 2,257 actual headcount in December of 2019. Now it's 1,621. So big decreases in actual headcount from before the pandemic until now. We saw this at HPD, but HPD recovered their headcount over time in a way that DHS and HRA have not. And this affects their ability to process one-shots, city FAPs, and homeless referrals. And this is at a time when these programs are growing. City FAPs has grown from 3,800 vouchers to 15,000 last year. One-shot program, 52,000 last year. And then moving households into affordable housing in 2009, DHS moved 409 households from shelter into affordable housing under the set-aside program. And last year, they moved 3,700 households. So our recommendations: HRA must sufficiently staff the agency to meet the needs of these various programs and ensure timeliness of their processing, ensure homeless referrals are supported and already approved. We're also concerned about non-payment and evictions in affordable housing, and so we call on HRA to work with HPD to proactively avoid evictions, and we have a recent report that looks at this in more detail. That includes appointing a coordinator for one-shots for proactive strategy, and then finally ending city FEPS inspections.
What was the last bit you said about improving for one-shots?
Appoint a coordinator for one-shots. So what we found is that in order to, and this is in our report that we put out, but in order to get a one-shot, tenants often have to go to housing court before HRA will approve a one-shot. Right. And so if there's coordination with HPD, with HRA, and they're getting one-shots earlier in the process, it saves the city money. It means people aren't going to be evicted and aren't going to housing court.
Thank you. Thank you all for your testimony. Appreciate you being here. Okay, the next panel is Shania Ramsey, Maria Diaz, Reham Bader, Meg Espy, Katie Mui, and Richard Flores. Richard Flores. We can start with Shania. Just press the button on there. Yep.
Good afternoon, Chair Hudson and the other members of the Committee on General Welfare. Thank you for the opportunity to testify today on the preliminary budget. My name is Shania Ramsey. I have been a New Yorker for over 40 years and a mom of 3 children and a special needs mom. I am also a member of the Anthos Home Speakers Bureau, a program helping community members with lived experience of housing insecurities and homelessness to share their stories and advocate for change. I am here today to speak about my housing journey and advocate for housing navigation services for families and changes to the city's FEPS process. I have lived in my apartment for over 14 years. It wasn't the best neighborhood, and there were a lot of uncertainties due to the management, but that was my home. During COVID, the bathroom ceiling began breaking. I called the supers for help, but no one came. When the bathroom ceiling fell in, our apartment was deemed unsafe, and that's when we entered the shelter system. I found myself with $17, 2 garbage bags, and 3 children in front of New York City's Department of Homeless Services. In 9 months, I lived in 3 different shelters. The whole time, I have had a housing voucher and couldn't find an apartment of my own. My genuine tears of frustration were met without sympathy. A caseworker at the shelter told me about Anthos Home. One of the workers explained to me about the program and I didn't believe it. After so many months of being told no, I finally was told yes. I looked for a few apartments with Anthos Home. I fell in love with the second apartment I saw. I didn't believe it. It was real. I signed my lease. I didn't tell my daughter until we were moving into the apartment because there have been so many times that we didn't work out. The support didn't end in moving day. Anthos Home set my family up with essential furniture like beds. We had a safe and comfortable place to sleep from day one. From the first year, housing support specialist checked in with me every month to make sure that I knew my rights as a tenant and I could renew my voucher and my lease on my own. Anthos Home has been the glue filling the gaps between valuable resources from the city, like housing vouchers and homes. Without a program like Anthos Home, I believe I'll still be in a shelter somewhere, really wouldn't have, I would be somewhere I really wouldn't even thought City FEPS is a available resource many families like mine can use. Due to discrimination and bureaucracy, families need additional support to navigate the housing process at Anthos Home program. Model has demonstrated the extra support and advocacy makes all the difference. Thank you very much for the opportunity to speak. I'm sorry for my nervousness.
No, we, take the time and the deep breaths that you need to. We always appreciate hearing from folks who've had direct lived experience. So thank you very much for being here and for testifying.
Thank you.
Maria?
Good afternoon, Chair Hudson and members of the Committee of the General Welfare. Thank you for the opportunity to testify today on the preliminary budget. My name is Maria Ruiz-Diaz, and I am an aftercare specialist at Anthos Home, a nonprofit that helps New Yorkers with housing vouchers move out of shelter and into permanent housing as quickly as possible. We are also a member of the Family Homelessness Coalition, Homeless Services United, and the Homes Can't Wait Coalition. Today, I'd like to speak about how we can move people out of shelter and into homes faster and help them stay housed long-term. In our work, we see both the severity of New York City's homelessness crisis and the impact of targeted housing solutions and process changes. The city has the opportunity and the obligation to better serve its most vulnerable residents, both by reallocating existing funds to more effectively address the crisis and by streamlining the voucher process. WIN's report, More Than a Moral Choice, shows that the cost of housing a family in shelter costs 35% than doing so via City FEPS. At the same time, many eligible households cannot use the voucher due to discrimination, bureaucracy, and competition for units. In 2024, the state comptroller reported that only 21% of households with shopping letters got their voucher approved. Families need—
Sorry, you said 21%?
21%. Families need support to navigate the housing process, as Anthos Home's model shows. We provide housing navigation services and at least 1 year of post-move-in support. Since September 2023, we'd have over 1,100 people move into homes, engage over 600 property providers, and maintain 100% housing stability. By providing targeted funding, the city can move more New Yorkers into permanent housing, engage more property providers, and reduce shelter returns, all while saving money. There are also opportunities for impactful, low-cost voucher process changes, including streamlining the package approval process, simplifying income reporting requirements, and allowing CBOs to perform inspection for all units. Together, these solutions will help more people move out of shelter faster while reducing costs. More details are provided in my written testimony. Thank you for the opportunity to
Thank you. Can you just share this statistic again? 21% with shopping letters receive housing. Was that it?
21% of households with shopping letters got their voucher approved.
Thank you.
No problem. Thank you.
Reham Bader.
Good afternoon. Good afternoon, Chair Hudson and members of the Committee on General Welfare. My name is Reham Bader, and I am the Director of Community Health and Wellbeing at the Arab American Family Support Center, also known as AAFSC. At AAFSC, we help immigrant and refugee families enroll in health insurance to address urgent health and food security needs. Our team includes the only 2 Arabic-speaking certified health navigators in New York State, filling a critical linguistic gap in the healthcare system. As a result, our services are in extremely high demand. In 2025 alone, our team supported 3,320 clients in securing health insurance coverage. Today, I would like to highlight the importance of Managed Care Consumer Assistance Program, or MCAP, and the Access Health NYC initiative. Both programs are critical lifelines for New Yorkers navigating the complexity of the healthcare system, particularly low-income residents, immigrants, people of color, individuals with limited English proficiency, and those living with chronic health conditions. Through MCAP, community-based organizations help residents understand their health coverage options, resolve problems with health plans, appeal insurance denials, access prescription drugs and specialty care, and address cost of care challenges. For many families, this support is the difference between having meaningful access to care and going without the services they need. Access Health NYC is a citywide initiative that funds 37 community-based organizations across all 5 boroughs to provide education, outreach, and direct assistance to New Yorkers seeking health coverage. This work is especially important in the current policy environment. Programs like MCAP and Access Health NYC ensure that New Yorkers are not left to navigate the system alone. By investing in community-based organizations with deep cultural and linguistic ties to the communities that they serve, the city can ensure that all residents are able to access the healthcare coverage and services they need to stay healthy. To continue meeting this growing demand for services, we respectfully request maintaining $2 million in funding for MCAP, increasing funding for Access Health NYC initiative to $4.5 million, $115,355 in Access Health NYC initiative funding for AAFSC, and $144,645 in MCAP initiative for AAFSC. Thank you for your time and your continued commitment to ensuring that all New Yorkers can access health care and the benefits they deserve.
Thank you so much. Meg?
Thank you for the opportunity to testify today. I'm Meg Espy, the Policy and Advocacy Coordinator at Her Justice, a nonprofit organization that has advocated with and for women of gender minorities living in poverty in New York City for more than 30 years. Last year, in 2025, Her Justice served more than 4,000 women and children across all 5 boroughs in family court and Supreme Court, including child and spousal support, custody and visitation, orders of protection, divorce, and immigration matters under the Violence Against Women Act. Legal services not only stabilize family, but enables an access and engagement with critical public benefits. 92% of our clients are women of color, 85% are survivors of domestic violence, 3/4 were born outside the United States, representing 103 countries. Through our pro bono model, Her Justice trains and mentors thousands of volunteer attorneys each year and pairs them with women facing urgent legal needs. This model allows us to leverage the private sector legal expertise to expand access to justice for low-income New Yorkers. Her Justice is grateful for the New York City Council's long-standing partnership in supporting survivors of gender-based violence. Council investments through the initiatives such as SAVE, DOVE, and the Speakers Initiative have enabled Her Justice to provide critical legal services to survivors across New York City. The need for legal representation for survivors, it remains significant. Last year, we worked with 866 family matrimonial matters serving more than 2,000 women and children. Through these cases, clients secured more than $1 million in financial awards and settlements, along with ongoing monthly benefits to help stabilize families. Her Justice serves the urgent needs of immigrant survivors in family and divorce cases and in applications for status under the U.S. immigration system. Given the heightened enforcement, our immigration practice provides critical assistance for survivors whose abusers exploit immigration status as a tool for control. Last year, our immigration attorneys handled more than 2,000 matters, securing legal status for 102 survivors and their children. Her Justice was proud to support the passage of Intro 1175 last year, creating a pilot program to provide divorce representation for survivors of domestic violence. Divorce proceedings are often one of the most complex and financially consequential stages for survivors. Her Justice has deep expertise in litigated divorce representation and provides holistic services so survivors can secure financial independence and remain free from abuse. We urge the Council to continue its investment in civil legal services that are essential in ensuring that survivors can securely access safety, financial stability, and independence. Thank you for the opportunity to testify.
Thank you so much. Katie?
Good afternoon, Chair Hudson. I'm Katie Moy, the Policy and Programs Manager at the Network, a membership organization representing over 200 nonprofits that develop and operate supportive housing across the state. As you know, supportive housing is one of the most effective tools to ending homelessness and strengthening our communities. However, the model faces mounting challenges as ongoing federal uncertainty, rising costs, and workforce challenges place increasing pressure on our providers. We are here today to discuss the need for targeted investments to preserve the state's existing supportive housing stock, advancing the goal of 1,300 units preserved by 2030 in alignment with the NYC 1515 reallocation plan, which the Council is in support of. Now it's time to put that plan into action. We are asking the city to invest $44 million in capital funding and $21.3 million in the expense budget to preserve 325 supportive housing units in fiscal year 27. Our data shows that at least 7,600 units are primed for preservation. All these units are at least 15 years old and use a combination of federal rental assistance and NYSHIP HRA SRO support services funding, putting them at significant risk of closure. The federal cuts to continuing care are imminent, as you know, meaning nonprofits will lose their operating subsidy for thousands of units, destabilizing programs and tenants alike. By investing in preservation now, the city can mitigate this loss. On the services side, the units we've identified are currently operating service contracts through NYSHIP HRA SRO support services. This is the lowest funded service contract in existence. While the network was successful in securing a $17.8 million increase in last year's state budget, this still falls short. Allowing nonprofits to claim NYC 1515 service contracts will address the significant gap in funding, so the providers can adequately serve their tenants. The $44 million in capital funding will preserve at least 325 units that are 15 years old or older to complete necessary renovations, meet energy efficiency standards, and offset rising maintenance and operating costs. If the city does not address the significant preservation needs now, we will have to contend with the reality of programs closing, residences shutting down, and tenants losing their homes. Proactive investment in preservation is crucial to the stability of nonprofits and formerly homeless New Yorkers. We also fully support the continuation of the 3% COLA, the passage of Intro 452 sponsored by Councilmember Stevens, and raising the baseline funding for the peer behavioral workforce to $6 million. Thank you for your time.
Thank you so much. Richard.
Thanks for giving me the opportunity to testify today, along with everyone who's testified, and thank you for your assistance. At the last meeting at City Hall, there was a message that was being sent. How or why did 13 people die as a result of being homeless, either not receiving basic services, emergency shelter, and medical treatment? Were these deaths a case of mismanagement, neglect, or something else? Despite current Mayor Zorhan Mamdani's reporting that more than 1,100 people were placed in shelter or safe havens during the cold snap, more alarming to me is the factors regarding why 1,100 people needed this type of assistance to begin with. Is it economic? Is it social factors? Everything that everyone's testified today about what the organizations need, how much money they need to help people to work effectively as an organization. Seems to me that are the de facto definitions as to why these individuals are in this position to begin with, including myself. Dealing with the Department of Homeless Services, dealing with HRA, and having them actually perform the tasks regarding housing, regarding vouchers, regarding city FEPS, regarding Section 8, to all New Yorkers who qualified for this assistance. Again, I've stated that trying to open a case just for myself in regards to the judicial system in this country regarding how I became homeless to begin with has been mired with corruption, discrimination, fraud. I've dealt with racism, etc. Especially, as I noted to you before, as you know, there is now an investigation with a so-called not-for-profit company called the Bowery Residents Committee. Along with them, municipal agencies, I personally don't feel are running the way that they say they are. I don't have the time here, and also this is not the place to go into a very long explanation as to that, but I'm sure everyone here is aware of what that issue is, and that's the reason why I'm here, because I'm a person who's been homeless for over 10 years, and in that 10 years' time, I've been denied a voucher, I've been denied Section 8 for various reasons. The last company that I worked for was actually a company that gave Mayor Bill de Blasio money that he used to run his campaign, which I find a very serious matter insofar as how that's been handled by the city. So that's the reason why I came here to testify. Lastly, I'd just like to say that I think re-legislation of constitutional law would result in a replacement of old laws with new and revised laws, which would result in better progress regarding housing placement, regarding city FEPS, how they're issued, regarding Section 8 vouchers, et cetera. And I would imagine that's how New Yorkers would have a better way to have their needs met, quite simply. Thank you very much.
Thank you so much. Thank you all for your testimony. Thank you. Okay, my apologies. The next panel, Dana Dennis, Gabina Santa Maria, Nicholas Pearson, Arti Bala, Brian Fritsch, and Jeremiah Gonzalez. We can start with Dana. Just press the button.
Good afternoon, everyone. Thank you, Chair Hudson. I have testimony prepared, and I'm sending it up to you, and I know my 2 minutes has started. But I will say that I come here year after year, and I know this is your first time chairing this committee, but I'm always at General Welfare Committee every year. And I do feel thankful today that you asked a lot of the heads of the agencies to stay, but I'm just interested in how we can get that formally implemented outside of like personal preference, because it's always hard as an advocate, specifically as an organizer, someone who's organized people with lived experience, to stay here and tell their story and how these systems and policies almost disrupt their individual lives versus like protect them in the way that they're supposed to. And I have so many folks here who are just taking time out, unpaid, unlike the rest of us here who may be staff, and consider this work throughout our day. So I'm thankful to the volunteers of Riders Alliance that joined me today, and thankful for you all for hearing us, and to the gentleman that stayed. I forget his name. Yeah. With that being said, my name is Deanna Dennis. I'm the senior organizer of Riders Alliance. We're a grassroots group that fights for better transit. I've been working on the Fair Fares campaign for a decade of my life. When I started, I was not an organizer, and it is something that is very near and dear to me. I'm here today to advocate for the expansion of Fair Fares. I think there's a host of New Yorkers across this city that still do not receive the subsidy, and too many people that don't even know about it. I'm here to also advocate for automatic enrollment for Fair Fares. And as we heard from all these previous agencies that just spoke about staffing concerns, I think it goes right along with that, why we need automatic enrollment. With that being said, I know there's not many of us left in the room, but if you take a good look at me, you may not be able to see, all the things that I identify with, but I am also someone who will label myself as a priced out New Yorker. I'm born and raised in this city, and yet I'm told often that I make too much, right? And I know that I don't make enough. And so, my time is up, but I'm gonna go just very quickly.
Yep.
And so due to that, I ended up having to move to New Jersey a few years ago, still work here. I have no family, no friends there, right? Only because I could not afford my rent, could not afford childcare once I had a child, and had to get a 2-bedroom apartment. Myself and my husband just could not afford this city. And so it's really, painful even to sit in this room and hear these things. I'm from Bed-Stuy, Brooklyn, as many of us know. Bed-Stuy and Crown Heights has experienced so much gentrification. And so I speak to New Yorkers every day, and I'm going quickly, who are at the intersection of affordability around housing, food insecurity, and then most of all, transit, because public transit is how they access most of these systems. And again, these are the reasons why we need Fair Fares to be expanded. And I'll just lastly say that if folks cannot afford to get on public transit, they can't afford their food and all these various costs, then they're also struggling to afford the fines that are put upon them when they can't get into the systems, and all of the barriers and stress that it feels to be under the weight of poverty. I had a lot more to say, but I'm gonna pass it to my colleagues. Can't wait to hear their testimony. Thank you.
Thank you so much. And we do have your written testimony, so thank you. Gabina?
Let me know you hear me.
I can hear you.
Hello, everybody. Thank you for this opportunity. My name is Gavina Santa Maria, and I'm a member of Riders Alliance. Today, I will speak in support of the Fair Fares program. I have Fair Fares, and it's lifeline for me as a rider. A lot of times, I have to pay double because I live in Staten Island, the Forgotten Borough. The Fair Fares, because, and not only me, but so many people, give you a quick example. If I want to get out of the island, I gotta take 2 buses, plus 1 train, and sometimes another bus. So that means it's $6 for 1 ride. There are working people in Staten Island who spend a lot of commuting every day because they cannot afford $7.25 it takes to get an express bus. It should not be difficult for people to have access to affordable public transportation. Is a human right. And we should not have to make a choice between our food every day and our transportation. We should not have to risk a ticket or arrest when we cannot afford the ride. And if we spend, let me give you another example. If you spend a lot of money on those guardians on the doors and security to watch you, if you pay your fare or not, I think we have enough money to spend on Fair Fares. I fight for public transportation, but also for immigrants' rights. ICE have detained a lot of people in Staten Island unfair because there are no eligibility for the program. It's so low, unfair. So many people don't qualify. My Staten Island people, I'm sorry, struggling. They cannot afford it. They're planning to move. We want them here. We need here our neighbors. It is time for the city to invest in making transit more affordable and expand the Fair Fares programs. I don't want to lose my neighbors. I don't want them to leave New York. It's one of the most effective ways. And it's time to Staten Island raise their voices. Staten Island excluded no more. Sí se puede. Thank you.
Thank you so much. Nicholas?
New Yorkers, working people believe in one simple truth. Transit is the way. Transit is New York, and New York is transit. Because the hands that built this city should never be the feet left stranded in it. When we talk about subways, when we talk about buses, we have to think about working families and their commutes. Because too many politicians forget what it really means to get around this city. Too many forget what it means to protect the Fair Fares program and even extend it. Not many politicians truly understand what it means to walk 1 block, 5 blocks, 6 blocks, 7 blocks down the street just to reach a bus stop or a train station, especially in the Bronx. Too many people who make the decisions in this city have never had to live with the consequences of those decisions on the sidewalk. Every delayed train, every long wait at a bus stop, every fare that rises too high is just an inconvenience. Is not just an inconvenience, it is a weight laid on the backs of working New Yorkers, the very people who keep this city standing. We have a goal, and today I am speaking on behalf of the Writers Alliance, because this movement means something to me. The general welfare of the Bronx means a lot to me. A better transit system is better for working families. A better transit system is better for the average Joes and the average Janes. A better transit system is better for the mother counting every dollar and every dime. And yes, a better transit system is better for even the transit workers themselves, the proud members of the Transport Workers Union Local 100, who keep this city moving every single day. Because when fares are reduced, when fares make sense for the dollars and dimes people have in their pockets, the city works better for everyone. This matters, transit matters, working people matter. And the future of New York depends on whether we choose to stand on business for the general welfare, for the people who keep this city alive.
Thank you. Aarti?
Good afternoon. My name is Aarti Bala. I live in Washington Heights. I ride the subway or bus nearly every day, and I'm here today to advocate for the expansion of the Fair Fares program for affordable transportation for all New Yorkers. I moved to New York City nearly 12 years ago. I've had jobs in education, workforce development, and social work. I really believe in contributing to my community, and I love New York City. I've lived in Upper Manhattan, in Brooklyn, and in Queens. When I met my husband, he moved to the city too and began to contribute his own talents. But the city, which has always been expensive, is becoming less and less affordable. The cost of groceries, rent, electricity, childcare, and public transportation are all rising. My husband and I got married last year, and we want to start a family in the city. But between all these rising expenses, we don't know if we can afford to. The expansion of the Fair Fares program could save hundreds of dollars every month for families like us who are being locked out of their own city by the $3 fare that prevents them from paying their bills, getting to school or to a job, accessing city services, receiving health care, and so much more. We need the council to treat transportation and other basic needs such as housing and food as rights, not privileges, or we risk people moving away and losing the contributions and skills of so many people who love this city. We will continue to fight for a New York where everyone can afford to move, live, and thrive. Thank you for listening to riders like me.
Thank you. Brian?
Good afternoon, Chair Hudson.
I'm Brian Fritsch, Associate Director of the Permanent Citizens Advisory Committee to the MTA, PCAC. For nearly 50 years, PCAC has served as the official voice of riders on the MTA system. Wonderful to be up here with so many of my Riders Alliance colleagues today. We've heard a lot today from New Yorkers, delivering a clear call to city government to do everything they can to fight our affordability crisis, a daunting job. But sometimes the right tool to do that work doesn't need to be bought. It's right in your toolbox waiting to be used. The Fair Fares program is that tool, but it's been overlooked. Currently, an estimated 35% of the over 1 million eligible New Yorkers are enrolled in the program, and as a result, it's been chronically underused and underfunded. This means hundreds of thousands of New Yorkers who could be saving up to $910 a year in transit costs are instead getting nothing at all. HRA needs to step up and develop a plan to reduce the hurdles for low-income New Yorkers that they face in getting enrolled. After all, how many residents are already in the HRA Connect system, are known to be eligible based on income verification for another program, yet are not receiving fair fares? Too many. We believe now is the time to pursue automatic enrollment in this program, which could double enrollment and give New Yorkers a much more affordable way to get to jobs, education, appointments, and more. Use the tools you already have in your toolbox. We'd also love to see more data released on existing enrollees, including demographics, locations by council districts, and more. Just over a month ago, we organized a letter from a broad range of unions, transit and disability rights advocates, social and immigrant service organizations, and more, who believe City Hall can make transit affordability a reality in this year's budget by transforming the Fair Fares program. Our 5-point plan includes expanding eligibility to at least 300% of the federal poverty level, to include workers making at or near minimum wage, fully free fares to the lowest income New Yorkers at the current level of 150%, and adding commuter railroads and express buses as options. Let's get people to work with the tools in your bag. Thank you for the opportunity to testify today.
Thank you so much. Jeremiah?
Esteemed members of the City Council, thank you for the opportunity to hear us out today. My name is Jeremiah Gonzalez. Since November 2024, I've been a member of the Fair Fares program, which has been essential to my ability to access job workshops, recruitment opportunities, and other related activities that this city offers. Whether I have to go to Manhattan, or Brooklyn, or just across the Bronx, Fair Fares allows me to stretch my transportation costs without having to wonder if I have to put less onto my car to pay my Con Ed bill. Unfortunately, many do not have the opportunity to use Fair Fares because they are not eligible, even though they would absolutely benefit from this program just like me. With this program, just this year alone, I've saved $81 with 54 trips. Mind you, for an unemployed person like myself, those savings are significant. I don't have any children, but many who would benefit do have children. With childcare costs and inflation higher than pre-COVID, less money is in families' budgets to afford the $6 or more they need to get where they need to go. This is not to mention the increases in rents and Con Ed bills, etc. Saving for those costs will really help the purse strings hold firm a little while longer. Esteemed members of the City Council, riders are facing a general welfare crisis. We do not ask for handouts, we ask for a hand up, that we can contribute to the biggest city in the largest economy in the world is something we should not be begging for. Transportation, childcare, housing, they are not privileges to be handed to the few, they are rights. If we treat them as rights, the Big Apple and its residents and its guests will notice it, and they will love it. On behalf of the Riders Alliance, we ask for this. Because I want to have enough money to pay bills and to contribute to the city. I was born here. I would rather have this city and his people prosper. They cannot do that if at every turn their finances say no. Expanding services like Fair Fares, making transit accessible to everyone, especially those who rely on it every single day, is something that will help the 5 boroughs in the short and the long run. It has helped me immensely. I want to see those benefits given to many, many people. It will help them immensely too. Esteemed members of the City Council, thank you for your time for having us today.
Thank you so much. Thank you all for your testimony. I just want to state for the record, I am in full support of the expansion of the Fair Fares program and really appreciate you all being here today. Thank you. Okay. Sergeants, can we add one more chair? Thank you. Calvin Michael. Anita Kwok. Amy Blumsack. Shanna McCormick. Haley Nolasco. Marcos Reyes. And Michaela Perry. Maybe we don't need the extra chair, I don't know, let's see. Okay, we can start with Calvin. Okay. He's not here. Anita?
Thank you, Chair Hudson, for convening this budget hearing. My name is Anita Kwok, a policy analyst at United Neighborhood Houses, a member organization of settlement houses across New York. Demand for emergency food is higher than ever, with many New Yorkers struggling to meet their basic needs. Federal funding threats and cuts to programs like SNAP are leaving settlement houses without the necessary tools to respond, while placing greater strain on other emergency food programs. The Community Food Connection program plays a vital role in combating food insecurity. One of our members uses it for their pantries and soup kitchens. Another uses it for a new pilot program to provide pantry clients with grocery gift cards. A total investment of $100 million is needed to sustain and grow the Community Food Connection program at this time of deep need, which will allow providers to allocate resources for the growing needs of food insecure New Yorkers. Additionally, in fiscal year 27, the city should invest $13 million in New York City Services Civic Impact Fund, which funds nonprofits to expand their volunteer infrastructure, which in turn will help those newly subject to federal SNAP work or volunteer requirements. Investing in the Civic Impact Fund program presents an opportunity for SNAP recipients who are able to continue receiving SNAP benefits by meeting their work requirements through volunteering at organizations across the city. A $13 million investment is needed to expand this Civic Impact Fund program to include more community-based organizations and larger grant sizes, allowing CBOs and settlement houses to expand or fund their volunteer programs. UNH also does a lot of work in the SNAP skimming space. Our settlement house members have increasingly raised concerns that this is persistently occurring in communities, especially for older adults and those who rely on EBT card benefits to feed their families. We urge the City Council to support our state budget advocacy this month to secure EBT chip cards and a SNAP skimming victims compensation fund in the final FY26 to FY27 state budget, and to support Councilmember Zhuang's Intro 512 to help track skimming cases. Thank you for your time.
Thank you so much. Amy?
Thank you, Chair Hudson, members of the committee, and staff. We really appreciate your time and attention. My name is Amy Blumsack. I'm the Director of Organizing and Policy at Neighbors Together. We are a small community-based org in central Brooklyn. We have 3 programs. We have a soup kitchen, we have direct services, and we have organizing and policy led by our members, 80% of whom are homeless, have experienced homelessness, or have vouchers. CityFEPS is a critical tool for addressing the homelessness crisis. At Neighbors Together, we know firsthand from our members' experience that vouchers are a life-saving tool, and we need the full implementation of the CityFEPS expansion laws. Homelessness, yes. Homelessness and the use of CityFEPS have increased because the need for affordable rent is increasing. CityFEPS is working, it's getting people housed, it's keeping people housed, but as rent continues to rise, more and more people are going to need it, particularly as only a portion of our units are rent stabilized. So I think it's really important to say that expanding CityFEPS in the community will not only keep families in their home, but it will also preserve affordable housing. right? If those families become homeless, enter the shelter system, cycle through the shelter system, and then if they're lucky, get a voucher, they're gonna use that voucher to rent an apartment that costs way more money than the affordable units that they're in now. In addition to the full implementation of the CityFEP's expansion laws, it's really critically important that we address and fix the administrative barriers in the CityFEP's program. We need to increase the staffing at DHS and HRA. We should also expand the number of community-based organizations that can submit CityFEP's applications in order to help alleviate the delays that our members experience at home base. Thank you for asking about source of income discrimination. We also need to have DHS and HRA coordinate with CCHR on source of income discrimination. It's a massive barrier to people with vouchers finding housing. And last but not least, we need to build housing that is targeted to the people who need it most, which is extremely low income and homeless New Yorkers. The most of the units built in the last few administrations have been called affordable housing, but they haven't been at the AMI levels for people who are in the shelter or who are falling into homelessness. So we need the city to make a commitment there as well. And yeah, if a dam has multiple holes, you can't plug just one hole. We have to address holistically the crisis of homelessness in the city. And we give more details in our written testimony, which we'll be submitting soon. Thank you very much.
Thank you so much. Shanna?
Hi, good afternoon, Chair Hudson and members of the General Welfare Committee. Thank you for convening this. My name is Shana McCormick, and I'm here on behalf of Rethink Food, a chef-led nonprofit that has spent the past 6 years ensuring quality meals make it to those in most need. We believe that every New Yorker, regardless of their circumstance, deserves a meal that nourishes them, not just nutritionally, but also culturally. For the over 100,000 plus of our neighbors living in public shelters, food is more than sustenance. It is dignity. It is belonging. It is a signal that this city sees them. Right now, that signal is too often missing. At Rethink Food, we've built a model that works. We partner with small, independent restaurants and food businesses across the city, many of them women and minority-owned, to prepare and deliver meals that are fresh, chef-crafted, and reflective of the communities being served. We've delivered over 35 million meals through this model, and we've kept some small businesses alive through the hardest seasons the city has faced. And as we're discussing budgeting, we've done it at a cost that is competitive, sustainable, and proven. New York City does not need to invent a new solution. The solution exists. It's operating right now in the kitchens and the communities of this city. What we're asking for is simple: to just ensure nonprofits like ours and others have opportunities to do what we do best. And for us, that's creating quality meals at scale. When public dollars flow through mission-driven organizations, they don't disappear, they recirculate. They fuel more meals, more partnerships, and more impact. The diverse, inventive, resilient fabric of this city is one of our greatest assets. Let's use it. And separately, on a personal note, navigators within the on the housing note, navigators to help successfully place people with vouchers is needed. We have to give them the assistance and help that they need to successfully get placed. Many of them are in critical positions and need that extra hand, so thank you.
Thank you so much. Haley?
Good afternoon, Chair Hudson. My name is Haley Nolasco, Senior Director of Government Relations at the Center for Justice Innovation. Thank you so much for the opportunity to testify today. As New York City confronts fiscal challenges, we must continue to invest strategically, prioritizing prevention alongside crisis response. Too often, systems engage New Yorkers only after challenges already have escalated. So when individuals are food insecure, when they're facing eviction, entering the justice system, or experiencing homelessness. This highlights the need for earlier community-based interventions. We thank the Council for its support and humbly request sustained investment in community-based solutions that stabilize our most vulnerable New Yorkers before crises really deepen. Just some of our programs, our community justice centers, just as those in Harlem, Midtown, and Red Hook, provide holistic support connecting New Yorkers to social services and housing assistance, mental health care, workforce development, and legal services. In Harlem, the Housing Help Center works directly with tenants to prevent eviction and maintain stable housing, having 3,000 visits in just 2025, helping navigate housing court, access rental assistance, and address unsafe living conditions. In Midtown, our Community First program reaches people experiencing street homelessness through street outreach and mobile case management, building trust and connecting individuals to care early. Our Community Justice Connect program, which is in Crown Heights, Jamaica, and South Bronx, trains volunteers to help neighbors navigate housing and public benefits issues, preventing legal problems from escalating. And finally, our Strong Starts Court initiative supports young children and families in family court by integrating early childhood expertise to improve long-term outcomes. Across these efforts, the goal is clear. Continued investments in community-based services help navigate tough systems, offer timely intervention early, and stabilize families. Thank you so much for your time and your partnership. Additional data has been submitted in my written testimony. Thank you.
Thank you so much. Marcos?
Hello, everyone. Thank you, Chair Hudson, for having me today, for having me testify today. My name is Marcos Reyes, and I'm a CBC youth advocate, and it is a great honor to be given this opportunity to give this speech. On September 13th, 2023, I lost my home in a brutal apartment fire that almost cost me and my family our lives. And we escaped, but we couldn't escape hardship. And without house vouchers and EBT to help ease our tragedy, I would not be here today. With the looming anxiety and uncertainty of SNAP benefits and the ongoing federal budget cuts with SNAP, it has thrown my family into panic. No parent should have to be forced to choose cheaper alternatives and nutrient-deficient foods. No child should have to eat foods that would not nurture them or empower them. As a brother of two little girls, I feel a clear duty to speak because their well-being and future are at risk with these cuts. I have to look into their eyes and watch their growth and potential be jeopardized by circumstances beyond their control. And I explain to them why the fresh foods they have come to enjoy are replaced with what we can afford, not what they need. I can skip meals so my sisters can eat well. I can handle hunger, but it shouldn't be that way. No one should have to choose to starve themselves. And as a youth advocate, having to worry about the next meal, the next sacrifice, dwindles my ability to advocate. We all know that healthy food supports strong minds. I ask that the elected officials here in New York City support the programs that help families like mine. In particular, we urge you to invest in Community Food Connection Program, invest in programs to address hunger in older adults, and in city council initiatives, we help people access food benefits. We urge you to invest in expanding city FEPs and housing voucher programs. And we urge you to invest in fair fares so all New Yorkers can access public transit. These programs are all life-saving and help New York families thrive. You can see more in our written testimony. When SNAP and other public benefits are cut, it cuts a lifeline for hundreds, thousands of families that keep food on the table. I implore legislators to invest in children's health, to invest in their future. A child's potential should never be limited by their parents' income. Thank you.
I couldn't agree more. Thank you so much for being here and for your testimony. Michaela?
Good afternoon. My name is Michaela Perry, Advocacy Manager at Equity Advocates, and we convened the New York City Food Policy Alliance, a network of 60 food and farm groups fighting for a healthy and equitable food system. Some of our partners are sitting at this table right now. Last year's passage of the federal H.R. 1 bill unleashed the largest cuts to food assistance in our nation's history. Under H.R. 1, roughly 180,000 New York City households are projected to lose their SNAP benefits, half of whose members are children and senior citizens. Estimates suggest that 70,000 residents in our city will be pushed below the poverty line every single year starting in 2028. As the federal government retreats, the city must step forward. First, we ask the council to increase baseline funding for the Community Food Connection Program to $100 million. With an 83% rise in emergency food visits since 2019, our pantries need support. This investment would better address rising food prices and provide critical support for vulnerable communities. Second, we request the council increase Health Bucks funding to $700,000 to provide an increased allocation to community and faith-based organizations. Community health bucks are independent from SNAP, making them a vital resource for individuals ineligible for public benefits, including non-citizen households and folks newly required to meet federal work requirements. Finally, we ask the council to scale the Groceries to Go program above the previously allocated $10 million. Groceries to Go is a proven lifeline for New York City care members with an incredible redemption rate. For every $100 in credits the city puts into the accounts of New Yorkers, $99 is actually being spent on groceries, which bolsters our city's economy. In a city this well-resourced, hunger is a policy choice. We ask the council to pass a budget that chooses dignity for every New Yorker, and thank you for your leadership.
Thank you so much. Thank you all for your testimony. The next panel is Elizabeth McKay and Judith Douglas. Thank you, Elizabeth.
I don't know what's on. Yeah, they saved the best for last. So we're the last two. So thank you for allowing us to be here today on March 17, 2026. And I'm glad to be alive because 3 weeks ago I was hospitalized due to them finding blood clots severely in my chest and my lungs. So here I am, was fighting for justice for others and wound up in a hospital fighting for my own life. But praise the Lord that I am here to testify and just came back from Albany and continue fighting the good fight. So and congratulations for being the chair speaker.
Thank you.
And I wish everyone else stayed, but thank you for the Deputy Commissioner Hooks for being here today. So I'm gonna read a little quote, and it says, even though things look hopeless now, Jesus is not done. There will be life, ownership, and promise again in this land. I'm very spiritual, and I believe that things happen for a reason. 29 years ago, I used to work for the city under Administration and Children's Services and foster care. And I also taught for 7 years in the private sector as a teacher. 2023, I found myself being homeless. Never could imagine being in that predicament. But I think that's when God showed me what I need to do. 2019, I died on a train. And that's what brought me to become homeless. And man said I have 95% brain damage. Came back, couldn't see, couldn't talk, couldn't even move my left side. But here I am, fighting for what is right. I have a City Feds voucher, which I thank God for. But there's some issues that I listened to the staff of DHS HRA that was here to testify. The city is backed in arrears. We talk about landlords, deadbeats, some lords, but HRA has their own issues. HRA owes landlords millions of dollars of back rent. And here I am. They owe my landlord close to $9,000. Next month, I have to go to court. But I know that the God I serve, justice will be served. HRA, who funds city FEPS, need to pay their share of fare. It's supposed to be 70%. How every other month they pay the landlord, but for 5 months they got backed up. 5 months I get a rent ledger. So as I'm not knowing that I'm becoming sick back and forth to HRA, because now I have to stop doing my advocacy because I have to advocate for myself. they have to do better. So many people is in that city FEP's office demanding, even the landlords, demanding, where's the money at? So we look at homelessness, look at a voucher that they say, which it does help people like myself, but why they're not paying the landlord? So the landlord looking to evict us, to become right back in a shelter system where it's a revolving door. Now they said it costs about close to $4,600 for one person, an individual, to be in a shelter, but that's not true. It went up close to $6,000, right? The shelter that I was in, $11.2 million that they was providing 200 women to be in the shelter, the city shelter. Is it right? No. We become collateral for all these systems. These systematic systems that keep us bounded, keep us chained, home base. I've been trying to get emergency transfer. They treat me like if I'm still in a shelter. The IL report, I have to do that. Why? I'm not in a shelter no more. It takes so long to get help, to get assistance. But then the panel was here, and they make it seem like everything is good as what they want y'all to see. But we here, and they need to be here, to hear all the things that we go through with their systems. So I do hope and pray that Commissioner Hooks will go back and tell their people what we go through. I really hope and pray that H.R. 8 pays my landlord his back rent, because I forbid to go back to the shelter system, because y'all don't know what I went through. I'm out here fighting for expansions, for this, for that. While the city, the most expensive city of rent going up, but also the most city that I was born and raised in.
We'll make sure that we get your contact information so we can follow up with you directly to see about your particular case. And also, I'll say that this is exactly why we encourage people, particularly those with lived experiences in all of these systems, to come and testify, because it is important to hear directly from folks with direct experience. And also, many times, it is, the testimony that we hear from you is in direct contradiction to what the administration is sharing. So again, though, I do want to thank Deputy Commissioner Hooks for being here and listening intently. And so thank you. Thank you for your testimony.
Thank you for having me.
Judith, just press the button, please, at the bottom.
Hi, good afternoon. My name is Judith Douglas. I am a tenant. I'm also a member of the HOPE, Housing Organizing for People Empowerment, and part of East New York Community Land Trust, which is helping the community to maintain their property without anyone coming in to steal it from them. So I'm glad to be a part of those. I'm learning to know my rights as a HOPE organizer. So I'm here because I have seen so many programs that are here to help the community is kind of failing them. And I say that because when I hear some of the speakers talk about the organization, the agencies, and I'm like, wait a second, maybe that's a new, maybe I'm not aware of it. But particularly HRA, there's so many issues with the HRA system, they need to revamp it. The recertification process, so many people losing their vouchers because they don't have no one to help. We basically, when you call HRA, the number that they give you, you will be on that phone for 7 hours until the phone drop, shift finish. I've tried that so many times. I've helped so many people go through the process. It's a tedious process. It doesn't work. You wonder if somebody works in that agency, nobody picks up. Even the number they give you for the disability is worse. I've been through all of them. It doesn't work. So I can speak from my own experience. So when I hear people talking about their experience, I know exactly what they're going through because I've been down that road before. Help people and knowing the struggles that they have. Imagine those seniors who are not tech savvy, can't be on the phone, don't have the patience to hold on. They're the ones who are suffering. So another thing, when you HRA, when you do the recertification through them on the computer, they give you a time in which they will call you back. You will wait on that time, nobody calls. When that time passes, you will try to call them before the time passes. Nobody will pick up. You will leave a message to call, nobody will respond. But they will discontinue until you have to start all over again because you missed the appointment. You didn't call me. I put in my application. You're supposed to call me back and tell me, go through my paperwork. You never did that. All of a sudden, I have to go through the whole process again. The entire process. Take about an hour. It's about 8 or 9 pages you got to go through individually. It's real painful when you have to do that. Imagine the senior, how they feel to do that because they can't do it. And when they go down to the office, they tell them to sit at the computer and they stay all day, nothing gets done. They're not helpful. So that system has to be more friendly, client friendly, because right now it's not. When tenants get a voucher and they're ready to move out and they put in their money, they put in the application to get the one-shot deal, 1 month's rent, all those things, the landlord's tired of waiting. They're so tired of waiting, somebody say, I don't want the client anymore. I don't want to be bothered with anymore. Give me somebody else. They will go and take the cash. The process is too lengthy. They have to work on it. I was speaking to the guy from HRA. I was telling him the same thing. We are failing the client. It makes sense we have a system in place, and we're failing them because it's not working. How are you going to take 3 months to do to cut a check for somebody? You're saying you give a voucher, then speed up the process. It cannot be 2 and 3 months. Landlords don't have time, they have bills.
Right.
And they don't want to work with the city. A lot of the feedback, I don't want to work with the city. They prefer to go and take the cash.
Yeah.
Because the young lady was saying they have back rent. They're not paying.
Thank you.
DHS shelter. We have too many clients in DHS shelter that needs to get out. Too many clients that need to get out. Point blank. People have a voucher. Why do you dare the voucher expire? The worker's not renewing it. They don't even give you paperwork to say, oh, go and get yourself, here's a list of apartments. Go and start looking for it. There's a case manager. There's a housing specialist. What are they doing? What are they doing? I would rather pay the executive director $6,000 a month to keep a mother and a child there. And you have case manager there working, they can't even move those clients out. Clients are there for 5 years. The last time I was working there, it's like a client there for over a year, and all she wanted was to do. The city closed in on her apartment building because the landlord wasn't fixing it, so to make it unlivable. So she ended up in the shelter. Guess what she was waiting on? A transfer voucher from Niger. Just a transfer voucher, and she'd been there for a whole year. That's ridiculous. We have to hold these agencies more accountable because they're not. All they're doing is taking whoever's paying them, DSS or HRA, every month. We don't need to keep the clients there that long in a shelter system. To do what?
I agree, and that's why we appreciate your testimony.
I used to work in shelter.
Thank you. We appreciate your testimony because it helps color what we've been saying and gives us a clear understanding of the lived experiences of people who are going through these systems.
Yeah.
So thank you. And you can submit written testimony.
Yeah, the shelter is not a home, so you don't need the clients to be there that long. It's not. It's just a temporary something. It's a money making. Yeah.
Yes, thank you both.
Okay.
We appreciate your time. Thank you for being here. We will now move to virtual testimony. Please wait for your name to be called to testify, and please select unmute when prompted. Jason Chanchaudo.
You may begin.
I think Jason needs to be unmuted.
There we go.
There it is. Okay.
Hello, Chair Hudson. It's nice to see you again. Thanks to you and members of the General Welfare Committee for the opportunity to testify. I'm Jason Sanciato. My pronouns are he, him, his, and I'm the Vice President of Public Policy and External Affairs at GMHC, founded in 1982 as the world's first HIV and AIDS services organization. In 2025, GMHC served over 7,600 clients who lived throughout all 5 boroughs of NYC and who represented NYC's poorest and most vulnerable residents. In 2025, GMHC provided supportive housing services to 424 unique clients with histories of chronic homelessness through our connections with HUD and the Housing Opportunities for People with AIDS program. I'm here to update you on 2 issues of import to this committee and the communities we serve. First, an issue for which the Council does not have direct control, but is important for you and HASA to be aware of. Over the past few years, we have been supporting clients in distress after receiving a letter from HASA indicating that they will lose their HASA housing subsidy in 30 days because of an increase in their income from a Social Security cost of living adjustment, or COLA. For example, one client, a 72-year-old Hispanic man, was $1 over the HASA ceiling of $376. Another received an SSI COLA that caused his income to be $16.26 above the ceiling. GMHC supports the submission of an appeal for these clients, which is almost always denied. And while the appeals process is happening, these clients face having to pay back the subsidy they receive if the ruling is not in their favor. As a member of the statewide and in the epidemic coalition, GMHC supports a solution to this issue that is incorporated into the HIV Housing for New York plan, which would extend the 30% rent cap that has supported New York City residents to people living with HIV statewide. This plan includes an increase in the income ceiling to 200% of federal poverty level. This is the solution preferred by OTDA. HIV Housing for New York is included in the State Assembly's One House bill.
Thank you for your testimony. Time has expired.
Actively support its inclusion in the final FY27 state budget. I'm sorry, was my time up?
It's up, but you can wrap up if you're towards the end.
All right, last is that, we support the committee's concerns that the impact of HR1 will have, particularly on SNAP benefits. In 2025, we served 1,340 clients, over 26,170 congregate, and 24,840 pantry bag meals. And when SNAP benefits were halted briefly in December, we saw an increase in demand of 10%. So I just want to thank you all for your support, for helping to feed and house our clients and people living with HIV and AIDS.
Thank you so much, and sorry for butchering your name there.
Don't worry about it.
Annie Minguez.
You may begin.
Good afternoon, everyone. I am Angel Donahue. I am actually testifying on behalf of Annie Minguez with Good Shepherd Services. I want to thank you, Chair Hudson, and the Committee on General Welfare for the opportunity to testify today. I am a runaway homeless youth coordinator at Good Shepherd Services at Chelsea Foyer program. We're a transitional living program for youth experiencing homelessness. Good Shepherd Services continues to advocate to expand City FEP's eligibility for runaway and homeless youth transitioning out of foster care or youth transitioning out of foster care by counting their time spent in the Department of Youth and Community Development, also known as DYCD, and the Administration of Children's Services, also known as ACS, towards the 90-day shelter requirement. In 2021, we joined in celebrating that the council passed 2 pieces of legislation to expand the eligibility criteria for the CFEP's rental assistance program to include runaway and homeless youth and young people aging out of foster care. Everyday youth are aging out of the DYCD RHY system and into the adult shelter system. Today, as you know, I was accompanied by LaJoy Clark to City Hall. LaJoy is a resident of the foyer and spoke in support of the expansion of CityFEP's vouchers for youth. LaJoy has been living in a DYCD RHY program, ours, for 2 years with no access to a voucher. She did not qualify for these Section 8 voucher due to an administrative error at the Section 8 level. LaJoy stated today that it is unfair, and I'm quoting her, it is unfair that young people don't receive CityFEP's vouchers as much as adults. She expressed that this is mentally draining. LaJoy is turning 21 on April 1st. No, she's turning 21 soon, but she's going to age out of this program, unfortunately, on April 1st, and she's going to have to move into an adult
Thank you for your testimony. Time has expired.
We're winding it up right now, Chair.
No problem.
We urge the council to ensure youth in need of these vouchers can access them without any further delay, as we are lightening the population of DHS shelters, adult shelters, just by being in existence as a DYCD provider agency. Thank you so much for this opportunity to testify.
Thank you so much. Thank you for being here and for your testimony. Okay, thank you to everyone who has testified. If there's anyone present in the room or on Zoom that has not had the opportunity to testify, please raise your hand. Seeing no one else, I would like to note that written testimony, which will be reviewed in full by committee staff, may be submitted to the record up to 72 hours after the close of this hearing by emailing it to testimony@council.nyc.gov. We very much appreciate everyone's time and patience today. The testimony provided is incredibly important to the work that we do advocating to ensure we have all of the full funding and resources needed to address all of these issues pertaining to Department of Social Services. So thank you again to everybody, including the staff. This hearing is now adjourned.